Very good morning to all. You are connected to the 59th Directing Council of the Pan American Health Organization. This is day 3. And our president is the Minister of Health of Jamaica, Minister Tofton. Mr. President, I am very glad to indicate that we do have quorum to start the meeting. Please go ahead.
So good morning, all. Thank you very much. This is our third day of the 59th Directing Council. Let me welcome all of you, delegates, participants. We had 2 good days, I think, made some progress, and I think our region will be better off for it. And we will continue today to advance very critical matters around public health in the region. We begin with item 4.2. And 4.2 is scale of assessed contributions 2022, 2023. And I would like to bring document CD 59-5 to the attention of the council. I invite the representatives of the executive committee to report on the said item.
Buenos días, señor presidente, delegados.
Good morning, Mr. President. Regarding 4.2, the executive committee was informed that the PAHO scale of assessed contributions for 2022-2023 will be based on the scale adopted by the OAS General Assembly in October 2018, which covers the period from 2019 to 2023. As the OAS scale will apply different percentage calculations for 2022 and 2023, the PAHO scale will also differ in the 2 years of the biennium. The changes in the percentage calculation will entail an increase for all OAS member states except for the United States of America. In the committee's discussion, it was pointed out that it was not in the organization's best interest to be heavily dependent on a single donor, and that equitable sharing of quota contributions among member states would encourage financial sustainability. The Executive Committee adopted Resolution CE 168.R5, recommending that the Directing Council approve the scale of assessed contributions for 2022-2023 as set out in document CE 168/9. Thank you. Mr. President, this concludes my report on this item.
Thank you very much. I open the floor now to the plenary for discussion and invite delegates to raise their hand on the electronic platform, and of course, ask our moderator to coordinate. Thank you.
Thank you very much, Mr. President. We will now proceed to take note of the request for the floor to discuss this agenda item. We note the delegation of Chile has requested the floor.
Muchas gracias, señor presidente.
Thank you very much, Mr. President. The delegation of Chile would like to express thanks for the presentation of this report and would say that it cannot go along with this resolution for the scale of contributions. We do support the idea that PAHO has a budget, but in 2018, there was an original increase that was adopted under very different conditions from that which we just heard in the current context of the economic slowdown and budgetary restraints for all of the countries of the region, it obliges us to make a call to member states and PAHO to facilitate the complement of contributions based on the idea of, well, those countries with co-responsibility that believe in this system have historically contributed to the organization based on fiscal responsibility, and we would call for the current scale of contributions be kept. Thank you.
We thank the delegation of Chile for that intervention. And I do not see any additional requests for the floor at this time. Mr. President, go back to you.
At this point, I will recognize Mr. Ronnie Mazza, Director of the Department of Planning, Budget and Evaluation, for his comments.
Thank you, Mr. President, and good morning to all. I will switch to Spanish.
Getting feedback in my,
Can you hear me now?
go ahead.
Yes.
Thank you again, Mr. President, and good morning to all. Allow me to switch to Spanish, considering the request, the question from Chile. Entendiendo la situación que se enfrenta la región y los
Now, I
países,
understand the situation that countries of the region are facing. The Secretariat has taken that into account. Still, I must clarify that the organization does not have within its power to not apply this resolution. Member states had already agreed to it and approved at the OAS General Assembly. As the document itself explains, the Secretariat just wanted to seeks to apply the prior scale of assessed contributions to this period. Now, what is within the power of the Secretariat and what our director has done is taking into account the situation and the financial straits the countries of the region are in, is to not ask for an increase in the scale of assessed contributions based on solidarity and equity for all member states, but to ensure that we have the necessary funds, as has been said in prior discussions, for us to keep up the quality and sustainability of the technical assistance we offer. Thank you.
Okay, thank you very much for that. And Madam Director, for your comments.
Thank you, Mr. President, and good morning to everyone. I merely want to highlight what Ronnie has said. Our rules demand that we apply the same scale as the OAS, and member states at the OAS agreed to this scale. And so we have no other option but to apply the scale to PAHO contributions. We recognize that countries have difficulties, we too. At this time, member states are also asking for increased technical cooperation. And I really want to reiterate that we rely on member states to make good on their quota contributions so the organization can continue to deliver at the standard and quality that you demand. We have not had an increase demand. We've never asked for a quota increase in the assessed contributions for 10 years. Next year will be 10 years, and we have not yet asked for it. And so this is how we are taking into consideration that many of you will have to make good for the decrease in the quota payments of the United States. And this was agreed in the OAS. Thank you so much for your consideration.
Thank you very much, Madam Director. At this point, I'd ask our rapporteur to submit the proposed resolution. There is a hand up. Can I ask our moderator to return to coordinating and recognize the person? I'm sorry about that, our rapporteur. Hand is down. It's up, yeah.
Sure. Thank you very much, Mr. President. We see an additional request for the floor from the delegation of Chile. Chile, go ahead.
Muchas gracias, señor presidente. Y a la
Thank you, Mr. President and Madam Director.
por la aclaración.
For
Solamente,
those clarifications, I would just
agradecer nuevamente la aclaración. Nos sumamos
thank you again for that clarification. We can join the consensus.
nuevamente manifestar que
And I would just say again that our intention is to try to ensure the prioritization of facilitating the payment of assessed contributions rather than seeking an increase. Thank you.
Okay, thank you very much for that. So can we return now to our rapporteur?
Gracias, señor presidente.
Mr. President,
Procedo a la lectura.
I will now read
Proyecto de resolución,
proposed resolution,
contribuciones
scale
señaladas
of assessed
por los Estados miembros,
contributions
los Estados participantes y los
for
miembros
member states,
asociados
participant
a la
states
Organización Panamericana de la Salud para el 2022,
for 2022-2023,
59,
the 59th Directing Council, BP1, whereas in resolution CD 59.R, the Directing Council approved the program budget of the Pan American Health Organization 2022-2023, official document 363.
Señor presidente, hago una pausa acá para
I would just pause here to clarify
vacío
that there's a
en la
blank space
en el documento será llenado después de que sea analizado el punto
in the
5
document that will be filled out after the next item is taken up
del programa de trabajo de hoy día. Que se
and on today's order of business, which is 4.2. I will proceed with reading the document.
PP2,
BP2,
considerando que en el artículo 60
having
del Código Censario Panamericano
having examined that the report of the Pan American Sanitary Bureau on scale of assessed contributions,
Panamericana de la Salud se dispone
bearing in mind that provisions of Article 60 of the Pan American Sanitary Code, which establishes that the assessed contributions of the Pan American Health Organization shall be apportioned among the signatory governments on the same basis
cuotas aprobadas por
as the contribution of organized American states.
de los Estados Americanos, PP3, teniendo
BP3,
que la resolución CD 59R, no espacio, el Consejo Directivo
the Directing Council approved the scale of assessed contributions for member states, participant states, and associate states of the Pan American
para el bienio
Health Organizations for the biennium 2022-2023 resolves
establecer las contribuciones señaladas
to establish
miembros
the
participantes
scale of assessed contributions for member states, associate members, participant
para los periodos
states for the Pan American Health Organization for the biennium 2022-2023 in keeping with the scale of contributions
y las cantidades correspondientes
and the corresponding quantities represent a 0% increase relative to 2020-2021.
leído la parte
I have read
escrita de la
the
resolución,
written
señor
part
presidente.
of the resolution.
De las indicaciones,
Should I read the rest?
Yes. Go ahead.
contribuciones de los Estados miembros
contributions of member states, participant states, and associate members of the Pan American Health Organization for 2022-2023.
Estados miembros,
Members,
Estados miembros. Antigua Barbuda,
Antigua Barbuda
contribución
will contribute for 2022-2023
contribución porcentaje.
by percentage
Antigua Barbuda 0.037,
0.037,
0.044.
0.044 for Antigua and Barbuda.
Contribuciones brutas en dólares de
Now, in gross dollars, the speaker's sound or mic was just turned off, says the interpreter. I apologize. The interpreter would also like to add that the resolution that interpreters were given is not the same one verbatim as being read by the rapporteur.
Okay, can I intervene for a sec? I don't think you need to go through the entire list. I think it's accepted. So we would not need to do that. Okay, so can we move on to the floor? If there are any comments on the proposed resolution, please show your hands and we will recognize you, and I'll ask our moderator to manage the proceedings.
Thank you very much, Mr. President. We will proceed to take note of the request for the floor to discuss the proposed resolution.
Dame un segundo. Señor presidente,
Mr. President, I apologize. Regarding my reading of the draft resolution of the proposed resolution, I should read 4.2 with all of the documents. I had read the prior point.
proyecto de resolución, escala de
Proposed
contribuciones
resolution scale of assessed
señaladas para
contributions
el 2022-2023.
for 2022-2023.
Proyecto de resolución, el 50
Proposed resolution, the 59th Directing Council, whereas resolution CD 59R space, again, that space is to be filled, Mr. President, later on. The Directing Council of the Pan American Health Organization, PAHO, approved the program budget of the Pan American Health Organization 2022-2023, official document 363. BP2, having examined the report of the Pan American Sanitary Bureau on the scale of assessed contributions for 2022-2023 to be applied to PAHO member states, participating states, and associate members for the budgetary period 2022-2023, document CD 59/5, PP3, bearing in mind the provisions of Article 60 of the Pan American Sanitary Code, which establishes that the assessed contributions of the Pan American Health Organization shall be apportioned among the signatory governments on the same basis as the contributions of the Organization of American States. PP4, taking into account Article 24A of the Constitution of the Pan American Health Organization, which states that the organization shall be financed by annual contributions from its member governments, and that the rates of these contributions shall be determined in conformity with Article 60 of the Pan American Sanitary Code, PP 5, considering that the General Assembly of the Organization of American States has adopted a scale of quota assessments for the years 2019, 2023, PP 6, bearing in mind that the total assessed contribution level still needs to be determined and resolves. OP1 to approve the following scale of assessed contributions for 2022, 2023, document CD 59/5, OP2 to request the Secretary to present detailed amounts of the proposed gross and net assessment contributions to be paid by PAHO member states, participating states, and associate members once the total assessed contribution level is determined. I have read rather the written part of the proposed resolution.
Thank you very much. So at this time, we can now go to opening the floor for the plenary for discussion and invite delegates who wish to make a contribution so to do. And of course, our moderator will coordinate that aspect.
Thank you very much, Mr. President. We will proceed to take note of the request for the floor to discuss the resolution presented. And we note the request from Bolivia.
Sí, muy buenos días. Disculpe, creo
Good
que
morning.
estoy confundida.
I'm a little bit confused. I apologize. I would like to more clearly understand what the real amount is. You've got the gross amount. And we agreed with what Chile said and supported. I'm from Bolivia. I would like to know what this increase means so we can have a real understanding of what we are approving. Thank you very much.
Mr. President, we do not register additional requests for the floor, and we return back to you.
Okay, thank you very much. So I'm going to recognize the contribution made, and I'm going to ask Ronnie Mazza to respond to that query that was raised.
Thank you, Mr. President, and apologies for the mixing up of the resolutions there. It's important to clarify indeed, as the distinguished delegate of Bolivia and Chile asked for clarification, that what is being approved in this resolution is the percentage applicable to each member state and the difference as it's presented in the table in the Annex C of the document. The actual amounts are included in the program budget 2022-23 Addendum 2, which applies. First, the member states need to approve the scale of assessment, the percentage application to each member state, and that is shown in the table that's presented in this document. And that application is then translated into the program budget. And we will review that those numbers in Addendum 2 in the resolution that is coming in the subsequent item on program budget. So the actual amounts are there for each member state. Thank you, Mr. President.
Okay, so I'm hoping that that explanation would have clarified the concern. If it has not, then the member is welcome to raise the hand on the electronic platform, and we can seek further clarification. If you are comfortable, then we will go forward with the resolution. Give you a few seconds to either raise or not raise. Okay, well, I asked moderator again to allow you
Very much, Mr. President, and we recognize the delegation of Bolivia.
Sí, nuevamente, y entendiendo que la propuesta está
Understanding
absolutamente ligada a la siguiente resolución,
that the proposal is tied to the following
junto con la siguiente
resolution,
de tal manera de tener claros el panorama real que
we would like to clarify some points of resolution to be absolutely clear.
We thank Bolivia for the intervention and we turn back to our president, seeing none additional requests.
Okay, are there additional clarification that you would want to make, Mr. Mazza?
Thank you, Mr. President. No, we will follow the guidance, your guidance in this regard.
Could we? You do. Okay, all right, so we've consulted and we will seek to achieve consensus. And so we'll suspend a move for the adoption of the resolution at this point, and then we'll return. A minute. Wanna do it? No, yeah. So just give us a minute to clarify and then to return to the resolution. 1 minute, please. Okay, thank you very much for that brief suspension to consult on this matter. I would like to firstly indicate that we are taking Bolivia's intervention very seriously to look at the budget. And we are recommending that we suspend going further with item 4.2 and go to 4.1 to deal with the budget. And during that period, address some of the main issues that have been raised. Prior to that, however, I would like to ask Mr. Ronnie Mazza to explain for delegates the application of the budget and how it is determined, because I think that clarity is required, certainly for the purposes of Bolivia, but hopefully for all who are online. Mr. Mazza.
Thank you, Mr. President, for the opportunity to clarify further. Thanks to Bolivia again for their question. As noted, the total amount of assessed contributions remains at 194.4 million. There's no increase being requested in the quota payments of member states. However, through the application of the OAS scale of assessment, where there's a reduction of the US to 49.9, that slight reduction is redistributed to other member states. And that is the distribution that the resolution requests to be approved through the resolution that has been tabled for this item. This approval is required for us then to apply that proportional allocation of the scale of assessments to the actual budget, which we will present in the subsequent item. Indeed, as noted by the delegate of Bolivia and Chile, there are changes to individual member states in their absolute numbers, and that will be seen in addendum 2 of the item on program budget 2022. At this time, however, we request member states to approve the application of the OA scale of assessment so that we can then translate it into the program budget 2022. Thank you, Mr. President.
Thank you very much for that, Mr. Mazza. I hope that brings some clarity to the issue in terms of the scale and how the budget is determined. However, we will seek
Mr. President?
Yes.
So,
Madam Director.
may I come in?
Sure.
So, as Ronnie was explaining, the total assessed contribution component of the budget has not changed. Has not changed since 2012. Because obliged to apply the OAS scale for quota contributions, that scale has been applied to the total assessed contributions. And so we arrive at the quota contributions for each country. Of course, because one country reduced its quota of the assessed contributions, other countries then must make up. That is what happened in the OAS, and that is what will happen in PAHO. So the individual countries' quota contributions may increase, but it is not an increase imposed by PAHO. It is an increase as a result of the change in the OAS scale, which by our regulations must be applied to PAHO. Thank you.
Thank you very much. That adds a lot of clarity to what has been said previously. I'm wondering if Bolivia would want to agree to having heard this explanation, or further clarity would be required. Can I invite Bolivia to perhaps comment on the explanations that have been provided? Moderator.
If I may, The interpreter believes this is Bolivia. Yes, here we go. Yes, but may I speak, Chair?
Go ahead, go ahead.
Thank you so much. Well, that is crystal clear. We see it and are looking at the big picture. But that has necessitated, as you've explained, Director, some reshuffling from within. And that is something that we in turn will have to explain, hopefully that clearly to our higher ups, beginning with the president and everybody else in a position of authority. So we're just trying to get a grip on these various amounts. And so I appreciate the explanation. And I also understand that we will now move to the program budget. And I had earlier suggested that we might, before taking any decision, we would look at the two together. I would again put that to you because I think it makes better sense and it makes it easier for me to explain situation to my superiors. I totally understand the explanation as to the drop in the contribution of one country, the resulting reshuffling within the OAS, therefore necessarily among us, we get that. But I still think it'll make sense to me and perhaps to others to take the two together. I understand they're separate components, but if we can just wait to any decision till we get the big picture, and if we need time for consultation, I would thank you in advance for giving us said time. Thank you.
If I may, I'm guided by the delegates and the team, but I just wondered whether the resolution is likely to change any, even with the additional explanation that I fully appreciate and respect that Bolivia is requesting for her own the explanation internally in terms of the authority. The formula seems to be standard and it will be applied in any event. There's not likely any authority or powers that can change it. And so in a sense, the discussions that may take place in the margins or even later on would be for the benefit of Bolivia, which is very important for all members to fully understand and appreciate the implications of the adjustments. But it's not likely to change the formula because that formula is rooted in policy and has to be applied anyway. So I'm just wondering that it may not add great utility to delay the resolution, while I do appreciate the need for the explanation afterwards. So if we're agreed on that, I would want to propose that we go ahead with the resolution and then provide follow-up interventions and explanations for the benefit of Bolivia, which I think is necessary once those queries are advanced. Okay, so I'm going to suggest that we move to the declaring the resolution adopted with an explanation for follow-up later on. So can I move for the resolution to be adopted? Okay, can we move now to item 4.1, proposed program budget of the Pan American Health Organization 2022-2023. I'd like to bring documents OD 363 and addendum 1 and addendum 2 to the attention of the council and invite the representative of the executive committee to report on the item.
Muchas gracias, Presidente.
I thank you, Chair. After reviewing the proposed program budget for 2022-2023, the Executive Committee expressed appreciation for the Bureau's efforts to incorporate lessons learned from the previous biennium and from the pandemic response into the budget proposal. The committee also welcomed the Bureau's work with member states to review the organization's priorities. Delegates commended the Bureau's efforts to present a proposed program budget that clearly shows the alignment between the global and regional mandates and indicates how collectively established objectives will be achieved. To facilitate future evaluation of the achievement of those objectives, the Bureau was urged to carefully validate baselines and targets for the output indicators. The cost efficiency measures implemented by the Bureau were applauded. At the same time, however, it was hoped that those measures would not affect the deployment of technical cooperation at the country level. It was pointed out that the recovery of essential health services in the post-pandemic period will require a redoubling of efforts at the country level. The Bureau was therefore encouraged to review the proposed 3% increase in the allocation to the regional level in order to channel more resources to the country level. It was recognized that the Bureau's ability to continue providing critical support during the pandemic and to implement the technical cooperation plan for the coming biennium will depend on the availability of those financial resources. Member states were urged to pay their assessed contributions on time and in full. In view of the historical shortfall in the receipt of the WHO allocation to the region, the Bureau was encouraged to plan around potential gaps in WHO funding. It was encouraged also to identify new strategies for resource mobilization. The Executive Committee then adopted Resolution CE 168R6, recommending that the Directing Council approve the proposed program budget for 2022-2023. The committee also approved and adopted Resolution CE 168.R7, recommending that the Directing Council establish the assessed contributions of member states, participating states, and associate members for the biennium 2022-2023. I thank you, President. This concludes my report on this item.
Thank you very much. And I now yield the floor to Mr. Ronnie Maza, Director of Department of Planning and Budget and Evaluation, for his comments.
Thank you, Mr. President, and good morning to all again. Distinguished members of the Directing Council, Madam Director, I am pleased to present to you the proposed program budget 2022-23 on behalf of the Secretariat. I would like to highlight that this program budget proposal takes into consideration the process and the outline that was approved by the Subcommittee on Program Budget and Administration, and also incorporates the recommendations from the Executive Committee in June, and also updates on developments considering country, regional, and global considerations as we live in these challenging times. I would like to highlight the following key considerations. The program budget 22-23 is the second program budget to implement the PAHO strategic plan for the period 2020-2025. This program budget responds to the current situation without losing sight of the medium and long-term commitments for sustainable health development. It outlines and responds to the current needs and regional and global commitments agreed by member states in the Sustainable Health Agenda for the Americas, as we call it, SHAP 2018-2030, the PAHO strategic plan, the 13th WHO General Program of Work, and the Sustainable Development Goals. A careful review of the situation and priorities was conducted in the context of the COVID pandemic. We also look at the lessons from the 2021 biennium and considered updating the risk situation as well, as you will see in the document. The process included a thorough bottom-up planning and costing exercise involving the three levels of the organization: country, sub-regional, and regional. And consideration was given also to corporate commitments to ensure a realistic and feasible proposal. The program budget 22-23 proposes a strategic direction in light of the challenges and opportunities moving forward, building on successes, lessons learned, and implementing new ways of working and innovative approaches. I would like to thank member states for their continued input and engagement during the governing body meetings and especially through the country consultations to review the priorities for PAHO's technical cooperation moving forward. In light of the major changes in the situation, a strategic review of priorities was conducted to ensure PAHO's technical cooperation remains responsive and relevant to the needs of member states for the next biennium, considering its value added, the changes in the context, and also what member states really need going forward. Despite the challenges to convene joint face-to-face meetings, I am pleased to report that up to 87% of the countries and territories were able to complete such strategic reviews as of 15 July 2021. We would like to give special thanks to the health authorities and our country office teams who facilitated such important exercises. The results in this table show that member states remain committed to implement the approved PAHO strategic plan and continue to prioritize technical cooperation in non-communicable diseases and mental health, preparedness, prevention, and response to emergencies, risk factors for both communicable and non-communicable diseases, and response capacity for diseases, as well as quality and integrated health services. As you can see from the table, the green and red arrows show those few cases where there have been shifts in the priority tiers of one outcome to another one, with the green arrows showing where an outcome moved from a lower tier to a higher tier of priority, and vice versa with the red arrows. I would like to highlight that this table shows the aggregated results. But most importantly, for planning, budgeting, and resource allocation at country level, we'll be using the individual country prioritization results, which vary from country to country given the specific needs of each country. The priority needs as well have been considered going forward, but also the interprogrammatic and complementary nature of outcomes, as they are activities that are indeed interconnected through the various outcomes that you see here. For instance, access to comprehensive quality of health services indeed includes aspects related to maternal and child health, human resource to health, and so on. We also took the opportunity to reflect on the strategic direction going forward, and considering the situation analysis, the review of priorities, commitments, current and new policies and strategies, some of which are being discussed by this very same directing council, and the need for adaptation in the face of the pandemic. The program budget 22-23 incorporates an overall strategic direction that focuses on three approaches: to protect, recover, and build stronger, and 6 areas of focus, as we call it 3x6, underpinned by 2 overarching principles of this organization and the region, which are equity and solidarity, and also highlighted in the deliberations of this directing council. The 6 areas of focus as described in the figure are: build resilient health systems and service with primary health care and equity approach; to stop the COVID-19 pandemic, protect essential health services, and ensure equitable access to vaccines, medicines, and health technologies; to bolster preparedness and surveillance, to prevent and respond to future pandemics and other health emergencies; advance digital transformation and information systems for health, ensuring the use of timely, reliable, and disaggregated data for evidence decision-making; implement intersectoral actions to address risk factors, determinants, and the needs of vulnerable groups; increase organizational effectiveness and modernization of PAHO's work. The strategic approaches and areas of focus are directly aligned with the vision and goals of the Sustainable Health Agenda for the Americas.
Yanni,
Yes, sir.
do they clean up that thing?
Thus allowing the organization short-term response to align with the hemispheric long-term vision. The strategic approaches and areas of focus are indeed interconnected, as you can appreciate. They are linked to the outcomes in the strategic plan, that they do not replace the results chain in the PAHO strategic plan, but rather serve to articulate the areas that require emphasis in the 2022-23 biennium. Consistent with the programmatic context and strategic direction, and considering a balanced approach of needs, finance, and capacities, and indeed a realistic approach, the program budget considers internal efficiency efforts and also working in new ways as we have been doing in the last 2 years. The Secretariat is therefore presenting a budget that is realistic to the tune of $688 million, $640 million in base, shown here in blue, plus $48 million in special programs, shown in gray on this chart. The real budget increase represents almost a 6% or 38 million, and in base programs, 3.2%, 20 million. This also includes the approval of the Health Assembly, the World Health Assembly, of budget allocation to the region of $252.6 million. The distribution of the budget by functional level follows the approved budget policy as outlined in the document. Now, when it comes to the application of the budget by outcomes, and I want to clarify that when we refer to budget here, we're referring to a budget space that needs to be financed. So the total budget envelope and by outcomes presented in document were determined based on that bottom-up realistic approach that I highlighted before, balancing the needs identified in the consultations, again, through the 3 levels of the organization, considering corporate commitments, the priorities identified in member states, historical and prospects in financing, and the programmatic and complementary nature of the outcomes, as I noted before. This table shows the proposed budget by outcomes, as table 2 in the document. It's presented for reference for you to appreciate the shifts between one biennium and another. I want to highlight the fact that the budget determination considers those 4 items related to the bottom-up costing, the feasibility to finance, and also any shifts in demands for technical cooperation that we identified through the costing exercise. In terms of the sources of financing, the document also presents the main expected source of financing. I want to note that there are 2 fixed lines here, the PAHO net assessed contributions that we were just discussing, as you can see here. It remains stable again for another biennium, as highlighted by the director. Since 2012-13, there has not been an increase in the assessed contributions. And then the WHO allocation to the Americas, which is also predetermined and approved by member states in the World Health Assembly. The other 2 lines, the miscellaneous revenues and the PAHO voluntary contributions, were estimated based on the best information we have at this time. What we aim to achieve, however, and I want to highlight this, is the full financing of 640 million. But we also know that the reality is that the budget approved for the Americas from the AMRO or the WHO allocation is indeed a budget that, while we have seen increases in financing in the recent past, we continue to have a major funding gap, which is at the tune of 25% of the approved budget at this time. Also, I think it's important to stress the point that the assessed contributions, while we recognize the economic situation and the hardship that countries are facing, not requesting an increase in such assessed contributions represents a real reduction in monetary terms, as the demand of technical cooperation, the operational costs continue to increase. And yes, while we continue to invest in efficiency measures as proposed in it and documented in the document, we do face a challenge, and that we rely therefore on member states' timely payment of those funds. They are the funds that really allow us to respond to your priorities. Now, it's also important to highlight that this organization continues to its commitment of implementing its results-based management approach to increase accountability and transparency. What you see in this slide is the main mechanisms we have for the ongoing monitoring and regular reporting on the implementation of the program budget, ensuring that resources really lead to results. From the internal monthly reviews that we do with our executive management, and also the 6 monthly exercises that we do with the entire house, all managers and teams participate in that, to the joint end of biennium assessment, which is a unique experience that we have in PAHO, and it's not, you will not find this in other UN organizations, the joint assessment of the program budget outputs and the outcomes of the strategic plan. I also want to highlight, in that spirit of increased transparency and making available real-time information, we continue to improve our PAHO program budget portal, which provides member states and partners with a full picture of the financing of the program budget. And it's updated quarterly, and we hope that member states continue to see this information. And we will continue to improve that platform going forward as well. In terms of our commitment to country focus, and in light of that effort that the organization continues to ensure that both our resources and efforts end up in contributing to improving health outcomes at country level, we continue with the inclusion of the country pages in the document. You will find these. There is a page for each country that provides a synopsis of the priorities, the key interventions, and the overall budget that has been allocated to each country that's engaged in directly implementing PAHO's technical cooperation. We also continue to update these tables, and we hope that member states can see the value that we bring to this to emphasize the importance of country focus and improving health outcomes. The Directing Council is invited to analyze the proposed program budget and provide the Secretary with its comments on its content and format of the document. The Council may also wish to comment on the appropriateness of the overall level of the budget, and also consider approving the proposed resolution contained in Addendum 1 and Addendum 2 to the document. And again, just to highlight that Addendum 2 contains the actual amounts of the assessed contributions that apply to each member state, and a comparative from the previous biennium to the 2022-23. Thank you, Mr. President, and I remain available for any questions, comments. Thank you.
Thank you very much for that comprehensive presentation, very useful. I open the floor now for a discussion and invite delegates to raise their hand using the electronic platform if they have any questions or comments, and ask the moderator to conduct this proceedings.
Thank you very much, Mr. President. We will proceed then to take note of the request for the floor to discuss this agenda item. And we note the request from Honduras, followed by Canada.
Señor Presidente, distinguidos delegados.
Mr. President, distinguished delegates, Honduras agrees with the 2022-2023 program budget for the Pan American Health Organization, because this is a proposal that resulted from the effort made by the Bureau, taking into account the socioeconomic situation of member states to comply with the mandates of public health. Furthermore, it also takes into account the current context that is ever-changing, and the effects of the COVID-19 pandemic at the national, regional, and international level. The program budget, biennial program budget, and the strategic plan are together the documents that put forth the priorities and objectives that guide the work of the Pan American Health Organization and make up the accountability method regarding the use of the organization's resources, which are geared toward and based on needs, priorities, and emergency situations that may arise nationally or regionally. We appreciate the technical work that has been incorporated in this document, including regional analyses of the public health situation of each country and the results of regional consultations and special committees that undertook very specific and worthwhile work. We congratulate the Secretariat for the title given this document, the motto: to protect, recover, and build, to strengthen. Very timely. For the foregoing, we would ask of the Directing Council to approve this program budget for the Pan American Health Organization 2022-2023, and to authorize the Madam Director to execute, orient and reorient in a flexible way the available financing in keeping with priorities that are currently established and those that may emerge during the 2022-2023 time period. Thank you very much.
We thank Honduras for the intervention. We now yield the floor to Canada, followed by Mexico.
Thank you and good morning, Mr. President. Canada would like to thank the Secretariat for the proposed program and budget for 2022 to 2023. The COVID-19 pandemic has demanded a shifting of efforts from all member states, including in the allocation of resources. In this regard, we are pleased to note that many high priority outcomes either maintain or increase their allocated budgets, which is important for the continued efforts, both COVID-related and non-COVID related. That said, Canada is concerned with outcome 14, malnutrition, shifting its priority from high to moderate, given the rise of malnutrition among women and children in the region following the pandemic. We would like to understand whether the shift in priority would affect budgetary allocation to the nutrition program and how PAHO plans to mitigate the effects of this lowered priority in countries with greater nutritional problems and needs. While the WHO is increasing the AMRO budget allocation compared to the current biennium, this has historically not always been fulfilled, including the recent 68 million gap in the 2020 to 2021 biennium. We continue to encourage the Secretariat to plan around these unfulfilled allocations to mitigate the risks associated with this. Considering PAHO's budget's increased reliance on WHO allocations for the next biennium, and 1/3 of program budget is still relying on unpredictable and earmarked funding, it would be particularly important to be prepared for potential gaps in funding in an effort to maintain sustainable program delivery. Finally, Canada recognizes the importance of assessed contributions in funding the base programs. We continue to encourage all PAHO member states, associate members, and participating states to pay their assessed contributions on time and in full. As we are all aware, now more than ever, PAHO is playing a crucial role in supporting us all in the pandemic response, and the organization needs to be funded adequately if we want PAHO to continue responding effectively to our needs. Thank you very much.
We thank Canada for the intervention. We give the floor now to Mexico, followed by Ecuador.
Thank you very much, Mr. President. Good morning, everyone. The delegation of Mexico takes note of the presentation made by the Secretary and acknowledges the regular structure of this document, program budget for the Pan American Health Organization 2022-2023. We also express our acknowledgement because during the prolonged health emergency, the Pan American Health Organization has focused its attention on a COVID-19 response, consolidating, ensuring a transparent accountability regarding results and the use of the resources. The program budget ensures the use of resources such that we can improve the health in the region. Also, we appreciate that that financing has been kept at the level proportionate at the national, regional levels, and the request made for the proposed budget for the next budget be reflected graphically along with the financing for us to do a better assessment of this. That will also facilitate looking at financing gaps relative to the next fiscal year. Regarding the pandemic, we do think it's important for us to have the documents presented to the next directing councils in 23-24 with the outbreak response program in keeping with our commitments to non-state actors. We also think it's very important to reiterate that when reference is made to interventions and a technical assistance, that we explicitly consider that will be done hand in hand with the national health authorities, focusing on those multi-sectoral matters, strengthening the stewardship of authorities. Finally, we thank the Secretariat for including Annex A with the summary on the impact broken down by country for each one of the countries.
We thank Mexico for the intervention, and we yield the floor to Ecuador, followed by the United States.
Muchas gracias, señor presidente.
Thank you very much, Mr. President. Ecuador appreciates the effort put forth by the Pan American Health Organization in developing this document, which is a breakdown of the 2022-2023 program budget, in which we look at the challenges and PAHO's goals for the next biennium. To that effect, we do think it's very important that is the 28 outcomes that seek to offer coverage and accessibility of services, better endowed healthcare services, and to reduce risks that are associated with health. That we are pleased to see the high priority outcomes that take into account risk factors in communicable diseases, as well as those for non-communicable diseases, integrated information systems for health, among others. As regards the mid-level priority outcomes, we think that we should reconsider malnourishment, considering it a high priority, because the region and our country in particular have registered increases in the prevalence of chronic malnourishment. At the same time, there's been an increase in obesity rates, and this compels us to call for technical cooperation on this pillar. To this effect, or on this matter, there are some key activities to be carried out by PAHO in Ecuador 2022-2023, technical tools, for example, to implement prioritized health care and mental health services, support for the implementation of the HERTZ initiative, strengthening the regulatory, national regulatory authorities. Finally, Ecuador would like to make a call to, or urge the Secretariat to keep up the technical assistance in countries through the country offices, which are essential in achieving the implementation of cooperation strategies with each country. Thank you very much, Mr. President.
We thank Ecuador for the intervention, and we yield the floor to the United States.
Thank you, Mr. President. The United States thanks the Secretariat for the updated budget proposal and appreciates efforts to incorporate lessons learned from the previous biennium, as well as the response to the COVID-19 pandemic. We welcome the three strategic approaches guiding the budget, as well as the focus on equity and solidarity. We also thank PAHO for its ongoing commitment to the member states' prioritization exercises and appreciated the updates provided in the program budget proposal. We are also pleased that the budget aligns with the WHO GPW 13 and the proposed WHO program budget 2022 to 2023, as this programmatic alignment facilitates critical technical collaboration and reporting between the global and regional levels. The alignment between the WHO GPW 13 results framework and the PAHO outputs is also welcome. Going forward, it will be critical to continue implementing lessons learned from the COVID-19 pandemic and making adjustments as needed. Thank you.
We thank the United States for the intervention. And Mr. President, I don't see any additional requests for the floor, and we yield back to you.
Thank you very much for that. And thanks to those who participated and gave valuable contribution. I will now yield the floor to Mr. Maza to respond to the comments that have been made.
Thank you, Mr. President, and we would like to also thank the member states for their comments and continuous support to this program budget of PAHO for the biennium 2022-23. I see the comments can be grouped regarding the prioritization and then the budget aspects. And let me start with the prioritization so that I can elaborate on some key points. In terms of the priorities and those outcomes that I highlighted in the top tier, and I would like to clarify, top tier for us means high and medium outcomes, which are 17 of them that guide us from a collective approach, and the majority of member states saying this is where they would like to see more emphasis from PAHO's technical profession. It doesn't mean that the lower tier are not important, but that a more tailored approach is required to respond to those. And in the specific mention of nutrition, as highlighted by Canada and Ecuador, I would like to note that given the importance of this outcome, while it shifted from high tier to medium tier priority level, the budget has been maintained, recognized at $6 million, recognizing again the importance of the topic. I would like to also note that for those member states that have identified that outcome as priority, they will get also the full support. We'll continue to protect these outcomes, such as malnutrition, also through the allocation of flexible and unearmarked funds, wherever possible, of course. And that's why the importance of the assessed contributions to protect those priorities that member states highlight. Also important to note that nutrition also is interconnected and related, and interprogrammatic work here is important to the determinants of health, another outcome that also has its own budget, and the NCDs and risk factors. So we also need to see the complementarity among outcomes as well, and that a budget line is there, but also we will seek to protect and respond to the demands of member states technical cooperation through this outcome by protecting the budget and looking at resource allocation, but also the interprogrammatic work that all the departments do with the country offices. In regards to the point highlighted by Canada in terms of the funding gap, which is indeed, as I noted, a challenge, especially for the AMRO allocation. We have seen positive trends in the last two biennium, a constant increase in the allocation, and we hope that that will continue. But also the Secretariat is prepared to continue with its own resource mobilization efforts to also expand its donor base and to also increase our communication outreach in communicating our results and reaching to partners to ensure that the great work that you so much appreciate, and we welcome that appreciation, is also known, and that also should contribute to mobilize resources. We have a renewed effort in resource mobilization to a new resource mobilization strategy, and we are also looking forward to implement a renewed communication strategy to expand again and deepen our partnership, and which also should result in resource mobilization. We also want to highlight that during this biennium, we have seen, of course, an increased allocation of funds to the COVID response to the tune of over 200 million. That is not reflected in the base program. But as we shift from the emergency mode to the development, hopefully, in the next biennium and going forward, that some of those funds that are there for the emergency response will shift to base programs. That is critical that we continue to invest in integrated response and strengthening health systems as well, as highlighted. We welcome and also we thank member states for continuing to advocate and for the fair share that the region should get from WHO. And with the increased budget approved by the World Health Assembly, it also allows us, both the Secretary and member states, to request for it to be filled now. And that will be the challenge going forward, an opportunity. We welcome Mexico's suggestion to look at the analysis of the funding and gaps for the final program budget 24-25, as I understood it. We are prepared to conduct that analysis when that proposal is prepared. But I want to also note an update here that when we present our end of biennium assessment report at the end of this biennium, which the governing bodies will see next year, we will also include information that will show the financing of the program budgets 2020, 21 and 2022. Member states will be able to appreciate the trend in financing as well. So I would like to again reiterate our thanks and remain committed to implement the recommendations from our member states, and that indeed our country office and technical programs will continue to work as highlighted by Ecuador with the countries, with that country focused approach that is characteristic of our work. Thank you, Mr. President.
For your comments, Mr. Maza. I'm going to ask now Dr. Jarbas, who is our Assistant Director, to comment, representing, of course, the Office of our Director.
Thank you, Mr. President. I just want to make a very brief comment to complement what Mr. Maza has already said. First, I think that this process in our region has always been has had a very important participation from our member states, both in the process to establish the prioritization, to establish the links between the biennial planning process with the general agendas that you have in the region. So I think that it's very important, the participation. I remember that when we established the 2025 strategic plan, we had a working group with 21 member states participating. So I think that this is a very important characteristic of the region that we need to stress, to keep, and see how to strengthen. The second is about the transparency. I think that is important also to recognize that we have learned from the countries that they need more improvement in the way that we make the organization more accountable to our member states, how we can report better, not only the general indicators, but also for the achievements that we have had in each country with a better use of the resources that we have. Thirdly, to remind, as Mr. Maza said, that is very important, the advocacy that member states of UNRWA, PAHO, have made in the World Health Assembly, the executive board of WHO, that we need to get a fair share of the general budget of WHO. And also to remember that in the next biennium. And finally, of course, we need to respect the decision from our member state about the prioritization process. But again, malnutrition is a very important topic. And for sure that we will find a way to provide the technical cooperation covering this double burden of the nutrition problems that we have in our region. And at the same time, and sometimes living in the same community of family, obesity, and the hunger. So I think that the malnutrition is really a very important problem, and the Secretariat will do our best effort to keep the technical cooperation, to call the attention, and to provide technical strategies to overcome this very important project. Thank you, Mr. President, and again, thank you, our member state, for being so participative in this process.
Thank you very much, our Assistant Director, Dr. Jarbas. I would like to inform you that the delegates that this document contains two proposed resolutions. I propose we take them one by one. Now I ask the rapporteur, therefore, to submit the first one, which is the proposed program and budget of the Pan American Health Organization 2022-23. And then we will go from there. Rapporteur.
Gracias, señor presidente.
Thank you, Mr. President. I will proceed to read. Provisional agenda item 4.1, addendum 1, proposed resolution, program budget of the Pan American Health Organization 2022-2023, the 59th Directing Council, PP1, having examined the program budget of the Pan American Health Organization 2022-2023, official document 363, BP2, having considered the report of the 168th Executive Committee, document CD59/2, PP3, noting the efforts of the Pan American Sanitary Bureau, the Bureau, to propose a program budget that takes into account both the socioeconomic considerations and the joint responsibility of member states and the Bureau in achieving public health mandates. PP4, noting the efforts of PASB to propose a program budget that considers the evolving context and impact of the ongoing COVID-19 pandemic at global, regional, and country levels. PP5, bearing in mind Article 14C of the Constitution of the Pan American Health Organization and Article 3, paragraph 3.5 of the financial regulations of the Pan American Health Organization, resolves OP1 to approve the program of work of the Pan American Health Organization, PAHO, with a budget of $640 million for base programs and $48 million for special programs as outlined in the program budget of the Pan American Health Organization 2022-2023 official document 363, OP2, to encourage all member states, participating states, and associate members to continue to make timely payments of their assessed contributions in 2022 and 2023 and of arrears that might have accumulated in the previous budget periods. OP3, to encourage member states, participating states, and associate members of the Pan American Health Organization to continue advocating for an equitable share of the World Health Organization's WHO resources, and specifically for WHO to fully fund the budget space allocated to the region of the Americas. PP4, to encourage member states, participating states, and associate members to make voluntary contributions that are aligned with the PAHO program budget 2022-2023, and where possible, to consider making these contributions fully flexible and unearmarked. OP5, to approve assessed contributions for the biennium 2022-2023 in the amount of $225.5 million, composed of A, $194.4 million in net assessments of member states, participating states, and associate members, which requires no increase over the last approved amount of net assessed contributions, $194.4 million, and B, $31,150,000 as a transfer to the tax equalization fund as indicated in the table below. OP6, in establishing the contributions of member states, participating states, and associate members, assessed contributions shall be reduced further by the amount standing to their credit in the tax equalization fund, except that credits of those states that levy taxes on the emoluments received from PASB by their nationals and residents shall be reduced by the amounts of such tax reimbursements by PASB. OP7, to finance the approved base programs in the following manner and form. the indicating sources of financing. Sources or source of financing assess contributions from PAHO member states, participating states, and associate members for the amount of $225,550,000, less credit from Tax Equalization Fund, $31,150,000, budgeted miscellaneous revenue, 14 million, PAHO voluntary contributions and other sources, $179 million, funding allocation to the region of the Americas from WHO, $252,600,000, OP8, to authorize the director to use all sources of financing indicated above to fund the PAHO program budget 2022-2023, subject to the availability of funding. OP9, to request the director to prepare a report on the expenditure amounts from each source of financing and against the 28 outcomes outlined in the PAHO program budget 2022-2023 to be presented to the governing bodies in 2024. I have read the proposed resolution, Mr. President.
Thank you very much for that presentation, and we will now yield the floor to the plenary to have any discussion or matters raised on the proposed resolution. Mr. Moderator.
Thank you very much, Mr. President. We will register the request for the floor by member states to discuss the presented resolution. Mr. President, we don't see any requests for the floor, so we yield back to you.
Okay, very good. I really like when there is full agreement, and it appears that this is the case. And so I will therefore declare the resolution adopted. We will then ask the rapporteur to submit the second proposed resolution, assess contributions of the member states, participating states, and associate members of the Pan American Health Organization 2022 to 23.
Procedo a la lectura, señor presidente.
I shall proceed with reading that proposed resolution, sir. Thank you very much. Proposed resolution. Assessed contributions of the member states. There is intervening noise and children in the background. The interpreter points out, can do my best. Proposed resolution. Assessed contributions of the member states, participating states, and associate members of the Pan American Health Organization for 2022-2023. The 59th Directing Council. PB1. Whereas in Resolution CD 59R blank, the Directing Council approved the program budget of the Pan American Health Organization 2022-2023. PP2. Considering that Article 60 of the Pan American Sanitary Code and Article 24A of the Constitution of the Pan American Health Organization provide that the scale of assessed contributions to be applied to member states, participating states, and associate members be determined on the basis of the assessment scale adopted by the Organization of American States, PP3. Bearing in mind that the Directing Council in Resolution CD 59R blank adopted the scale of assessments for the member states, participating states, and associate members of the Pan American Health Organization for the biennium 2022-2023 resolves to establish the assessed contributions of the member states, participating states, and associate members of the Pan American Health Organization for the financial periods 2022 and 2023 in accordance with the scale of assessments shown below and in the corresponding amounts, which represent an increase of 0% with respect to the biennium 2020-2021. That concludes the reading, Chair, of this proposed resolution. Thank you. I yield to you.
Thank you very much for that. I now yield the floor to the plenary to begin the discussion and invite delegates, of course, to use the electronic platform if they have a contribution, and turn over to our moderator to conduct these proceedings.
Thank you very much, Mr. President. We will continue to register the requests for the floor to discuss the proposed resolution. Mr. President, seeing none.
Very well. Thank you very much for that. And because there are no comments or concerns raised, we will proceed to declare the resolution adopted. It's now just after 11. Should we complete items 2.1? Okay, so we're going to just complete items 2.1, third report of the Committee on Credentials, and then we take a quick break after. We're doing very well so far. Thanks again to all who are participating up to this point. So 2.1, third report on the Committee on Credentials. I will yield the floor to the delegate of Panama, President of the Committee on Credentials, to present the third report.
Buenos días, señor presidente.
Very good morning, Mr. President. I will proceed to present the third report of the Credentials Committee in conformity with 131 of the interpreter regrets there's enormous echo. Doing my best. The committee met for the third time on the 22nd of September at 9:30. We looked at the credentials presented to the director of the PASB in conformity with Article 4 of the Interior Regulation of the Council. This regards member states, participating states, associate members having presented their credentials, and we are pleased to say they were all deemed proper, and we therefore urge that they be approved as such. We have Antigua, Barbuda, Argentina, Bahamas, Barbados, Belize, Bolivia, Brazil, Canada, Chile, Colombia, Costa Rica, Cuba, Dominica, the Dominican Republic, Ecuador, El Salvador, France, Grenada, Guatemala, Guyana, Haiti, Honduras, Jamaica, Mexico, Nicaragua, Panama, Paraguay, Peru, St. Kitts and Nevis, St. Vincent and the Grenadines, Suriname, Trinidad and Tobago, the United Kingdom, the United States of America, Uruguay, Venezuela, and now for associate members, St. Martin, Portugal and Spain, We have the chair and the delegate of Paraguay. We're listing the members of the Credentials Committee and their offices. Thank you very much. This concludes the report.
Thank you very much for that. And I will now pose to the delegates if there are any objections. Use the electronic platform if there are any objections. I see no indication of objections, and therefore I declare the report approved. Thank you very much for that from our Credentials Committee. Thank you for your efforts, and thank you, Madam Chair, for the presentation. We are going to now proceed to a 10-minute break to stretch your legs, have a little coffee or tea or water, and then we get back. We will have another set of agenda items to cover up to the lunch break. So thank you very much. This has been a good morning, and we appreciate the presence and participation. So 10-minute break. Thank you.
The Americas have been hit hard by COVID-19. In March 2021, after intense preparations, countries were ready to introduce COVID-19 vaccines with the help of PAHO. When the first vaccines from the COVAX facility became available, PAHO's revolving fund delivered them to the region. Here's what it took to get there. For decades, PAHO has worked with countries in the Americas to achieve their immunization goals with a lifelong approach and strong adult immunization services, making it the first region in the world to eradicate smallpox, be declared polio-free, and eliminate other vaccine-preventable diseases like rubella. PAHO helped to analyze and review vaccination plans and consolidate demand to allow all countries to purchase vaccines at affordable prices. Throughout the COVID-19 pandemic, PAHO has supported COVAX, aiming for equitable access to COVID-19 vaccine doses in the Americas. Because we are not safe until everyone is safe.
Hello, world. My name is Mia, and I am the first digital worker in the Pan American Health Organization. I am a proud procurement technician. I have been looking forward to working at PAHO. I started my job on Monday, March 29th, 2021. On my first day of work, I supported buyers by processing the repetitive parts of purchase orders for strategic products, including COVID-19 vaccines, under the COVAX Initiative for the Americas. I'm available 24 hours a day, 7 days a week. I am happy to contribute to the rapid purchase of vaccines for all the countries in the region. I look forward to working with you. Thank you very much.
Bonjour, je m'appelle Max. Je suis un technicien logistique virtuel pour le département de la gestion des achats et des approvisionnements de l'OPS Pro. Mon rôle est de traiter les commandes des fournitures et des vaccins relatives à Covid-19. Aider à automatiser les achats soulage mes collègues humains. Ceci leur permet de se concentrer sur d'autres tâches essentielles contribuant à la riposte mondiale à la pandémie. Je peux numériser les informations, traiter les informations d'expédition, remplir les formulaires d'expédition et suivre les numéros d'expédition, les vols, les transports, les transporteurs, le nombre total d'expéditions et plus encore. Je suis disponible 24 heures sur 24 et 365 jours par an, car les envois peuvent arriver dans les pays n'importe quel jour ou à n'importe quelle heure. Merci Paro de m'avoir intégré à l'équipe.
I am.
We are.
All of us.
Together.
This is who we are.
Our humanity. The hopes we share.
The struggles we face.
The stories that define us.
Individually, collectively, universally.
Every person.
Family.
Community.
We are happier when we have each other.
Healthier when we stand together.
Every one of us matters.
No one should be left behind.
We all have the same fundamental right
To health and happiness.
To the care we need.
wherever we live.
Whatever we have or do not have.
Regardless of age,
Race,
language,
culture, or circumstance.
This is our mission.
We stand together with all people
in every community, every country, throughout the hemisphere.
Because we are healthier.
Together.
We are the Pan American Health Organization, working for health for everyone, everywhere.
Bonjour, je m'appelle Mia et je suis la première travailleuse numérique de l'Organisation panaméricaine de la santé. Je suis technicienne en achat et lors de mon premier jour de travail, j'ai accompagné les acheteurs en traitant les parties répétitives des commandes d'achat de produits stratégiques, dont les vaccins Covid-19, dans le cadre de l'initiative COVAX pour les Amériques. Je travaille 24 heures sur 24, 7 jours sur 7. Je suis heureuse de travailler à l'OPS car je contribue à l'achat rapide et efficace de vaccins pour tous les pays de la région. Merci beaucoup de m'avoir reçu et de me permettre de travailler avec vous.
The Americas have been hit hard by COVID-19. In March 2021, after intense preparations, countries were ready to introduce COVID-19 vaccines with the help of PAHO. When the first vaccines from the COVAX facility became available, PAHO's revolving fund delivered them to the region. Here's what it took to get there. For decades, PAHO has worked with countries in the Americas to achieve their immunization goals with a lifelong approach and strong adult immunization services, making it the first region in the world to eradicate smallpox, be declared polio-free, and eliminate other vaccine-preventable diseases like rubella. PAHO helped to analyze and review vaccination plans and consolidate demand to allow all countries to purchase vaccines at affordable prices. Throughout the COVID-19 pandemic, PAHO has supported COVAX, aiming for equitable access to COVID-19 vaccine doses in the Americas. Because we are not safe until everyone is safe.
Hola, soy Max, un técnico de logística virtual para el Departamento de Gestión de Adquisiciones y Suministros de la OPS. Mi función es procesar los pedidos relacionados con los suministros y las vacunas contra la COVID-19. Ayudar a automatizar las adquisiciones les quita una carga a mis colegas humanos, permitiéndoles enfocarse en otras tareas esenciales. Yo puedo digitalizar información, procesar la información de envíos, rellenar formularios de envío y rastrear números de envíos, vuelos, transportistas, número total de envíos y más. También puedo crear archivos de envío avanzados, cargar documentos de envío y completar la información del lote en las órdenes de compra. Estoy disponible las 24 horas, los 365 días del año, ya que los envíos pueden llegar a países en cualquier momento. Gracias OPS por hacerme parte del equipo.
Thank you very much. We are back at the 59th session of the Directing Council, and we will proceed with items 3.3. But before we go there, I would like to ask Ms. Monica Zaccarelli to make a couple of announcements, please.
Thank you very much, President. The first announcement refers to the proposed resolution number 1 on item 4.7, reinvigorating immunization as a public good for universal health. The amendments to that proposed resolution presented on the floor yesterday have been incorporated into the 4 languages, and the proposed resolution is already available to you through the resolution tracking system. The second announcement, it relates to the special event, the side event during lunchtime. The side event, a comprehensive response to tackle the prolonged crisis resulting from COVID-19 pandemic, the strategic link between health and economy. This event will be held in the same virtual room as the council. So you would just please stay connected and logged on to this same virtual room, and the event will take place from 1 p.m. to 4 p.m. Washington time. Thank you very much, Mr. President. This is all.
Thank you very much. Okay, so we will now resume to our regular agenda items. Item 3.3, election of 3 member states to the Executive Committee on the expiration of the period of the Office of Barbados, Ecuador, and the United States of America. I would like to bring document CD 59-4 to the attention of the council and report that the candidates of Argentina, Bolivia, and Jamaica were received. I yield the floor to the secretary to present the item and report to the council on the statutory provisions concerning this item.
Thank you, Mr. President. Can you hear me?
Go ahead, we're hearing. Thank you.
Thank you. Thank you, Mr. President. I am very sorry about that. I had some temporary problems with my internet. Mr. President, Executive Committee. The committee is composed of nine member states, which are elected by the conference or the council for overlapping periods of 3 years. This year, it is incumbent upon the 59th Directing Council to elect 3 members to replace Barbados, Ecuador, and the United States of America, whose terms on the committee have expired. I would like to clarify that in accordance with PAHO's constitution, on the council's rules of procedure, France, the Kingdom of the Netherlands, and the United Kingdom of Great Britain may participate in the voting, but are not eligible for membership on the executive committee. Associate members and observer states are not eligible to vote, nor may they be candidates for the executive committee. The only other countries not eligible for election are the 3 outgoing members of the committee: Barbados, Ecuador, and the United States. Excuse me, I'm having serious problems with my computer. Sorry. Can you hear me, Mr. President?
Yes, we are hearing.
Okay, I am very sorry. I apologize. I'm having some computer problems. Let me start over again from the last paragraph I was reading. The only other eligible countries not eligible for election this year are the 3 outgoing members of the Executive Committee, that is Barbados, Ecuador, and the United States of America, because every member leaving the committee must remain off the Executive Committee for at least 1 year before being eligible for re-election. And of course, the continuing members of the Executive Committee, that is Brazil, Costa Rica, Cuba, Haiti, Mexico, and Suriname, are also not eligible for election. If the number of candidates does not exceed the number of vacancies, Rule 51 of the Rules of Procedure of the Directing Council applies. Rule 51 states, elections shall normally be held by secret ballot, except as concern the election of an interim director, when the number of candidates for elective office does not exceed the number of offices to be filled, no ballot shall be required, and such candidates shall be declared elected. Rule 57 of the Rules of Procedure of the Council states, the term of office of members elected to the committee shall begin immediately after election and shall continue until their successors are elected in accordance with Article 15, Paragraph A of the Constitution. That concludes my presentation. Thank you very much, Mr. President.
Thank you very much. I would like to inform the council, therefore, having heard rules 51 and 57, that since there are only 3 candidates pursuant to Article 51, Argentina, Bolivia, and Jamaica are elected to the executive committee. And I want to congratulate them on this. I now ask the rapporteur to present the proposed resolution formalizing the decision of the council.
Aurora.
Rapporteur.
Lo siento, no lo procedo, señor presidente, no lo había escuchado.
My apologies, Mr. President. I had not heard you.
I am inviting you to read the proposed resolution contained in document CD 59-4, please. Thank you.
Procedo a la lectura, señor presidente.
Or else I'll proceed to read the document. Proposed resolution. Election of 3 member states to the Executive Committee on the expiration of the periods of office of Barbados, Ecuador, and United States of America. The 59th Directing Council, PP1, bearing in mind the provision of Articles 4.d and 15a of the Constitution of the Pan American Health Organization, PP2, considering that Argentina, Bolivia, and Jamaica were elected to serve on the Executive Committee upon the expiration of the periods of office of Barbados, Ecuador, and United States of America, resolves to declare Argentina, Bolivia, and Jamaica elected to membership on the Executive Committee for a period of 3 years. OP2, to thank Barbados, Ecuador, and United States of America for the services rendered to the organization during the past 3 years by their delegates on the Executive Committee. With this, I conclude my reading of the proposed resolution, Mr. President.
Okay, thank you very much for that. And if there are no objections, and that would be indicated at first by a show of hand on the electronic platform, and I see none, I do declare the resolution adopted. And of course, I want to express my congratulations to the 3 countries who have been elected to the executive committee. And being Jamaican, I want to recognize Jamaica for its efforts and contribution, as I do for the other 2 members, Argentina and Bolivia. Thank you very much. We proceed now to item 6.1, selection of 2 member states from the region of the Americas entitled to designate a person to serve on the Policy and Coordination Committee of the UNDP, UNFPA, UNICEF, WHO, World Bank Special Program of Research, Development, and Research Training in Human Reproduction. I would like to bring document CD 5914 to the attention of the council, and would like to ask the secretary to present the item and to report on the statutory provisions concerning this item. Madam Secretary, your mic is muted. Can you unmute, please? Thank you.
Thank you, Mr. President. Can you hear me now?
Yes, I can.
Thank you. The HRP is the main instrument within the United Nations system for research in human reproduction, bringing together policymakers, scientists, healthcare providers, clinicians, consumers, and community representatives to identify and address priorities for research to improve sexual and reproductive health. The HRP is based at WHO headquarters in Geneva. The HRP Policy and Coordinating Committee is its governing body, responsible for reviewing and approving HRP's plan of action, budget, strategic plans, annual financial statements, and periodic reports, among other functions. The HRP Policy and Coordinating Committee includes 14 WHO member states elected for 3-year terms according to population. The region of the Americas has been allocated 2 members to serve on this committee. In electing HRP committee members, due consideration should be given to the country's financial and/or technical support to the HRP and its interest in family planning, research and development in human reproduction, and fertility regulation, as demonstrated by national policies. The term of office of Argentina and Trinidad and Tobago expires on 31 December 2021, and thus the Directing Council, in its capacity as Regional Committee of WHO for the Americas, must elect 2 members. Two members to serve for the period beginning January 1st, 2022 to 31 December 2024 to serve on the HRP Policy and Coordinating Committee. In accordance with the rules of procedure of the Directing Council, if the number of candidates does not exceed the number of vacancies, Rule 51 states, elections shall normally be held by secret ballot, except that concerns the election of an interim director. When the number of candidates for elective office does not exceed the number of offices to be filled, no ballot shall be required, and such candidates shall be declared elected. Thank you very much, Mr. President.
Thank you very much for that. I would like to remind member states that 6 candidates were originally received for this committee: Argentina, El Salvador, Nicaragua, Panama, Peru, Uruguay. As discussed at the meeting of heads of delegation last Friday, the 17th of September 2021, Argentina, El Salvador, and Peru withdrew their candidacies to facilitate consensus. So 3 candidacies remain, Nicaragua, Panama, and Uruguay. I do understand that there have been negotiations and would like to ask if any one of these three member states would like to take the floor at this time. Mr. Moderator.
Thank you very much, Mr. President. We recognize Panama.
Muy buenos días a todos ustedes.
A very good morning to everyone.
Como país,
Panama, as a country
dos posiciones
who presented its candidacy for one of these two positions in the Committee on Policy and Coordination of the UNDP, UNFPA, UNICEF, WHO, World Bank Special Program of Research, Development, and Research Training in Human Reproduction. And as a country taking steps to allow others who have not yet served in this position, and being a country that likes to foster progress, we have decided as a country to withdraw our candidacy so that WHO PAHO may achieve consensus, and also to allow other sister nations to serve in these positions, particularly those who have yet to serve in such position. Thank you.
Thank Canada for the intervention, and I yield the floor back to the President.
Apologies. Okay, let me thank you for that intervention from Panama, and to recognize your recognition of the collaborative approach that's so necessary to advance the public health agenda in the region. Your intervention will appear in the decision of the final report. So the council will note, and as a consequence, therefore, we have Nicaragua and Uruguay as the remaining candidates, which therefore, according to Rules 51, will therefore advance them to sit on this particular committee. Thank you very much for that. I think there is tremendous spirit of collaboration, and that augurs well for the organization. We proceed to the next item, item 6.2, the election of 3 members to the Advisory Committee of the Latin American and Caribbean Center on Health Sciences Information. I would like to bring documents CD 5915 to the attention of the council and ask the secretary to present the item and report on the statutory provisions concerning this item. Madam Secretary. Madam Secretary, are you? I think your mic is muted. Madam Secretary, your mic is muted. Okay, I think it's now unmuted. Can you speak now, please?
Yes, thank you, Mr. President. I'm not sure if you can hear me right now.
I'm hearing you now, so you can go ahead. Thank you.
Thank you, Mr. President. Yes, I must apologize, Mr. President. I am having very serious problems here and I cannot locate. I would ask, Mr. President, I would ask if Monica can help me out on this. I am having serious problems with my computer. And Monica, I must apologize again. I would ask you if you can help me out reading the appropriate secretary notes. My computer has crashed.
Okay. Okay, we fully appreciate that technology sometimes is unreliable.
My mouse died and I can't move my screen.
Okay, fine. While you work on that, I'll ask Ms. Zaccarelli to fill in as Assistant Secretary.
With pleasure, with pleasure. The Latin America and Caribbean Center on Health Services Information, BIDEMI, is a specialized center of PAHO established in 1967 with headquarters in São Paulo, Brazil. In accordance with BIDEMI's statute, Resolution CD 49R5, the center's objective is to contribute to health development for the populations of the region of the Americas, promoting cooperation among countries, the democratization of access to scientific and technological information, legislation and sharing of knowledge, and evidence to support steady improvement of health, education, and research systems. In accordance with the governance structure established by its statute, BIDEMI consists of 3 permanent bodies: 1, an advisory committee; 2, a scientific committee; and 3, a secretariat. The advisory committee is composed of 2 permanent members, 1 appointed by the government of Brazil and 1 by the director of PAHO, and 5 non-permanent members selected and named by the conference or the directing council of PAHO from among BIDEMI's membership, described in Article 4 of its statute. According to Article 6 of BIDEMI's statute, the selection of the 5 non-permanent members should take into consideration geographical representation and be rotated every 3 years. However, the conference and the directing council of PAHO may indicate a shorter rotation period in cases where it's necessary to maintain balance among members of the advisory committee. This directing council is asked to elect 3 non-permanent members to serve on BIDEMI's advisory committee on the expiration of periods of Grenada, Mexico, and Uruguay. Since the number of candidates does not exceed the number of vacancies, Rule 51 of the Rules of Procedure of the Directing Council provides. You all know Rule 51 by now, but let me read it again. Elections shall normally be held by secret ballot, except as concerns the election of the ad interim director, when the number of candidates for elective office does not exceed the number of office to be filled, no ballot shall be required and such candidacies shall be declared elected. Thank you, Mr. President. This is the report.
Thank you very much for that. Thank you very much. I informed council that since there are only 3 candidates pursuant to Article 51 of the Rules of Procedure of the Directing Council, and those 3 candidates are Chile, Guatemala, and Trinidad and Tobago. These 3 candidates are designated to serve on the Advisory Committee of the Latin America and the Caribbean Center on Health Sciences Information. I will now therefore ask our rapporteur to submit the proposed resolution.
Muchas gracias, señor presidente.
Thank you very much, Mr. President. Proposed resolution. Election of 3 members to the Advisory Committee of the Latin American and Caribbean Center on Health Sciences Information, BREMI. The 59th Directing Council, bearing in mind that Article 6 of the statute of the Latin American and Caribbean Center on Health Sciences Information, BREMI, establishes that the Advisory Committee of BREMI is to be comprised of one representative appointed by the Director of the PASB and one by the Government of Brazil as permanent members, and that 5 non-permanent members are to be selected and named by the Directing Council or the Pan American Sanitary Conference of the Pan American Health Organization, PAHO, from among the BREMI membership, which at this time includes all PAHO member states, participating states, and associate states, taking geographical representation into account. Recalling that Article 6 further states that the 5 non-permanent members of the BREMI Advisory Committee should be rotated every 3 years, and that the Directing Council or the Pan American Sanitary Conference of PAHO may indicate a shorter rotation period in cases where it is necessary to maintain balance among members of the Advisory Committee. Considering that Chile, Guatemala, and Trinidad and Tobago were elected to serve on the BREMI Advisory Committee beginning 1 January 2022, due to the completion of the term of Guyana, Mexico, and Uruguay, resolves 1, to declare Chile, Guatemala, and Trinidad and Tobago elected as non-permanent members of the BREMI Advisory Committee for a 3-year term, 2022-2024. 2, to thank Guyana, Mexico, and Uruguay for the services provided to the organization by their delegates on the BREMI Advisory Committee over the past 3 years. Thank you, Mr. President.
Thank you very much. I now open the floor to the plenary for discussion and invite delegates, of course, to use the electronic platform to raise their hand if they have a comment. And I'll ask our moderator to manage this section of the proceedings.
Thank you very much, Mr. President. We will take note of the request for the floor from member states for this agenda item. And Mr. President, seeing none.
There are no objections to the 3 nominees for this advisory committee of the Latin American and Caribbean Center on Health Sciences Information. I do declare that Chile, Guatemala, and Trinidad and Tobago have been duly elected to this position and declare the resolution adopted. Good, we're making good progress. And I want to again take the opportunity to congratulate those delegates, countries that have been elected to the various positions to guide the organization over the next number of years. Very important responsibility. I do see a hand up, and I'm going to ask our moderator to recognize the delegates and allow for the contribution.
Thank you very much, Mr. President. We recognize Guatemala.
Buenos días, señor presidente.
Good morning, President, ministers, delegates from member states, Director of PAHO. Guatemala is pleased to be part of the advisory committee of BREMI for the next term. Thank you very much.
We thank Guatemala for that intervention. And we are, if you could give us a couple of minutes, we're double checking on further requests
Is there any other?
from the
Okay.
floor.
Buenas tardes. Buenos
Hey,
días,
Luis.
Ibis.
Good afternoon, good morning.
We recognize Chile.
Thank
You
you.
have the floor.
Muchas gracias. Buenos días.
Thank you
Ibis
very
Par-
much and good morning. I'm speaking on behalf of Chile. President, delegates, as a delegation, we're very pleased to have been appointed as a country to the Latin American and Caribbean Center on Health Sciences Information BREMI. We very much welcome this appointment and will contribute to adopting more IT to promote the creation of more sources of technical and science information and steps. We fully endorse the mission of the center in contributing to the development of health in Latin America and the Caribbean, and also take on the task of making it easier to gain access to scientific information. The interpreter points out the feed has frozen. And to also make this information more visible in order to have a larger impact locally, regionally, and globally. We recognize the effort to spread scientific knowledge for the betterment of the region, and as a country, we have also benefited from these efforts. We also believe that there is a lot more work to do, which is why you can count on our full cooperation in order to achieve this mission. Thank you.
We thank Chile for the intervention. And Mr. President, I don't see additional requests. Over to you.
Okay, thank you very much for that. And we will therefore proceed to items 4.8, strategy for building resilient health systems and post-COVID-19 pandemic recovery to sustain and protect public health gains. I would like to bring document CD 5911 to the attention of the council and invite the representative of the executive committee to report on the item.
Muchas gracias, Presidente.
Thank you very much, Mr. President. The Executive Committee expressed support for the proposed strategy and its lines of action. Delegates agreed that the pandemic has highlighted existing weaknesses and demonstrated the importance of sustained investment in health systems. The committee underscored the need to build on the lessons learned from the pandemic, build more resilient health systems to protect the public health gains, and ensure the continued delivery of essential health services during future health emergencies. The importance of ensuring access to safe, efficacious, and high-quality medicines and other health products was also emphasized. Several delegates underlined that the need to enhance capacity for national protection of health products in order to avoid shortages and supply problems. Delegates also highlighted the need to bolster the capacity of human resources and health systems to adapt to emergency situations and respond to sudden large increases in demand. The need to protect the health workforce, including with adequate supplies of personal protective equipment, was stressed. It was pointed out that strengthening the resilience of health systems is essential to protect not only health, but also social and economic development. The need for renewed effort to achieve the Sustainable Development Goals was underscored. Delegates suggested that several aspects of the strategy could be enhanced, including by placing greater emphasis on ensuring appropriate training of human resources, improving core capacities for public health risk assessment, and addressing the social, economic, and environmental determinants of health. It was recommended that the issue of mental health should feature more prominently in the document, as should the need to address the long-term health and economic impacts of the pandemic on children and young people. The committee adopted resolution CE 168.R12, recommending that the directing council approve the strategy. Thank you, Mr. President. This concludes my report on this item.
Thank you very much. I open the floor to the plenary for discussion and invite delegates to use the electronic platform to indicate an interest in commenting, and of course, our moderator to manage this segment of the proceedings.
Thank you very much, Mr. President. And before taking note of the request for the floor, I'd like to remind delegates of a few pointers for their interventions. Please remember that the time allocated for the interventions should be limited to 3 minutes, and you should speak in a paused manner so as to allow all of the delegates to fully understand your intervention and facilitate the role of the interpreters. Additionally, please, when you make your interventions, name your country, name yourself, and the agenda item you are referring to so as to properly reflect your interventions in the final report of the meeting. Having said that, I would give the floor to the delegation of Mexico, followed by the United States.
Buenos días, Alejandro Svarch.
Good morning, Alejandro Svarch from the Mexican delegation. The COVID-19 pandemic showed the demanding need to step up the pace so that the right to health will not only be an objective, but a concrete response, unwavering when dealing with the many needs faced by the population. Mexico strongly coincides with the framework in order to achieve universal health and universal coverage is by promoting resilient health systems based on primary health care that will be comprehensive and that will have people-centered families and communities at the very core. Thus, we will eliminate the 4 barriers: economic, geographic, cultural, and gender barriers that have an impact on quality healthcare services with the technologies and opportunities that will guarantee its utmost effectiveness. In April 2019, Mexico welcomed the launch of the report of the High-Level Committee of PAHO on Universal Health in the 21st Century, 4 years of action, a space to reflect on the growing challenges for health systems, challenges that go beyond the health environment and that represent geographic, social, and environmental determinants such as aging of the population, climate change, mass migrations, and political and economic problems. Along these lines, we find these efforts that are being deployed in order to attain universal healthcare and with increasingly more resilient systems in order to deal with the COVID-19 pandemic. The problems that were already affecting our populations and tomorrow with other epidemiological outbreaks or health emergencies in the future. We acknowledge international cooperation offered by the Pan American Health Organization to member states in order to attain these goals and the objectives set forth in plans, programs, and projects of our countries. Within a framework of transparency, celerity, and technical and scientific support, thus responding to expectations on health and the demand from our population. We complete our statement reaffirming the support of Mexico to this proposed resolution, which is necessary in order to strengthen the governing role of our institutions, bringing the social commitment of providing coverage of health services to our populations at the top of our agenda, combating the distance with solidarity, having trust in a better union of our institutions, and betting on the construction of a health system, always, always, always of a public nature and for all. Thank you very much.
We thank Mexico for the intervention. We will now yield the floor to the United States, followed by Honduras.
Thank you, Mr. Moderator. With respect to agenda item 4.8, the United States appreciates the inclusion of this item on resilient health systems and pandemic recovery and supports the proposed resolution. Resilient health systems require sustained investment. Healthcare systems that are underfunded, lack planning and infrastructure, or with chronic workforce challenges will face more difficulty in becoming resilient and in supporting pandemic recovery. In particular, we would like to highlight the importance of trained health workforce as a necessary prerequisite for a resilient health system. Resilient health systems are better positioned to achieve equitable resilience of individuals and communities when they leverage cross-system approaches, working with a multi-sector approach to proactively address foundational and long-standing inequities. The United States supports the call for global, regional, national, and subnational action to invest in, protect, and address the needs of health workforce. Such measures should include enhancing the availability and quality of training and supplies, including personal protective equipment and standardized infection prevention and control practices, ensuring access to medical care in underserved areas and communities, and recognizing the significant benefits of preventative healthcare. The resolution and attached strategy can help us as a region to develop health systems that can respond, recover, and sustain capacity during day-to-day operations and in times of crisis. The United States looks forward to exploring how the region could work together to address needs in this area. The United States would like to propose that PAHO convene a technical or other committee to discuss and consider ways in which the Americas region can address the issue of health systems resilience and pandemic recovery approaches. And we would volunteer to be part of that committee. The struggle to get qualified medical professionals across the spectrum of medical services will be one all PAHO countries face, and we must start our work now. Thank you.
We thank the United States for the intervention. We recognize Honduras, followed by Jamaica.
Muy buen día, gracias, señor presidente.
Good morning. Thank you, Mr. President. Honduras fully agrees with what is included in the proposed resolution, which is in addition to other strategies that have already been defined by the Pan American Health Organization, and which we hope will accelerate changes in order to improve the response to the COVID-19 pandemic, and will enable us to quickly and progressively recover essential services in order to respond to the prevailing health problem that has emerged as a result of the pandemic. Special emphasis should be placed to the fact that Honduras has carried out an updating exercise for the National Plan for Containment and Response to COVID-19, which includes the 10 pillars proposed for that response: coordination, planning, funding, and monitoring, emphasizing risk communication to the population, community participation, and managing infodemics, which to a large extent is having a huge impact on the response by the population to all the risk containment measures within the framework of the pandemic: surveillance, epidemiological research, traceability, tracking of contacts, and adjustment of social and public health measures, taking into account all the points of entry to our country, including migrants. Transportation and international travel. Emphasis is also being placed on labs and diagnosis, prevention and control of infections, and particularly protecting our health personnel. These 10 pillars implemented in an articulated fashion can give a timely, comprehensive, integrated response and quality response to the population through the already established programs in our health systems. in order to reinstate and protect the achievements in public health that have already been reached in the region of the Americas. Because of all of the above, we kindly ask the Honorable Directing Council to consider approving the proposed resolution as submitted. Thank you very much, sir.
We thank Honduras for the intervention. We recognize now the delegation of Jamaica, followed by Canada.
Mr. President, Jamaica would like to commend PAHO for providing this in-depth review of building resilience in health systems. The COVID-19 pandemic has been an unprecedented challenge and an unforeseen opportunity. It has exposed long-standing deficiencies in our health systems and has highlighted the need for a whole of government and whole of society approach to enhancing public health capacities. Many countries, as the pandemic unfolded, have wondered what resilience looks like, as we have been surprised in the lack of resilience where we thought it would be, and the taken for granted strengths in places where we never expected it. We are cognizant of the emphasis that is once again being placed on developing strong primary healthcare systems. Jamaica has a good primary care foundation and a community health program that was the backbone of our initial response to the pandemic. This primary care wall allowed us to manage prevention and containment with oversight that was provided by strong emergency and disaster management coordination, whilst we built capacity in our hospitals to face the onslaught of the inevitable surges. The pandemic has afforded us the opportunity to build capacity in several areas and to point us to areas that need further strengthening. We have scaled up responses at our ports of entries and increased our capacity for implementing and monitoring quarantine and isolation across the island. We have increased in our hospitals the capacity for isolation and for high dependency care and have implemented surge plans at different response levels. We have improved the capacity in our national laboratories for RT-PCR testing and have implemented algorithms for antigen testing in several hospitals. The private sector has also increased capacity for testing, and we have strengthened the monitoring and reporting framework so that the overall capacity for a national laboratory response is enhanced. We have improved in utilizing surveillance data in implementing rapid responses to emergency situations. Yet there are several areas that require more attention to provide elasticity to our health system that will ensure resilience in the face of natural and man-made disasters. Learning from the lessons of this pandemic, strong collaborative multi-sectoral approaches are required to ensure health in all policies that must be a cornerstone of resilience of not only the health system, but the social and economic fabric of our countries. Jamaica is appreciative of the proposed strategic approach and fully endorses the resolutions. We recommend, however, that more emphasis be placed on building resilience in information management, risk communication, and public relations within and without the health system in normal times, pre-pandemic and inter-pandemic times. This, we believe, is an important pillar of recovery as it can enhance or diminish a country's efforts at strengthening other areas. As we move forward, we recognize the urgency to build resilience and look forward to the continued support and leadership from PAHO in implementing the strategies outlined. I thank you.
We thank Jamaica for the intervention. We recognize Canada, followed by Peru.
Mr. President, I'm delivering this intervention as Canada's youth delegate to the 59th Directing Council. Canada welcomes PAHO's continued work towards strengthening health systems in the Americas and advancing the goals set forth in the 2030 Agenda for Sustainable Development, and commends its policy development to guide member states in building resilient health systems, particularly as we look to shift from the pandemic response to recovery. In my role, I've heard from youth across Canada who strongly support improving the resilience of health systems to ensure that they are responsive to the needs of all individuals, particularly the most vulnerable, marginalized, and those populations at greatest risk of negative health outcomes. This includes Indigenous peoples, individuals of low socioeconomic status, and those experiencing homelessness. Responding to the needs of all individuals will require addressing the social, economic, and environmental determinants of health through a health equity and gender lens, supported by comprehensive and accurate data collection and evidence-based interventions and policies. As the surge of COVID-19 cases resulted in resources being diverted to fight the pandemic, many women and girls were left without access to adequate maternal and sexual and reproductive health services, thereby widening gender inequality in the region. Therefore, gender gaps and barriers to accessing health services must be addressed to ensure universal access to sexual and reproductive health and rights, to eliminate preventable maternal mortality and morbidity, and sexual and gender-based violence, and to achieve the Sustainable Development Goals. As the region moves ahead with these efforts, multi-sectoral action involving a range of interrelated fields will be required to adequately address the social, environmental, and economic determinants of health and truly build back better post-pandemic. In addition, improving access to gender-responsive health services for all women and girls, including members of marginalized communities, require initiatives that decentralize health systems by strengthening the role of primary healthcare to reach vulnerable groups and ensure that their concerns, needs, and priorities are addressed. This will advance women's full and equal participation in decision-making and empower them to share the demand-drive health system. Canada is pleased to note that our comments have been reflected in the latest iteration of the strategy, highlighting the importance of mental health support in these resilient building efforts post-COVID-19, as well as including the considerations of the generational issues of the long post-pandemic recovery of children and youth. In tackling this generational issue, it's essential that youth have equal participation in decision-making, understanding that decisions made today will impact the youth not only now, but also in their future. Finally, as we look to shift from the pandemic response to recovery, Canadian youth call upon member states to work towards the creation of a new normal, one that's more equitable, ensuring that the priority populations experiencing marginalization are not left behind. Thank you.
We thank Canada for the intervention. We now recognize Peru, followed by Brazil.
Gracias, señor moderador. Señor
Thank you,
presidente.
distinguished moderator, Mr. President. Sarela Solis from Peru. The president shows that the impact that the COVID-19 pandemic has had on the health of the life and subsistence methods in the Americas, leading to an economic and social crisis characterized by massive unemployment, impoverishment, and the exacerbation of inequalities. The result on health in the region of the Americas, particularly everything that has to do with the vulnerable groups, identifies the obvious problems of segmentation and fragmentation of health systems, the persistence of low levels of public investments in health, the hurdles in having access to cultural and other factors, the gaps in the capacity, and the need of the health personnel and the scarce capacity to resolve in the first level of care. The resolution contributes to strengthen leadership, governance, and stewardship in order to carry out the strategic lines of action for the establishment of resilient health systems and for progress to be made on the transformation of health systems of the entire government and society, with intersectoral action in order to deal with the social determinants as well as environmental and economic determinants of health, and to prepare sectoral plans of action as well as intersectoral plans that will strengthen these functions integrated in the policies and the budgetary cycle of the country by increasing and enhancing the capacity of health services networks in order to improve access and to be able to overcome fragmentation, including the capacity to manage and coordinate networks, planning and managing human resources, digital transformation, and the strengthening of information systems for health, the availability and managing critical supplies such as medicines and other health technologies, as well as infrastructure, community participation, and the development of response plans that are adaptable, increasing and maintaining public investments in health towards the attainment of a universal healthcare. paying special attention to the development of the capacity in order to untangle the essential functions of health and to enforce the international health regulations and to give priority to investments in the first level of care to support the provision of health services, integrated services, both individual as well as for the population at large. Nothing more in keeping with the Peruvian health policy that was announced through the model of integrated care. Because of all of the above, Peru is in favor of the approval of this proposed resolution. Thank you.
We thank Peru for the intervention. We now yield the floor to Brazil, followed by Colombia.
Good afternoon, Marina Pitela from the Brazilian delegation. The COVID-19 pandemic evidenced that strengthening resilience in health systems is an imperative in order to protect and promote health and social and economic development. As was well enshrined in the document, the pandemic evidenced the capacity to respond, which is adaptive in the health system, showing challenges that had not been tapped by existing parameters, and which when translated into practice during the critical times of the pandemic. Brazil supports the strategy for building resilient health systems and post-COVID-19 pandemic recovery to sustain and protect public health gains. We believe that the main elements of this strategy have to be: one, to ensure access to medicines, safe, effective, efficacious, and quality drugs, investing in a health surveillance mechanism. At three, increase national production and transfer of technology, and four, strengthening primary healthcare services. We would like to submit together with PAHO the planning of a post-COVID scenario. So for the COVID health system, rehabilitation of post-COVID patients in a new frontier. We believe that we have to repair our health systems in order to offer rehabilitation services that are adequate for patients to fully recover from COVID-19. Therefore, we want WHO and PAHO to urge members in preparing their national health systems for a post-COVID recovery. They could contribute through the establishment of protocols, diagnosis for patients, as well as sharing recent experiences and best practices for rehabilitation of patients. Thank you very much.
We thank Brazil for the intervention. We recognize Colombia, followed by Cuba.
Gracias, señor moderador y señor presidente.
Thank you, distinguished moderator, Mr. President Grecia Amarilla, the Colombian delegation. We would like to thank the Secretariat for the document presented on the post-COVID-19 pandemic recovery, which is of great interest to our country. Our countries, and in particular our health systems, not only are to concentrate their efforts on mitigating the emergency of these effects as a result of the COVID-19, but we ought to concentrate our efforts and capacities on attaining the Sustainable Development Goals, and in particular the goals and objectives set forth in number 3. Colombia, as a part of a strategy launched by the national government, has deployed huge efforts in order to have a resilient health system where, in spite of the difficulties of flaws and changes in the environment as a result of the COVID-19, has maintained its operation in order to ensure the provision of services for the benefit of our citizens. However, we are always open to improving our capacity for the continuous provision of services that will contribute to protecting the achievements in public health. In this regard, we want to highlight the proposed strategy that is brought to our attention by the organization today, which undoubtedly will enable us to strengthen national strategies for the provision of services in priority areas such as mental health, attention given to the elderly, people with disabilities, rehabilitation, maternal and child health, non-communicable diseases, immunization, as well as others. From our country, we stress at the importance of a strategic line 4, where we stress at the need for having additional investments in order to develop the capacity to perform essential roles in health, in public health, such as those related to the enforcement of the IHR and reducing and managing risks and disasters. This taking into account that the more investments we have for the implementation of the IHR, more steps will be taken in order to achieve regional health security. Likewise, we want to stress the strategic value of the inclusion of follow-up and evaluation in these strategies, considering that their implementation is a long-term approach and therefore a medium-term approach and evaluation will enable us to take actions in order to attain the objectives set forth and strengthening the strategies that so require. Last but not least, please allow me to express the commitment of Colombia with the implementation of this strategy and our agreement with the proposed resolution. Thank you.
We thank Colombia for the intervention. We now recognize Cuba, followed by Suriname.
Thank you, Mr. President. We would like to thank the Secretariat for the document presented. This pandemic has brought about a social and an economic crisis with negative impacts all across the board and essentially on the life of people. For health systems, this has been quite a challenge because they have brought to a limit their capacity, forcing them to take immediate actions with a positive element which has been encourage investments as a form of response to this serious crisis. The post-COVID stage will lead to a return to normal in the life of people and countries, gradually and asymmetrically, with the essential principle of avoiding new outbreaks of the disease and developing capacities in order to deal with it so as to reduce risks and vulnerabilities. We believe that the strategic lines of action proposed reflect the main aspects that we have to work on in order to achieve resilient health systems with well-trained and prepared human resources and the capacity to face future situations and based on primary health care. In this post-COVID recovery and going back to normal, moving forward with the vaccination of our populations is a basic element, as has already been said. Only by attaining 90% of the population vaccinated will we be able to control the situation and to allow for the rehabilitation and reactivation of the economies that have been so seriously affected by this pandemic, as well as other facets of social life of people. Besides, we need to step up epidemiological surveillance, adequate enforcement of the IHR, and to implement the lessons learned, thus to act on the weaknesses of health systems, to move forward with recovery and to be better prepared when dealing with future situations. In this process, the support provided by the organization is essential, together with strengthening cooperation among countries. We need a greater exchange to share experiences and better planning of resources in order to strengthen health systems in the region. Thank you very much.
We thank Cuba for the intervention. And before we continue to give the floor to those that have requested the floor, I yield to the President for some announcements.
Thank you very much. In light of the time and we are going to break here. We do have a side event that is going to take place during the lunch break. So we want to break here on item 4.8, and we will pick up after the lunch period. Before I give you an idea of what we will cover after lunch, I'm going to ask Ms. Zaccarelli to give us an announcement. Ms. Zaccarelli, announcement as to what would happen during the break.
Mr. President. Good afternoon. So a kind reminder that for those accompanying the side event at lunchtime, a comprehensive response to tackle the prolonged crisis resulting from the COVID-19 pandemic, the strategic link between health and economy, you will stay in this same virtual room. The side event is scheduled to start at 1 p.m. and run until 2 p.m. Thank you very much.
Thank you. Thank you very much. So we'll break for lunch. After lunch, we will have item 7.1, the PAHO Award for Health Services and Management 2021. We will try to do that first, and then we will resume where we have left off here prior to lunch with item 4.8. And time permitting, we will take item 8.1, which is updates on COVID-19. So that's the plan for the post-lunch period. And I would certainly wish for you a good lunch period, and for those who are staying on, a good session on the side event. Thank you very much.
The Americas have been hit hard by COVID-19. In March 2021, after intense preparations, countries were ready to introduce COVID-19 vaccines with the help of PAHO. When the first vaccines from the COVAX facility became available, PAHO's revolving fund delivered them to the region. Here's what it took to get there. For decades, PAHO has worked with countries in the Americas to achieve their immunization goals with a lifelong approach and strong adult immunization services, making it the first region in the world to eradicate smallpox, be declared polio-free, and eliminate other vaccine-preventable diseases like rubella. PAHO helped to analyze and review vaccination plans and consolidate demand to allow all countries to purchase vaccines at affordable prices. Throughout the COVID-19 pandemic, PAHO has supported COVAX, aiming for equitable access to COVID-19 vaccine doses in the Americas. Because we are not safe until everyone is safe.
Hello, world. My name is Mia, and I am the first digital worker in the Pan American Health Organization. I am a proud procurement technician. I have been looking forward to working at PAHO. I started my job on Monday, March 29th, 2021. On my first day of work, I supported buyers by processing the repetitive parts of purchase orders for strategic products, including COVID-19 vaccines, under the COVAX Initiative for the Americas. I'm available 24 hours a day, 7 days a week. I am happy to contribute to the rapid purchase of vaccines for all the countries in the region. I look forward to working with you. Thank you very much.
us.
Individually, collectively, universally.
Every person,
Family.
Community.
We are happier when we have each other.
Healthier when we stand together.
every one of us matters.
No one should be left behind.
We all have the same fundamental right
To health and happiness.
To the care we need.
wherever we live.
Whatever we have or do not have.
Regardless of age,
Race,
Language.
culture, or circumstance.
This is our mission.
We stand together with all people
In every community, every country, throughout the hemisphere.
Because we are healthier.
together.
We are the Pan American Health Organization, working for health for everyone, everywhere.
Hello, I am Max, a virtual logistics technician for PAHO's Procurement and Supply Management Department, PRO. My role is to process orders relating to COVID-19 supplies and vaccines. Helping automate procurement takes a load off my human colleagues, enabling them to focus on other essential tasks contributing to the global pandemic response. I can digitize information, process shipping information, fill out shipping forms, and track shipping numbers, flights, carriers, total number of shipments, and more. I can also create advanced shipping notices, upload shipping documents, and fill out the batch information in purchase orders. I am available 24 hours a day and 365 days of the year, since shipments can arrive in countries at any day or time. Thank you, PAHO, for having me.
Hola mundo, mi nombre es Mía y soy la primera trabajadora digital de la Organización Panamericana de la Salud. Soy técnica de adquisiciones y en mi primer día de trabajo apoyé a los compradores procesando las partes repetitivas de las órdenes de compra de productos estratégicos, incluidas las vacunas COVID-19, bajo la iniciativa COVAX para las Américas. Trabajo las 24 horas del día, los 7 días de la semana. Estoy feliz de trabajar en la OPS, ya que contribuyo a la compra rápida y efectiva de vacunas para todos los países de la región. Muchísimas gracias por recibirme y por permitirme trabajar con ustedes.
The Americas have been hit hard by COVID-19. In March 2021, after intense preparations, countries were ready to introduce COVID-19 vaccines with the help of PAHO. When the first vaccines from the COVAX facility became available, PAHO's revolving fund delivered them to the region. Here's what it took to get there. For decades, PAHO has worked with countries in the Americas to achieve their immunization goals with a lifelong approach and strong adult immunization services, making it the first region in the world to eradicate smallpox, be declared polio-free, and eliminate other vaccine-preventable diseases like rubella. PAHO helped to analyze and review vaccination plans and consolidate demand to allow all countries to purchase vaccines at affordable prices. Throughout the COVID-19 pandemic, PAHO has supported COVAX, aiming for equitable access to COVID-19 vaccine doses in the Americas. Because we are not safe until everyone is safe.
Olá, eu sou o Max. Eu sou um técnico de logística virtual para o departamento de compras da OPAS. Minha função é processar os pedidos relacionados a suprimentos e vacinas no combate à Covid-19. Ajudar na automatização das aquisições para a OPAS tira uma grande carga de tarefas dos meus colegas humanos. Eu posso digitalizar informações, processar informações de envio, preencher formulários de envio e rastrear números de remessa, voos, transportadoras, número total de remessas e muito mais. Eu também posso criar notificações prévias de remessa, fazer o carregamento de dados sobre os documentos de uma remessa e preencher com informações necessárias para efetuar pedidos e compras. Obrigado, OPAS, por me receber.
Buenas tardes, colegas que quisiera confirmar si algunos de los panelistas, además de Alicia, están ya conectados. Yo creo que Alicia no estás en la dirección adecuada, parece que entraste como participante. Excellent. Mr. Pearson, are you in?
Yes, I'm here.
I may still need someone to stay to turn off so it doesn't get feedback. I don't know. So you may have to. Yes.
Amalia, ¿estamos listos?
Sí, estamos listos.
Dame tu micrófono apagado.
Estamos listos. ¿Me escuchas?
Y escuchamos bien, Amalia.
Perfecto.
No, espérate. ¿Cuál presentación? Disculpa.
Perdón.
David, me indican cuándo puedo iniciar.
David, could you please let me know when we can kick this off? And I'd like everybody to please mute their microphones. Everybody, microphones off. We're ready to start.
Doctora, ¿podemos comenzar?
Doctor, we're ready to start. Excellent. Good afternoon, everyone, and welcome to this side event, a comprehensive response in health and the economy to the protracted COVID-19 pandemic. Taking into account the health and the economy, as a part of the 59th Directing Council of the Pan American Health Organization. It will bring together an analysis of current challenges, particularly those that have to do with the social inequity and health with the population, and a debate on the most effective strategies that will enable us to control the pandemic and to promote the strengthening of health systems with resilience. It is a pleasure for me to welcome the representatives with her today. We have Dr. Jarbas Barbosa, the Assistant Director of PAHO, the Executive Director of the Economic Commission for Latin America and the Caribbean, ECLAC, Alicia Bárcena. Alicia, once again, welcome to this home of health of the Americas. We also have with us three representatives, delegates from the Directing Council, the Minister of Health from Jamaica, Christopher Tufton, who is also the president of this Directing Council, the head of the Canadian delegation to the 59th Directing Council, Michael Pearson, and the Minister of Health of Chile, Enrique París. So with these excellent collaborators, we begin this session. I simply wanted to remind everyone who is participating this afternoon and the panelists that this is a 1-hour side event. So in order to make the best of the time and to be able to finish on time, before we go back to the afternoon session of the Directing Council, I kindly ask you that you stick to the time allotted for your presentation. So without further ado, Dr. Barbosa, you have the floor for the opening remarks. Dr. Barbosa, please. Thank you very much, Amalia. Good afternoon, everyone. All those participating in this side event. The region of the Americas continues to be one of the most unequal regions in the world due to its high levels of the informal sector, urbanization, poverty, social exclusion, and inequality, as well as the fragility of the health systems and social protection. Countries in the region of the Americas have shown significant vulnerabilities, in particular, vulnerabilities to epidemiological shocks, disasters, or economic and social crisis. It is in this regard that the need for articulation between health and the economy as central and necessary components in order to face the challenges of the pandemic brought about by the COVID-19 pandemic has been brought to bear as a result of the serious social impact triggered by this pandemic, making it impossible to have an approach exclusively from public health measures. Therefore, as a result of this, since last year, PAHO and ECLAC began a joint work agenda geared towards strengthening and supplementing their technical cooperation in countries, particularly aimed at providing support in the design and implementation of public policies that will face current and future challenges. These two international organizations share a health approach as a basic right and a public good that ought to be guaranteed and ensured by the state through public policies with intersectoral interventions that will deal and address the main economic and social factors as well as health post-crisis. This cooperation materialized in the course of 2020 in the first joint document, and it is strengthened through 2021 with the development of a new document that is concentrated on the comprehensive response from health and the economy in order to face this protracted pandemic and its impact. In the first document, the work was based on the premise of basing the ineligible link between health and the economy as central elements in order to interpret the problem and understand the path ahead of us. The epidemiological issues therefore could not be addressed in an isolated fashion as a respect to social components. And at the same time, it was clear that we could not have economic recovery, sustainable recovery, without controlling the pandemic. During that second work, we concentrate this on short and medium-term recommendations in order to implement a sustainable agenda for institutional transformations that will guide necessary structural changes in order to ensure the right to health by the population. It is within that context that it is necessary to reinforce the objective of creating resilient health systems that can address challenges in a context of profound uncertainty. Besides, the current document lays bare on the fact that the control of the pandemic as well as the economic response call for leadership and an effective and dynamic stewardship by states through national policies that will bring together health policies, economic policies, and social policies. It is in that sense that we attempt to strengthen the transformation agenda for health that since the approval of the Universal Health Agenda, PAHO has been supporting in the region, emphasizing an integrative approach of it as part of the set of social policies in order to address the environmental, economic, political, and social determinants of health. Thank you, Amalia. Back to you. Thank you, Dr. Barbosa, for your opening remarks. And the first part of this seminar has to do with an analysis from the regional point of view. And beginning with the social and economic impact of the COVID-19 crisis, looking at it from a regional perspective analysis. And for that, we have Alicia Barcena, the Executive Secretary of ECLAC. So Alicia, you have the floor. Thank you very much and good morning, everyone. I'm very grateful for this invitation, dear Amalia, and I greet Jarbas Barbosa and through him, to Carissa Etienne, saying that we're very pleased because of the joint memorandum that we're signing on October 7. We will submit a joint document between PAHO and ECLAC. I simply wish to express my greetings to Christopher Tufton, Minister of Health of Jamaica and President of this 59th Directing Council. So I greet you, Christopher, as well as Michael Pearson, the head of the Canadian delegation, and most especially Enrique Paris, the Minister of Health of Chile. So my most sincere greetings. So I begin with a regional analysis, a perspective analysis, as I was told, with the social and economic impact of this COVID-19 crisis. I'd like to stress the following facts: that there's an increase in global asymmetries and access to vaccines. Also in wealth and financing, we see with concern that the gaps have opened between developed countries and developing countries. COVID-19 enhanced the structural weaknesses of health systems in our region. And we are faced with a paradox of this recovery, because even though we will see growth in 2021 and 2022 because of a statistical rebound and because of private investment, there's very little genuine growth. So it is not that inclusive and transforming. We see an increase in poverty, inequality, informality, and unemployment, and they will remain for several years, which will demand the continuity in government supports. And what is urgent is to have transforming recovery strategies, emphasizing investment in equality and sustainability in strategic industrial sectors. And in here, obviously, I am referring to the manufacturing industries, pharmaceutical industry, and funding of primary healthcare services. First, take a look at the asymmetries, and these are two. One is within our region, and the other one is our region vis-a-vis the rest of the world. And here we are reflecting the percentage of the population older than 18 with this complete vaccination schedule as of September 15. And we see that Chile, Uruguay, and Ecuador head the list of the complete vaccination schedule. It might very well be that they have higher figures, that they even have a higher level of vaccination. But we see with concern that countries such as Haiti, Nicaragua, Jamaica, Guatemala are under, at least below the 20% level. St. Lucia, Guatemala, St. Vincent and the Grenadines, and Jamaica as well, and obviously Haiti. And regarding the rest of the country, US and Canada that have already reached these figures, in the European Union, 74.1, the US and Canada, 69.6. Our region does not have the complete schedule. We have 47.3 as an average and 26.3 in the Caribbean. So in the General Assembly, where I am today in New York, An appeal is launched so that developed countries that have concentrated 39% of the procurement commitments, having only 13% of the population, will deploy greater efforts in order to support COVAX, or else to have a better distribution of vaccines, surplus in some cases. In most of the cases, I would say, our region has been seriously impacted in development. Only 8.4% of the population, and we have 1.5 million deaths at a global level. And the social consequences have truly been huge, economic consequences, as we've seen. Alicia's message, her screen is frozen. Well, the pandemic finds us with weak systems in the region. You can already take a look at the funding that we have. This is a financing level that doesn't even reach 6% of GDP, which is a goal agreed by members of PAHO in 2014. We only have a few countries in our region, Argentina, Uruguay, and Cuba, that do make it to that level. Chile in 4.6, Nicaragua 5.1, Colombia 5.5. But we ought to reach at this goal of 6% of GDP, as was agreed on by countries. Once again, there's some countries that are lagging behind, as you can see here. And as an average, public expenditure in health over GDP in our region is up 3.8%. In countries of OECD, it surpasses 7%. And we also see another issue with great concern, which is the high out-of-pocket expenses that is truly quite significant for countries in general. This means that there is public underfinancing that leads to great dependency on out-of-pocket expenses that as an average represents 33.6%. Take a look at the case of Guatemala, that is all the way up to 58%, which is out-of-pocket expenses in health. It is a very high figure, while other countries, OECD members, have a 21% level because they have more universal health systems. We call this the paradox of recovery, because it is a paradox. Why? Because in fact, we had a huge drop in growth, 6.8%. There was a 5.9% recovery this year, and the next one in 2.9. But the recovery this year is a statistical rebound and not, in fact, reactivating investment with structural changes. And the recovery of GDP will not be sufficient in order to reach, for example, an increase in employment that is so important, or increase productivity. And here this is broken down by countries. And we see that obviously the rebound that we see in 2021 has a lot to do with the statistical drag and other factors, that is to say, increase in exports. You can see China and the US. And there's also private consumption that was stimulated and encouraged by the social transfers made by governments in a very effective way. So we see that all the way up on the chart, we have Guyana that has oil, we know that, but we also have Panama, Peru, Chile with significant growth figures. And by the way, in 2021, we see how this will come down now later on, and we will reach the trend that we had historically, which is a bit lower. And only nine countries in 2021 recover their levels of economic activity that they had in 2019. And obviously in 2022, we add to this 5 additional countries. What struck us the most, and Jarbas already mentioned this on how, or what was the greatest impact, and why are we the most affected region? We see that Latin America and the Caribbean had a drop in GDP that was much greater than advanced economies, that Asia in development, and even African, sub-Saharan Africa. It was the most impacted region in economic terms, and in unemployment, we had very high levels in our region compared to the rest of the world. And I would say that populations, or the sectors that have suffered the most, is the informal sector, young people and women. And we see here that the participation of young people between the ages of 15 and 24 already in 2019 had a major disadvantage compared to the rest of the population, between the ages of 25 to 64 with high levels of unemployment in the informal sector. And here we see women on the right-hand side that had significant access to the labor market. And so we see now that we're going backwards. That is to say, women looking for employment of 49%, which drags us back to a decade. It takes us back to 2008. And we also see that if we had not had any public social transfers, poverty and extreme poverty, and this is compared with and without transfers, countries would not have had any social effort in emergency transfers. And if we had not had that, poverty would have reached 230 million people. Fortunately, with these transfers, fortunately in quotes, we have 209, which is no panacea, but at least we're able to see that almost 21 million people did not fall into extreme poverty thanks to these transfers. And the same thing happens with extreme poverty. With transfers, we have a level of 78 million people. If we had not had these transfers, we would have been at 98. And we must acknowledge that in our region, 32 countries had to cover 395 million people, 59.6% of the population. And another factor that was very helpful in family income are the remittances from the big ones. They had record unprecedented amounts in Mexico as well as in Central America. What we did see is greater inequality in the distribution of income, undoubtedly. Now, in 2021, if we do not have the same level of emergency transfers, moreover, if they collapse or if we eliminate these transfers from household or to household, then poverty will definitely see an increase. And so we see that the level of expenditure that we've seen so far in 2021 is of only 0.8% of GDP in 2020. In 2020, the expenditure level was of 1.55. So we're halfway. And that is quite concerning because this could bring down the coverage given to the population from 49 to 29%. So we would go from 326 to 231 million people. And extreme poverty could go up and reach a 14.8, and poverty in general could reach a 35.2 level. There are countries that have already said that they will extend this to the end of this year. And there are other very interesting measures, and it is that they have been replacing emergency measures, but by some labor measures, that is to say, support for those who find a job in the formal sector, and that the government can give them a compensation. This is being done by Chile. We analyze that, and we believe that this is a very interesting strategy in order to support the return to formal jobs. So we're faced with the risk of a lost generation in occupation, in employment. This is a reality. We've seen that we have 167 million students that lost one whole year of in-person schooling with a huge impact on their learning. And we run the risk of having 3.1 million young people, boys, girls, that will drop out of school. And this is of serious concern, because on top of this, this is linked to food insecurity, to what is called breakfast, lunches, school food that also affect our youth and our children. And we also have a huge digital divide in Latin America and the Caribbean, 66 million households that are not connected to the internet, adequate internet services. And in fact, we've seen also a backlog in teenage pregnancy. And this is something that we've seen with the UNFPA 5 years going behind in reducing the rate of teenage pregnancy. So this is quite concerning. And this is what we find with tertiary and secondary schools, where some young people might not go back to school. And obviously preschool education, pre-K, where it is difficult to do tele-education with our younger kids. And another problem is food insecurity. I know that for PAHO, this is an issue of concern, particularly in our region, the impact of food insecurity, which truly increased in a very significant way, particularly in the Caribbean, in Latin America as a whole, obviously throughout the entire world. But in Latin America, the level of food insecurity, serious, severe, moderate, had major increases, particularly in the Caribbean. And this has to be carefully analyzed. The same thing happened in Central America. It is urgent then to promote a transforming recovery, emphasizing the investment in sustainability and equality. And therefore, we in ECLAC proposed, first and foremost, to be very concrete as to where we're headed, where to address our public expenditure. On the one hand, we have to promote investment. Investment is a bridge between the short and the medium term. Our region has a 17.6 in investment, the public and private investment. This is a level in GDP percentages. And take a look at the average. The average is 26.3. Obviously, developed countries don't need that much of an investment in infrastructure. The emerging economies have a 32.9 level. So at least we have to go to the average to increase the investment in 10 points. And this will call for expansive fiscal policies in order to protect social protection and for investment. And we will have to increase the fiscal space, avoiding evasion, reducing tax expenses, and obviously receiving international funding in more concessional terms. We will have to talk about progressive collection, the reach of taxes on income, ownership, wealth, the royalties, they should be equivalent to international standards. We should go up and not down, raise to the top and not to the bottom. And obviously to include the gender approach throughout the entire fiscal cycle. We have proposed 8 sectors that we believe are those that might achieve this very significant transition because they propose technical changes that they bring employment and they reduce dependency and energy transition towards renewables. There are many countries that are already working on that, even with significant direct foreign investment, to invest in basic services and primary healthcare, electromobility, digital inclusion. And in here, I'd like to mention the health and manufacturing industry with a regional approach. And I will emphasize that this sector in particular, and obviously the appraisal of these solutions that are based on nature, marine and land, circular economy, and sustainable tourism, which are so relevant, particularly for the Caribbean and Central America. And now I'd like to refer to the manufacturing industry and health with a regional approach, because I believe that there is an urgency there to move towards a greater health self-sufficiency. We've already seen the asymmetries in vaccination and the difficulties that countries had to go through in order to obtain vaccine, the high dependency on imports. And when faced with these phenomena, the SELAC asked ECLAC to develop a health self-sufficiency plan that was approved on Saturday unanimously, and where they agreed on 7 lines of action and prioritizing, by the way, the supply of vaccines in the short term, medicines through regional and sub-regional mechanisms, including COVAX, to strengthen COVAX and to strengthen the revolving fund of vaccines of PAHO, to give a priority to strategic coordination between health, the economy, finance, and industry in order to address the chronic underfinancing of health, research, and technological development, and obviously starting off on the basis of an important foundation, which is coordination amongst the 6 entities that have level 4 in terms of regulatory entities recognized by WHO, which are so important in the region, and to use the PAR network of PAHO and existent capacities and skills in the region. The plan, and this is a summary of it because I don't have a lot of time, they deal with 2 objectives. One, the short-term goal, which is to accelerate the access to vaccines and vaccination processes, and in the medium term, to strengthen technological and productive capacities of our region, and obviously to ensure a stable market, research and development, and to facilitate local production. The document, and I can gladly share it with you, both in English as well as in Spanish, has an inventory of capacities in vaccines and research in the region of production. We know what countries can produce or what pharmaceutical companies, what chambers or what associations or what regulatory systems we have, what flexibilities when dealing with intellectual property, and what are the sponsors. So we have over 135 sponsors of clinical essays and how to strengthen primary health care systems. We offer 7 lines of action regulatory recognition convergence, a regional platform of clinical assays, immediate mechanisms for procurement of vaccines at a regional level, or at least to share them amongst us, consortia, public or private sectors for development and production of vaccines based on what we already have in some countries, Argentina, Brazil, Mexico, Chile, that is truly moving forward with this. Cuba, the development of a regional market, a stable market, because medicines are an industrial complex, a very important complex that generates a lot of jobs, but it also calls for a long-term approach and obviously universal health system access. And we have to do this in close coordination with PAHO, and that is why we're signing this agreement. And the health sector in countries in the region, it is urgent for you countries, for you ministers of health to be involved. And therefore, a universal health strategy, as you have discussed this in PAHO, in order to strengthen primary health care. We've discussed this with Carissa to improve planning processes, access to essential medicines at a local level. Those countries with a good system of primary health care were those that achieved the most with a very effective vaccination. And in keeping with the proposal of PAHO to devote at least 30% of the budget of the public sector in primary health care, and to support these efforts with a regional approach, which is what SALAC did in convening us, and to have a sub-regional ministerial meeting of Comisca in Central America, the Andean Community, the Pacific Alliance, Mercosur, CARICOM, PROSUR, CARPHA, where we can discuss this issue and where we can see how to strengthen the sub-regional and the regional elements. And last but not least, we have to move to well-being. We understand that we have to restructure health and education and to achieve a society of care towards our communities with very short-term proposals to maintain transfers of basic income, but also a basic basket, industrial policies, technological policies for these 8 sectors that I proposed, and the regional integration. We cannot give up. Our region needs additional cooperation amongst us, and we are there, PAHO and ECLAC and many other institutions at the IDB, and they can provide a huge assistance as well as other regional institutions. But in order to do that, we must also bring here to the United Nations, and this is what is happening here in New York, a debate in order to overcome the deficit in international solidarity. Thank you very much for your attention. Thank you, Amalia. I hope that it has been of interest, and I'm very grateful for your attention.
Una excelente presentación y en aras del tiempo paso.
Thank you, Alicia, for that excellent presentation. And now I give the floor to Dr. Jarbas Barbosa, who will be presenting the other side of the coin, or the complement to the coin, something that you included in your presentation. You spoke a lot about health because it's a logical thing to do, but now I give the floor to Dr. Barbosa. Thank you.
I will share my screen. Thank you very much. I want to thank Alicia. I think that's a very comprehensive presentation and clearly highlighting the very important links between health, the economy, social development, and the environment. The pandemic, if anyone had any kind of doubts about these links, the pandemic, I think that was a very important statement that we need to bring together all these dimensions. The pandemic also has worsened the existing inequities in health that we have in the region, and is also compromising public health gains in our region: maternal mortality, immunization coverage, cancer, hypertension, diabetes, and many other chronic diseases that are suffering from the lack of access to medicines to control the disruption in health services during the peaks of transmission. We have some uncertainties yet about the future of the pandemic that I will very briefly address. Now we have some factors that we really don't control, and as we always say in public health, it's better to be prepared for the worst case scenario and pray and hope that the best case scenario will happen. And also, I think that is important to highlight that the role of the state is crucial. if we don't have this kind of comprehensive response that Alicia Bárcena mentioned many times, and also to lead the health system transformation, rethinking, adapting, being innovative, to get the health systems working to achieve the sustainable development goals, including universal health. As you know, COVID-19 cases, it was, if we have most cases happening among adults and young adults, the elderly men were disproportionately affected by death. So this is a very important characteristic of the pandemic in the world and in our region too. We also taking the Sustainable Development Index and the accidents that occurred due to the COVID-19. It's very clear that the countries that have the lowest Sustainable Development Index presented at the same time the most important excess deaths related to COVID-19. Here we have a snapshot about the interruption of essential health services in our region. Many countries reported the slight disruption, moderate disruption, and even severe disruption. And it's important to highlight that primary care was the most affected because nurses and physicians were diverted to hospitals, to emergency rooms, because people were not feeling comfortable to go to a health center. For many reasons, we really have had a very important impact in many public health priorities in the region. Vaccine deployments, as you know, is still a big challenge that we have. Just to mention that we still have 10 countries in Latin America and the Caribbean that have not protected with fully vaccinated schemes 20% of their population. So we are still lagging behind to protect the most vulnerable groups that we have, the groups that have a higher risk to develop a severe form of COVID-19 and to die due to the disease. We have some in the document that we are launching with CEPAL. We have some forecasts about what can happen. Now we are taking account the public health and social measures that are very important, that we know that can prevent the transmission, not only against the original virus, but also against the new variants, wearing masks, keeping social and physical distancing, avoid crowded spaces. Also, the vaccination coverage dynamics that is changing almost every week, and as the outcome, hospitalization and deaths. With this, we established these 4 scenarios, and the relevance that we have to present this is to highlight what are the strategies that you can implement to transition from low public health and social measures, low coverage, that unfortunately we still have some countries in the region that are here in this situation, to move all of the countries in the region to the C situation where adequate public health and social measures are adopted, and the countries can achieve a high coverage. This is the best scenario to control the transmission of COVID-19, to recover the economy, to reduce the very important social impact that the pandemic is providing. We have some uncertainty because the virus can change. We can have new variants of concern that if we don't control the transmission everywhere in every country, as we know, we always can have new variants as a natural development of the virus. We also have to work harder to ensure equitable, timely, and affordable access to vaccines and supplies. This is very important to control the transmission. The capacity for effective implementation of immunization programs. Vaccines are essential, but we need many other activities to ensure a good vaccination campaign. We need to prepare the healthcare workers. We need to review the cold chain capacity. We need to have a very strategic communication, a very comprehensive communication strategy, to address vaccine hesitancy in some groups of the population. We also need to address the socio-economic and political structural conditions and the social, cultural, and behavioral aspects that in every pandemic that request that the people change their behavior. This is always a challenge. The recommendations that we are proposing in this document to accelerate vaccination and strengthen technology capacity, first, to ensure effective and homogeneous coverage of vaccines. As I mentioned, not only to have the vaccine, they are essential, but also to provide all these aspects. PAHO is working with the countries. From the beginning, we are providing technical cooperation to strengthen their national immunization plans, to address specific challenges that we have. Probably Minister Tuffan will address this, but in the Caribbean, we have a problem with vaccine hesitancy that the Ministry of Health have to address, and also how we can get the vulnerable population social, economic, and cultural barriers that can prevent the people to get their vaccines. We also need to increase regional technological capacities, as Alicia also mentioned, and this is important that we can work together. Yesterday, we have two very important events. First, our Directing Council approved unanimously a policy document, a very strategic one, asking the member states to work together, asking the Secretariat to provide technical cooperation to increase and to strengthen the capacity that we have in Latin America and the Caribbean to produce medicines, vaccines, and medical products. And at the same time, yesterday, we have also announced the two first hubs that we have in Latin America and the Caribbean to develop and produce this new technology for vaccines, the mRNA vaccines. Yesterday, we announced a public project in Brazil, a private project in Argentina that will receive technical cooperation to be a very concrete step to move forward this important achievement to increase the regional technological capacities. We also need to strengthen primary health care. This is very important that we can, at the same time, increase the public expenditure in health, but how to split this budget to have primary health care fully funded with the human resources trained with the capacity to provide a comprehensive package of care to the people, including prevention, promotion of health, surveillance, and all the public health priorities that we have. Also important to call the attention for the intersectoral focus to our health policy. It's very important to strengthen at the country level this dialogue between the Ministry of Health and the other ministers and other sectors in order to build up agendas that can address in a comprehensive way not only the health care, but also the social and economic determinants that are very important to change for the better or for the worse the health of the population. Finally, we also believe that's very important to promote solidarity between countries with regards to vaccine procurement and other health technologies. The PAHO's Revolving Fund, as you know, is providing this kind of access for 42 years now, and we are working with the countries to strengthen their capacity. At the national level, to encourage and to stimulate dialogue between health, finance, international relations, industry, in order to have this comprehensive response to this very important public health crisis, to articulate and harmonize technical cooperation between international, regional, and national actors. As we have been working together yesterday during the announcement of the two projects we had in the Inter-American Development Bank that addressed the topic offering financial support to the projects. We are working, also inviting the Ministry of Industry, Commerce, Economy to be part of this dialogue, the two regional dialogues that we had about this topic. How to strengthen regional and sub-regional governance mechanism in health. We have a very well-established mechanism in the Caribbean, in Central America, in South America. We are still dealing with the need to strengthen the sub-regional mechanism that can put together or to come together all the countries on the same objectives. We have very good dialogue with Prosur, with CARICOM, and with CIFCA, and I think that this also can be a very important platform to strengthen solidarity and cooperation, collaboration that is crucial to the response. Thank you. These are some of the ideas that are presented in our document. Over to you, Amalia.
Muchísimas gracias, Dr. Barbosa, y verdaderamente.
Thank you very much, Dr. Barbosa. And yes, the approach here is fully comprehensive as we look at this from a regional perspective. We are now going to hear a national perspective, which, as we know, is where the more difficult fights are waged.
Tufton to give us the perspectives from Jamaica. Minister, the mic is yours.
Thank you very much, and thanks to those who have spoken before me. Very comprehensive, and there's a lot that we can learn from this. The COVID-19 pandemic has placed a tremendous burden on health infrastructure globally, resulting in a huge cost of lives lost, social displacement, mental health challenges, and economic fallout. Approximately 20% of persons require hospitalization, and maybe 5% require high dependency care. With over 200 million confirmed cases and over 4 million deaths, it is clear that the number of admissions have stressed health systems across the world. Many who are not ill enough to be hospitalized are sick at home. With a rapidly spreading infection, there is a clear impact on the workforce. As the numbers soar, there is no question in our minds that preventative measures had to be put in place. The measures to prevent the disease, prevent social interaction, and the conducting of businesses in a normal way. In other words, there have been side effects to the COVID response. It was clear that the businesses that depended on social interactions would suffer the most, and other businesses that could not adapt would also suffer. In a region that depends heavily on tourism, and in countries where economies depend on service industries, there is bound to have been an economic fallout. The pandemic has resulted, therefore, in a health crisis, a social crisis, and an economic crisis. For many developing countries, COVID-19 has affected and will continue to affect the debt burden, investments, human capital, and labor market participation, as well as global trade and supply linkages. It is important to understand how the pandemic has affected the economy. COVID-19 has led to a global recession, which has been described as the deepest since the end of World War II. In 2020, the global economy, which was forecasted to grow by 3.4%, contracted by 3.5%. Despite this, the world economy, according to the World Bank, is poised to stage its most robust post-recession recovery in the last 80 years in 2021. That is good news, but the rebound is expected to be uneven across countries as major economies look set to register strong growth, even as many developing countries or economies lag behind. In addition to this, Latin America and the Caribbean are characterized by a high dependence on imports of raw materials, medicines, and other health technologies from other regions. ECLAC, for example, estimates that in 2018, only 4% of a Latin American Caribbean series of health products imports came from the sub-region itself. This forecast of a vastly different recovery process for developing and developed countries will result in many countries in our region grappling with the effects of the COVID-19 pandemic for a very long time to come. Let me now turn my attention quickly to the Jamaican experience. Figures from the Planning Institute of Jamaica show that for fiscal year 2020-2021, from April 2020 to March 2021, Jamaica's real GDP contracted by an estimated 11%. Most industries have been affected due to reductions in the demand and supply of goods and services. The largest contractions were recorded in the high contact industries such as hotel and restaurants, down 65.5%. Other service industries, which included recreation, entertainment, and sporting activities, down 28.2%, and transport, storage, and communication, down 13.6%. The contraction in economic activities has affected employment also. There was an 11.9% reduction in employment in July 2020 relative to January 2020. To put this into perspective, employment in Jamaica declined by 7.7% over a 3-year period due to the global economic crisis, which started in 2008. The impact of COVID-19 are obviously worse. These developments are expected to lead to increase in poverty and inequality. The challenges experienced socially as a result of the COVID-19 pandemic are far-reaching, spanning several sectors. There have been disruptions in service delivery in education, health, and assistance to the poor. In terms of program delivery, programs which rely on face-to-face methods of service provisions have been impacted by measures implemented to limit the spread of the virus. The road to economic recovery will be determined by how quickly the public health system can reduce the threat of the COVID-19 disease to the economy through effective preventative measures such as behavioral change and vaccinations, and adapt to the increasing demand on the health sector by increasing resources to manage COVID-19 cases, such as that it does not affect the delivery of routine health services. While public education and vaccination campaigns are ongoing, behavioral change and vaccination are largely dependent on several factors that are outside our immediate control and may take time to achieve, especially with emerging variants and increasing COVID fatigue. Governments must recognize that increasing capacity must proceed hand in hand with increasing the pace of vaccinations. And that's always a challenge for several reasons. As the health system must learn to accommodate COVID-19, so also must the business sector. Several factors will affect recovery. The ability of firms and workers to pivot, to implement policies to stem the spread of the infection in the workplace, and to apply innovations to allow businesses to continue despite COVID will make a difference in our recovery efforts. Health in all policies must now not only be a cliche that we call upon when convenient, it must become a way of life. Businesses must now build in their operation plans attention to infection prevention and control, emergency response plans, and contingency plans for health emergencies. The promotion of healthy lifestyle and the implementation of workplace policies that ensure a healthy workforce will contribute to a stable workforce. Finally, while some countries in our region have started the recovery process, the process remains fragile, given new variants and the level of debt which restrict the level of fiscal intervention. The economic outlook is at best precarious. Countries cannot afford to continue to open up and shut down as the number of cases increase or decrease. The health sector must have the flexibility to adjust to the new demand, whilst at the same time working to decrease demand for health services through prevention. Sustained and increased public financing in health will be required to support additional resources that are needed. Economic recovery is dependent on this. Economic recovery is dependent on all of us. Health is inextricably linked to our economic recovery. Thank you.
Thank you, Minister Tufton, and for acknowledging the important role of health for the recovery of the economy. Music to our ears. So with that, I pass on to Canada, Michael Pearson, for their presentation. The mic is yours.
Thank you very much. I'm always humbled to be between ministers, minister following and minister before. Very much appreciate the comments that are made by our elected officials, who ultimately are the ones who, are the ones most important to lead us in this kind of crisis. And I want to thank PAHO as well for the invitation to invite Canada to speak about some of our national perspectives and experiences, and particularly lessons learned. And I'll start by saying the most fundamental lesson learned for us or lesson learned is not the right word, the most fundamental reality for Canada, and it's similar with, I know, a number of PAHO member states as well, is that we are a federal state. And as a federal state, there are divisions of responsibility when it comes to health in particular, quite significant differences in responsibility that have been very important in the context of managing this pandemic or responding to it. As a federal government, of which I am a representative, we are responsible for overall national public health guidance and advice, obviously for managing international issues, including border management, for providing economic support to our publics, which has been a particularly important issue during the pandemic, how to ensure the economic impact of the pandemic, and particularly of the public health measures that were undertaken, can be mitigated. And by contrast, our subnational authorities, primarily in our case, provinces and territories, 13 in all, they're responsible for public health measures. So the measures that are taken, whether they're lockdowns or partial lockdowns or mask mandates or any of those kinds of issues, vaccine distribution or particular administration of vaccines, those are all at the provincial and territorial level. And I'm highlighting that to start with because that division of labor between the national and subnational authorities when it comes to public health management during a pandemic such as this one has an impact on how the overall country is affected and can implement a strategy for dealing with a pandemic. That will be the same in the future as it is today, but clearly the pandemic has been able to teach us some real lessons about how that collaboration between the national and subnational authorities can work effectively. Okay, I'll move to the next slide. So we have just a very quick picture of our current situation in Canada. The map of our country, as you see it there, is really a capturing of our current situation of infection rates. It reflects the fourth wave, which I'll come back to in a minute. We'll see that in the next slide a bit more, but you'll also see the different colors of blue there. You'll see the different impacts that it's having in different parts of our country. And this is at the current time. And this is what I want to just, from my earlier remarks, highlight is that depending on public health measures taken in different provinces, there is an impact on how the various waves of the pandemic have affected the public. So it's both not just a function of population, higher numbers in our two biggest provinces of Quebec and Ontario, but also a function of public health measures. So you see to the left there, Alberta is in a proportionally the most difficult situation right now. And that's a function not just of population, or in fact, as function as much of the public health measures and approach that was taken by the subnational authority there, as it were the numbers of people in that province. So that's one consideration just to highlight on the current side. Also on the current side, and the two bottom boxes in particular, I want to highlight on the right-hand side of that slide are the indication of what the fourth wave reality has been, and this is not unique to Canada, but is something, of course, that is very significant in our country. Number one is that the cases, which of course at the beginning of the pandemic were almost hugely disproportionate to people 60 and over, are now significantly disproportionate towards youth. Up to the ages of, from basically young children to 29 years old. That's one factor that we're facing in the fourth wave. The other one is what we're calling as it's been called in many other countries too, a pandemic of the unvaccinated. So about 75% of the hospitalizations and emergency ICU admissions are people who are unvaccinated or only partially vaccinated in Canada. A very significant difference, and indeed is having some impact on vaccination rates amongst those who are unvaccinated, but also as a reflection of the challenge that's faced in public health in trying to encourage people to be vaccinated. My colleague, the Minister of Jamaica, who spoke just before me, made a few comments about those challenges, some of which are in governmental control, and some behavioral change, and some of which are often less in our control. Next slide, please. So this is a really good snapshot of our experience over time, and I just want to highlight again, different countries have had different experiences, but in many cases, very similar ones. So the very far left, you talk about what I would say is wave one back in March of 2020, when the pandemic was first declared. Relatively low spike, as you see in that wave. And that was because of a major lockdown across the country, 90 to 95% adherence by Canadians to those lockdowns, willingness to stay at home, work from home, be at home. Obviously, different countries, particularly different member states in the PAHO region, don't necessarily have the same capacity that we had to be able to really lock down everybody. But that was the impact, an ability to try to quickly snuff out the impact of the pandemic on us. So that led to that bottom curve, or that curve there in the summer of 2020. Then you go to wave two, which is that second spike there. And that in wave three, over the fall and then winter of 2020, 2021, is a consequence of two things. One of the looser, what I would call looser or not consistent lockdowns between provinces and territories. And again, back to my earlier point about different provinces and territories took different public health measures to deal with emerging and rising infection rates. So different approaches having that effect. And obviously the length of whatever lockdowns were put in place, how long they were put in place for, again, different from different provinces and territories. Clearly the other impact, which was cross-country, was the variants, which of course an ongoing issue that we're managing even up to this day, as new variants of this insidious virus keep emerging, what impacts they have on the wave. So then that takes you to the right-hand side, wave four, which is obviously still ongoing, but where in some parts of the country we were already seeing plateauing and a drawing down, the pandemic of the unvaccinated, as I called it earlier. This is the impact also, of course, of the Delta variant. But again, the much lower peak there that you're seeing is because of vaccination. 80% of Canadians, almost 80% of Canadians, I believe, are now fully vaccinated. And that's clearly had an impact on the degree of the wave that we have faced in this, what we call the fourth wave. Next slide, please. So over that same time period that I just described, a little bit of a snapshot, apologies for the small text, I know this will be distributed to everybody, of the various actions, government and impacts on publics that were results of those actions. So if you look at the far left, the government action, the massive, this is what I would call the good news at the beginning of the pandemic, the clearly significant, including at the national level that I represent, huge numbers of decisions that were made to mitigate the impact of those lockdowns. So if people had to stay home, how to ensure that their jobs were not lost, that their employment was maintained, even if they were working from home, or even if they were just being at home. Restaurant workers or others who allowed, we had systems in place or mechanisms, programs in place to allow both employers and employees to still receive income, even though they were not able to physically work. This was a really significant and important, hugely expensive, but a public health decision that needed to be made by both federal governments, but particularly led by the federal government with provincial and territorial support. And at the bottom, underneath that, you see the adherence rate. 90% of Canadians adopt public health precautions. So this is the challenge. My Minister of Jamaica talked about fatigue. Well, obviously we didn't have fatigue at the outset. We had huge adherence at the outset. The challenge is, of course, over time, how do you maintain adherence, particularly as you go through these waves? And what are the economic as well as other and behavioral measures that you can put in place that address those kinds of questions? So as you move to the right, you start getting the bad news, higher unemployment rates, but again, mitigated by the ability to provide resources, funding to those who couldn't work. but the health impacts at the bottom there, the declines in mental health. This is something obviously we've seen consistently happening and even increasing over time as we go along. That notwithstanding being able to give people financial support, the impact of isolation on mental health is not to be underestimated, cannot be underestimated. Then as again you move across in the middle of this slide, there's a reference to at the top July Atlantic bubble. So I won't describe what Atlantic bubble means, except to say that we had in Canada, let alone what happened internationally, border measures put in place to mitigate the movement of people in order to mitigate in turn the spread of the virus. This had an enormously effective impact in our Atlantic provinces, who basically said to the rest of Canadians, you're not allowed in here. And as a result, they were able to actually manage the virus and the outbreaks in a very relatively low level over time. But again, that is a challenge, not just domestically, how you establish those kinds of isolation measures region to region, but the knock-on economic and other impacts, tourism, et cetera. Atlantic provinces are particularly popular in the summertime for tourism. At all times of the year, but particularly in the summertime, very little tourism could take place, internal or otherwise. That had an economic impact, but the decision made there to have a public health measure in place to mitigate the impact of the virus and then take the consequences when it came to issues like tourism. And so just it's really the impact of changing policies by different authorities over time as we move down and through, and this is obviously ends at March 2021. At the end, it's the beginning of the third wave that was really significant in April. But even there, you see January of 2021, one of our provinces, Quebec, introducing an overnight curfew, something which is common in many countries, including in PAHO, and not just for health emergencies reasons, but very uncommon in Canada, to actually tell people that between 9 o'clock at night and 7 o'clock the next morning, they weren't allowed to leave their homes, to get in a car and go anywhere, was a dramatic measure, an unprecedented measure, and I actually saw a public health benefit of that. But again, that was one province taking that decision. Other provinces did not take that decision, including Ontario, the province right beside Quebec, which never imposed a curfew. So, what are the impacts of these divergent policies and provincial approaches or subnational approaches? How do you manage a public health emergency in the context of those divergent approaches? It is a challenge, a lesson learned. How do you do that effectively? Next slide, please. Or 2 slides more, I guess, to slide 8. So, these are the things we have learned, and I want to highlight about lessons learned. There's a series of 7 there, and there's an 8th one that I want to come to, which is what I call the wild card. So what we learned, notwithstanding these divergent approaches that we've been taking domestically, is there are some things that did work well. Collaboration. So notwithstanding different approaches, a lot of conversation happening between public health authorities, in particular between national and subnational authorities, to try to see how much collaboration, both with respect to public health measures and with respect to economic measures. Is there ways that we could do things? And we've learned some effective lessons, and indeed did some things successfully to do that. Evidence-informed decision-making. This is one of the hardest things. How do you use science, which evolves constantly in the case of a pandemic like this, to inform decision-making? A lot of the debates that happen about mask mandates, for example, in Canada, and when they should be imposed and how they should be imposed and how long they should last, were based on on evidence that was evolving over time about how much of a threat any particular virus, the virus was, particularly as it mutated, and things happen there. So how do you do that in an imperfect way? Which leads to precautionary approach number 5 there. I want to highlight that we one of the ways of doing that is to say, okay, we're gonna be precautionary. We're gonna say, put masks on, keep them on. And that is actually what you're seeing today, even as we start moving out of the 4th wave, an ongoing public adherence to use of masks in Canada, which is unlike our colleagues from the United States, is not really a debate. There are debate in some areas, in some provinces, in some parts like Alberta, and what the consequence of that was. I'm not saying that one is completely related to mask mandate, but precautionary approach on issues like mask mandates have been something that have helped Canada through this. So I will not talk about all the other ones in detail, don't have the time, but I want to say there is a point 8 there, not highlighted, which is what I would call the wild card, and that is the impact of politics. again, what national authorities think is necessary and what's right to do, what subnational authorities think is necessary and right to do from a public health measure standpoint. We saw that played out at the national level in our election campaign, national election campaign, which just ended 2 days ago. Again, different parties have different approaches. This is going to be an ongoing challenge. How do you create unity, notwithstanding the fact that the politics will always create a division at the same time? Next slide, please. On the collaboration, again, just to very much highlight how collaboration for us focused on equity, among other things. And that's why we focused on racialized communities, indigenous communities, religious minorities, remote communities, a lot of these coming together. A lot of our indigenous communities live in remote areas of our country. How to make sure that we learn the lesson of H1N1 from 2009 in that regard, where indigenous communities were disproportionately impacted by the virus. We've reached out with vaccines, for example, to indigenous communities in Canada with the consequence, and early on with the consequence that infection rates amongst indigenous communities was significantly less, disproportionately less than it was in 2009 with H1N1. So these are things we've been learning lessons. How do you then try to apply those lessons from a public health perspective using various mechanisms in order to ensure that you not just mitigate to the public as a whole, but you mitigate with particular populations which can be more vulnerable. And that means, another example, you don't just have people come to a vaccine center, you take vaccines to local communities and you administer vaccines in local communities, particularly in populations which may not otherwise be willing to go to a vaccination center. Next slide, please. So again, I will not belabor this, but these are the economic elements that we took in place. I've spoken to some of those, and we're happy to talk further about that. Next slide. Our approach to vaccines. So this is what I just discussed, the various measures that are not just science-driven, but the transparency, the coherence approach, fairness and equity in particular, ensuring that we took that approach that ensured that all populations were addressed as effectively as possible. And by the way, one of the issues we took, and one of the things I think the regions have done as well in other parts of PAHO, is a mixed dose strategy. So lack of availability of certain vaccines, let's apply other vaccines. A lot of AstraZeneca, for example, applied in Canada early on, but a lot of people who took a second dose, which was not AstraZeneca, it was an mRNA, and that was based on science advice to saying the efficacy of that was okay, the safety of that was okay. So that was a decision, a public health decision that was made and had a clear, important impact on Canadians. Okay, now I'm going to skip to slide 13. Just looking ahead, I want to highlight 3 points. I know I'm over time. Strong public health system, how important that is. Risk communications, how important it is to communicate with your publics on an ongoing basis about why you're making decisions from a public health perspective. We're moving now, and we'll be moving eventually from a pandemic to what we'd call an endemic situation with these variants. We're not going to ever lose this virus, but how do we create basically a situation where it's like the seasonal flu, and we get people to address it on that basis? And then finally, that high quality evidence, public health intelligence, how important it is to work globally, not just locally, on sharing intelligence to inform decision making. And then finally, I'll just end off with our slide 14, the global snapshot. Those 4 pieces: mitigating economic and social costs, working towards health equity, containing the spread of new variants, and preparing for the future. These are all pieces of the puzzle that both the public sector and the private sector and other sectors of the economy need to work on together in order to ensure that we can be successful in not just ending this pandemic, but in managing future pandemics. Thank you very much.
Thank you very much, Mr. Pearson, and for highlighting principle number 8, and also for recognizing the necessity of health equity in the response. And with that, we go to our next presenter. Le paso la palabra.
I would like to offer the floor to the Honorable Minister of Health of Chile, Enrique París. Minister, the floor is yours. Thank you very much, Amalia. Thank you for having me. Allow me to acknowledge the Director of PAHO, Carissa Etienne. I imagine that she is listening in to the Executive Secretary of ECLAC, Alicia Barcena, whom I commend as well for her fantastic presentation. It provided great guidance. I should like to also acknowledge Alberto Arenas, who is with ECLAC as well, and whom I've known for many years. I wish to also acknowledge the Minister of Health of Jamaica, as well as the distinguished delegates who are with us for this side event. I'd like to begin by thanking PAHO for putting this side event together and also for allowing us to come on to share our experience regarding the strategic link between health and the economy. Everyone knows that the COVID-19 pandemic has had a number of impacts on health, on society, on the economy, among others, and has particularly affected those who are the most vulnerable. And this is very regrettable. This is something that usually happens with any pandemic and across all countries. This has also compounded the challenges that already existed prior to the pandemic. I would like to just, as a reminder here, mention a number of key issues: the fact that health is a right, how important social factors are, as we heard from the Executive Secretary of ECLAC a number of times, also the need for an inclusive approach. And of course, how important it is to try to be as collaborative as possible, particularly as countries in Latin America and the Caribbean. As we think about the differences that exist between countries, unfortunately, this is across a number of different dimensions, one of these being access to vaccines. This is why it's important to both recognize and continue to boost efforts from PAHO through mechanisms like COVAX, but also what we have heard during this event, which is that Latin America and the Caribbean need to increase their R&D for scientific issues like producing vaccines for their countries, and to also ensure equal and fair access in a timely manner and ensure that everyone has access to vaccine programs. Now, in terms of what we're here to discuss, Chile, like many other countries, had to impose stay-at-home orders, seal the borders, close down schools. And we know that when you close down schools, many children also lose access to nutrition. This led to a decline in GDP that was upwards of 6%, as well as job losses that fortunately we have started to get back. All of this had an impact on household income, as well as the mental health of our citizens. Here in Chile, at least, the impact was severe. We know that medical leave for mental health issues is close to 30% higher than it has ever been in Chile. And there was an imposition on the government to increase public spending on medical issues and also provide support for individuals and businesses who are all impacted by the pandemic. Now, all of this is happening as health expenditures have been increasing. This went up in 2021 by 8.9%. And obviously, as we have heard during this session, we increased spending on primary health care. And I also agree with what other presenters have said. Primary health care is absolutely vital. It needs to be a priority and it needs to meet the needs of individuals, but not where we are, rather where they are, close to where they work and close to where they live. Under these circumstances, the government needed to go back to its toolbox in order to find the best way to address the consequences from this pandemic. And there were 4 tools that turned out to be key. The first was an action plan to combat the coronavirus. It started with building hospital capacity and tripling, and in some sectors, quadrupling the number of beds in ICUs in our public hospitals. Obviously, this also led to increasing our staff and increasing use of technology, as well as other equipment that needed to be distributed. Also, there needed to be an integration for public and private healthcare facilities. And this is key. This was something unprecedented in Chile. There were prices set for receiving care in ICUs And the same rate was set for both public sector hospitals and private hospitals, which was an eye-opening experience for us because it led to talk about healthcare reforms in order to ensure that there is universal healthcare, or at least to allow everyone in Chile to have the same kind of care, whether they go to a private hospital or a public hospital. This sort of coordination was necessary in also combating efficiently this pandemic and ensure that there was an integrated hospital network, which was once again unprecedented in Chile. Testing, traceability, and isolation capacity was also built with 20 million tests administered. That is over 1.1 tests per inhabitant. These are PCR tests as well as antigen tests. We have contracted or hired rather over 10,000 contact tracers for our strategy and also implemented 26 contact tracing facilities throughout the country. And we implemented the strategy for over 8,000 beds in healthcare facilities, which have benefited from the support of PAHO. There was also a social safety net created for more support for families. This evolved over time. And here it's fair to say that when we take a look back, it's easy to understand why there has been criticism in the beginning, but as time went on, assistance for families increased. And there was a fiscal response that was put into place, securing close to $30 million for those who needed it the most. Those funds allowed for strengthening the social safety net and providing coverage to close to 15 million Chileans. 3/4 of all people in Chile are covered, and these steps include emergency family assistance, as well as employment protection laws, COVID-19 bonds, as well as other financial assistance instruments, solidarity assistance for the middle class, employment subsidies. This was an initiative that was started with the pandemic, with the offering of groceries for households, which we believe that was going to be key in addition to any financial resources. The third point was the step-by-step plan, and this was a phased reopening strategy in order to address the pandemic based on the reality of each of the specific spots in the country. As you know, Chile has a very peculiar layout. We have different climates, we have different realities across the country. And obviously, this plan here was what allowed us to make decisions more region specific. This helped us curb cases of infection and exercise caution as we implemented these steps. And this was all based on evidence-based recommendations, as well as WHO and PAHO recommendations, as well as the COVID-19 Advisory Council that we established and provides guidance to the Ministry of Health, and is made up of experts. The vaccination plan was the fourth item, and developing the COVID-19 vaccine was something that from the beginning in Chile and throughout the world was seen as a vital tool to combat the pandemic. Now, in light of all of this, and understanding that immunization is a public health strategy that is very effective, and that in addition to health benefits, this can also improve economic and social performance and help economic development in Chile. There were steps taken to ensure access to vaccines. For this, there was an interagency committee. This was also mentioned by other presenters. This allowed for joint work with the Ministry of Technology, of Health, of Foreign Relations, as well as a scientific advisory committee that had been working in Chile for a long time, but in this case, it specifically focused on COVID-19 vaccines. So far, this has helped us get over 90% of our target population vaccinated. We have over 13.8 million who have received the first dose of the vaccine, and 88% of the target population is fully vaccinated. This is 13 million people. In addition to all of this, and very early on, we started to provide booster shots. The recommendation from the WHO was to prioritize these doses. This is why we prioritized the elderly as well as patients with chronic diseases and who were immunocompromised. And so far, we have 2.7 million individuals who have received a booster shot. And that is not always with a booster shot of the same vaccine that they received for the first two doses. And this was all decided based on the antibodies that were found in tests for these individuals. Also, with the approval that we've gotten from the equivalent of the FDA in the US, we've started to vaccinate children 6 and older. We know that it's important for children to go back to school, and we know that usually as the virus tries to stay alive, it looks for those who are unvaccinated. And so we found that the best way to keep the virus from continuing to spread and from mutating was to vaccinate this age group. We've also provided primary care to our government employees, and this is why we believe we need to continue to bolster our primary health care. Thanks to work done by city officials and by government employees at all levels, we were able to advance these steps and also thank the Chilean government for what we were able to do by working together with a number of different labs. We would like to hail the efforts of PAHO for its work on advancing vaccines and other health technologies. We know that challenging times usually come with an opportunity to think about ways to move forward and to think about things differently. We have a university that is currently working with a European business in order to manufacture or at least to help approve the manufacturing of vaccines in Chile in order to also provide these vaccines to the rest of the countries in Latin America and the Caribbean, and not only within our country. I would like to also highlight here what Alicia Bárcena mentioned when she said that it's really important to boost manufacturing, specifically when it comes to health and research. This needs to be one of the good things that come out of this pandemic. And once again, we commend COVAX for that effort. All of this has been happening in a healthcare context that seeks to ensure that there is universal healthcare coverage by 2030. There are a number of the health targets that we had set that we have updated for the 2020-2030 period. We've also included environmental targets in our original targets involving the environmental ministry, and also looked at including autism as one of the issues taken on by the work that we're doing. Chile is also focusing on providing quality services for at least 85% of those who are suffering the most from health issues. Now, this is something that goes back to a tradition in Chile. In Chile, healthcare has always been seen as something that the government should provide and ensure is provided. This has been a challenge for the vaccines. And also the government cannot say that everything that needed to be done was done, because what we know is that what has happened in Chile has been the fruit of what many have done, and we have learned from other governments and from what others have done in the region. And the different conditions that have been included showed a sudden drop in 2020 for the services that were provided, and that is because chronic diseases and cancer treatment, surgeries, and other specialty doctors' visits had to be put on hold because of the pandemic. We hope to bring that back as the pandemic disappears. If we add to all of this the lack of physical activity, as well as the economic challenges that are linked to the pandemic, the road before us is daunting. But this is something that I believe that we can do in solidarity by bringing together all of the countries in Latin America and the Caribbean. And the reason for this is that we have heard this in other meetings and we hear this in the song. If we're all of the Americas, we're all brothers and sisters, and we're called on to work together. We thank PAHO once again for this opportunity to be part of this event of the Directing Council. Thank you very much. Thank you, Minister, and thank you also for your call for solidarity and for all of us brothers and sisters in the region to come together and to continue to wage this fight. So let me now offer the floor to Dr. James Fitzgerald, who is the Director of the Health Systems and Services Department. He's going to provide closing remarks as we move into the next session.
Thank you very much, Amalia. Just to really recognize the excellent comments and note the strategic linkages, I think, between health and the economy. And just to inform all the participants that we will be taking this agenda forward in the joint work that we are doing with CEPAL and launching the publication on health and the economy within the context of the prolonged health crisis in the region. So we look forward to that. That will be on October 7th, and we hope that everybody will be able to join us then. Thank you very much.
Thank you, James. Muchas gracias, James. Y con esto llegamos al final de nuestro programa.
Thank you very much, James. This brings us to the end of our agenda. We look forward to seeing you all on October 7th for the launch of the publication. Thank you all very much for being with us.
Gracias. Saludos a todos.
Gracias, muchos saludos.
Hi, Alicia.
Muchas gracias. Hi, Carissa.
Gracias,
Gracias.
Alicia. Hola. Doctor
Adiós.
Etienne.
Gracias, ministro. Gracias.
Thank you.
Adiós.
Everybody.
Let's give you 5 minutes to stretch your legs before we jump straight into the session of the Directing Council. So why don't we do that? We'll give you 5 minutes and we start the session of the council at 2:35 sharp. Thank you. Good afternoon, delegates. Mr. President, I'm glad to inform that we do have quorum. Mr. President, good afternoon. I'm glad to inform that we do have quorum to start the afternoon, if you would like.
Okay, good afternoon. Thank you very much for rejoining. Hope you had a good lunch and a little break. And for those who participated in the side event, very interesting event on health and economy, very well presented. And those who did not may wish to get the papers for that event because I think it's quite instructive. We could all learn something from it and help us with our policy. So as announced in the prior to lunch, we were going to return and complete items 7.1 and then go back to items 4.8. Item 7.1 is PAHO Award for Health Services Management and Leadership 2021. And I would like to bring document CD 5916 to the attention of the council and ask the representative of the executive committee to report on the decision of the award committee.
Muchas gracias, presidente. El jurado del premio OPS a la gestión y al liderazgo.
Mr. President, thank you very much indeed. The award committee of the PAHO Award for Health Services Management and Leadership met during the executive committee's 168th session in June. The committee consisted of representatives of Barbados, Costa Rica, and the United States of America. After examining the information on the candidates nominated by member states, the award committee decided to recommend that the PAHO Award for Health Services Management and Leadership for 2021 be awarded to Dr. Joanne Liu of Canada for her dedicated work assisting communities affected by the earthquake and cholera epidemic in Haiti, her efforts to support the strengthening of the health system in Honduras, her leadership in health emergencies and crisis response, and her commitment to delivering healthcare services to those living in situations of extreme vulnerability, all of which embody the key PAHO values of health equity and solidarity. Dr. Liu's work and advocacy in the fields of medical humanitarianism, crisis response, and health emergencies have been influential at regional and global levels, especially in the context of the COVID-19 pandemic, and now as the world prepares to build back better. That's it, Mr. President. This concludes my report on this item.
Thank you very much. Ladies and gentlemen, every year the governments of the countries of the Americas, acting through their representative at the meeting of the governing bodies of the Pan American Health Organization, confer the PAHO Award for Health Services Management and Leadership, previously known as PAHO Award for Administration, in recognition of an outstanding contribution in the field of administration within the framework of national health services. I'm pleased to confer this year's honor on Dr. Joanne Liu of Canada for her significant contributions to the region through her dedicated work assisting communities affected by the earthquake and cholera epidemic in Haiti, supporting health system strengthening efforts in Honduras, her leadership in health emergencies and crisis response around the world, and her commitment to delivering health services to those living in the most vulnerable situations, all of which encompass key PAHO values, such as health equity and solidarity. In addition, Dr. Liu's work has influenced her countries in the region and around the world, implement and advance medical humanitarianism, and her work on health emergencies will continue to guide current COVID-19 pandemic response and support recovery efforts as countries look towards building back better. Noting Dr. Liu's contribution in health services and management, it is for me a great honor to confer this award to Dr. Joanne Liu. I now ask Mr. Michael Pearson, Branch Head Office of International Affairs for the Health Portfolio Health Canada, Ottawa, and Head of Delegation of Canada to hand over the award to Dr. Liu on behalf of the Council.
Canada clearly is very pleased with the award committee's recommendation to confer this award to Dr. Liu. I will not repeat. I will only say what we often say in English is ditto to the comments that have already been made by the president and the representative from Costa Rica. And we very much appreciate this recognition of Dr. Liu and look forward to her remarks. I will add one thing, that she has most recently been the representative, or a representative, a Canadian, but a member, I should say, panel member of the Independent Panel for Pandemic Preparedness and Response, IPPR. And that, in our view, only further showcases not just her expertise and knowledge, but her ability to bring a different and important perspective to the work of that panel, and it was clearly reflected in many of their recommendations. So I have the award here, Dr. Liu. Congratulations to you. We will, of course, in this COVID time, bump elbows. This award is for you.
Thank you.
Thank you very much, and the floor is yours.
Congratulations, Dr. Liu.
Thank you very much. Thank you very much, Mr. President. Dear Directing Council, I would like to thank PAHO for this prestigious prize. It is such an immense honor for me to receive this recognition. The COVID-19 pandemic caught most of the countries by surprise. Many countries initially believed that this distant virus was non-threatening. They thought they were safe. Consequently, they adopted a wait-and-see approach. This synergic combination of a lethal virus and a passive stand led to the outcomes that we know, the disastrous one that we know. Overwhelmed healthcare system, infected gasping for more oxygen, abandoned elderly homes by sickened staff, and drastic lockdowns impoverishing further the most vulnerable. Even here in Quebec, it seems so unbelievable that our aging parents died of hunger and thirst in soiled diapers in long-term care homes. But it did happen, and it was not an isolated event. We were completely unprepared, beyond our imagination. Tackling epidemic is always a very humbling exercise. It often, the Murphy's Law applies. What can go wrong, goes wrong. There are three basic lessons learned through time. No wishful thinking, proactive mindset, prepare for the worst case scenario. The year of 2021 held so many promises, mainly, but not solely, from the amazing breakthrough discoveries of vaccines against COVID-19 at the end of 2020. After months fighting the two waves of infected patients with COVID-19, with healthcare workers sweating in burdensome personal protective equipment, caring for them, we sighed in collective relief, caught our breath, and focused to get to the finish line of COVID-19. Science literally saved the day, but greedy politics spoiled the day. The sickening race between wealthy countries in hoarding worldwide stockpiles of COVID-19 vaccines unsurprisingly mirrored the phenomenon of hoarding equipment the year before. This is a dramatic illustration of the structural and political problems that perpetuate global health inequalities today and likely for so many other years if nothing happens. The leftover scrap of vaccine supplies given to the low and middle income country are not enough. The Access COVID-19 Tools Accelerator, ACTA, to its distribution pillar, COVAX, failed to deliver to the LMIC country in 2021. So far, it delivered 25 million vaccines to PAHO countries. But in the long run, A vaccine redistribution platform based on charity model, the capricious goodwill of the wealthy to share, is not sustainable. For the future, we need to transform ACTA into a truly global end-to-end platform to deliver a comprehensive basket of global public good, including vaccines, therapeutics, and diagnostic. But in fact, countries in the Americas did not stand still. Two public institutions in Brazil made technology transfer agreement with AstraZeneca and Sinovac. Local manufacturing is happening now. Furthermore, there is agreements between Argentina and Mexico with AstraZeneca to manufacture COVID-19 vaccine for the region. And beyond the US Operation Warp Speed, 4 vaccines were developed in Cuba. 2 of them are already released by the Cuban regulatory agency. Hence, health inequity, it does not matter how we call it. Vaccine nationalisms, vaccines hoarding, vaccine apartheid. The outcomes are the same. Excess deaths, trillions of loss in economy, new and deadly variants. But there are even darker side of the COVID-19 that is surfing on the large back of COVID-19 or the pushback of migrants. It's an issue that should be everybody's concern, including PAHO, although it's not, his full responsibility. The pandemic gave a blank check for countries for strengthened nationalist and isolationist discourse, leading to accumulation of people on the move, the migrants. For decades, people have been fleeing extreme violence and extreme poverty from Central America, Mexico, and other countries. Through their journey towards their American dream, they repeatedly suffer extreme violence, sexual assault, widespread discrimination. They are as well a source of business for the smugglers and the narco traffickers. From early 2021, the US government has enforced over 900,000 expulsion under the Title 42, a policy that exploits the pandemic to essentially shut down the border to those asylum seekers in order, quote unquote, to help prevent the introduction of COVID-19 in border facilities and within the country. Only unaccompanied children are not expulsed in an expeditious way. Each day, by thousands, they arrive. Mostly teenagers, 20% are in the tender age of 5 to 10. They live in inhumane condition, packed in poorly designed shelters. All should be reunited with their families or be placed in a foster care. The aftershock of COVID-19 pandemic will be felt for years. We must avoid the double fault of not being prepared and not learning. While I'm talking to you, while the UNGA is unfolding in New York City, power countries should strongly support a political declaration endorsed by member states that will mobilize political and financial alignment on tackling the full range of issues relating to pandemic preparedness and response, and create consensus around the critically necessary reforms in access to global public goods, global governance, and financing. And let me end on this note, that the dark side of the COVID-19 is something somehow that could be completely preventable. It is within our power. The reality is no extremely violent journey, no walls, no drastic policies will discourage our parents to dream for their child's future. That's what my parents did. This is human survival. This is universal. So my plea would be that Title 42 be suspended. The migrant protection protocols must be reestablished. It is about our dignity. It is about safety. But above all and beyond, it is about our common humanity. Thank you very much.
Thank you very much, Dr. Liu. A very impassioned plea and one born out with significant experience. And you are a beacon of hope for those of us who strive to improve public health in the region and in the world. We thank you very much. Well-deserved award. and we salute you and your efforts. Thank you. At this time, we will return to the agenda item 4.8, Strategy for Building Resilient Health Systems and Post-COVID-19 Pandemic Recovery to Sustain and Protect Public Health Gains. Members, delegates may recall that we had suspended the contribution during the plenary, and we had indicated we would resume, after which I will ask Dr. Fitzgerald to take the floor. I know he will have a lot to say, and there is a lot that will be said prior to him. So I'm going to ask our moderator to resume his role and recognize, in order of hands being raised on the electronic platform, the delegates who would like to speak. Thank you.
Thank you very much, Mr. President. We had noted the request for the floor from the delegation of Suriname. We will proceed with Suriname before the non-state actors that have requested the floor, as I see no other member state at this time. Suriname, you have the floor.
Thank you, Moderate. Mr. President and distinguished ladies and gentlemen of the 59th Directing Council. Today, I represent the government of Suriname and wish to wholeheartedly endorse the proposed resolution. Since March 13, 2020, when the first case of COVID-19 was detected in Suriname, our country has utilized an all-of-government approach to manage the national response to the emergency, and at the same time ensuring the essential health services continued uninterruptedly. The challenges we face and continue to face in Suriname reflect a weakened and fragmented health system. This pandemic, however, has offered an array of opportunities for us to develop a more resilient health system as we seek to build back better and stronger. Regarding the proposed strategic line of action 1, Suriname agrees that it is more important now than ever to accelerate the implementation of a primary healthcare approach. We have completed an assessment of the chronic care model in Suriname with technical cooperation from PAHO, which has offered key insights into our existing models of care, including current service provision modalities, quality standards, training curricula, information systems, and essential medicine and medical devices. We intend to use these findings to design a new model of care to address this growing burden of non-communicable diseases in our country. This new model will be grounded in the primary healthcare approach and will reflect our country's commitment to invest more heavily in the preventive care. As stated in proposed strategic line of action 2, Suriname is also advancing in the area of building capacity in the essential public health functions. Suriname is a pilot country in the use of the PAHO capacity assessment tool, and by the end of this year, we will have a more comprehensive overview of the functions for which we need to invest more human and technical capacity. In a small state like Suriname, many of these functions are exercised by a few persons. And it is important to know that with growing demand on the health actors to respond to emergencies, we should find ways to sustain intersectoral approaches, including the involvement of non-governmental agencies and to private sectors in national coordination mechanisms to exercise some essential public health functions. Finally, it is important to note that Suriname is also conducting the WHO Frontline Readiness Assessment to respond to COVID-19 and to maintain essential health services. The result of this assessment, along with those from the APHF capacity assessment, will be utilized as inputs in the revised national health strategy for the country. It will chart the way forward for the improvement of the health and well-being of citizens of Suriname. We continue to work with PAHO as technical partners in all our endeavors, and we commend the organization for this strategy and proposed resolution. Thank you, Mr. President.
We thank Suriname for the intervention. And just to remind the member states that we are discussing agenda item 4.8, strategy for building resilient health systems and post-COVID-19 pandemic recovery to sustain and protect public health gains. In case an additional member state would like to request the floor at this time? Seeing none, we will proceed to entertain requests for the floor from non-state actors in official relations with PAHO. I see before, again, non-state actors, I see Argentina requesting the floor. Argentina, you have the floor. Argentina, we can't hear you. Are you requesting the floor? Yes,
Hola.
Argentina, you can go ahead.
Y pedimos disculpas porque se nos levantó la mano, pero
We apologize because our hand was raised, but we'll pass for the time being. We understand.
We will then proceed with non-state actors. We have quite a few non-state actors that have requested the floor, so please bear with me. We will entertain the request for the floor from the International Council of Nurses. You have the floor.
Thank you. Thank you for the opportunity to speak on behalf of the International Council of Nurses and the over 27 million nurses worldwide. The ongoing COVID-19 pandemic has underlined the contribution of nursing to strong and resilient health systems and the risk that nurses are taking to respond to the pandemic. As document CD 5911 notes, as of May 12, 2021, in 22 countries in the Americas, at least 1,827,112 health workers have contracted COVID-19, and at least 9,159 have died. ICN is extremely concerned about the long-term impact of COVID-19 on the nursing workforce, including the persistence of high workloads in difficult working conditions, the rising rates of mental distress, and worsening nursing workforce shortages. It is clear that protecting the nursing workforce and supporting the nursing role is crucial.
Sana, no viste ahí como dice su altavoz no funciona y justo ahora está tratando nuestro tema. ¿Qué es lo que
It
puedo
is
hacer ahí?
highlighted
Me
the
parece.
reasons
Mira,
that
Ana, por la
there's
fotito que te
chronic
mandé.
underinvestment in human resources for health and a lack of information systems to report on HRH distribution, lines of care and professional categories, and composition and characteristics of interprofessional health teams. As such, ICN urges member states to invest in the health workforce, prioritizing safe working environments and working hours, training and continuous education on infection control, strengthening surveillance systems for health worker infections and deaths, rapidly scaling up mental health support and services to health workers, and effectively attracting and retaining the nursing workforce. Integrating the newly released WHO Global Strategic Directions for Nursing and Midwifery for the period of 2021 to 2025 into national health systems planning should be at the very core of transformation of health systems for greater resilience. ICN also wishes to emphasize the importance of engaging and empowering nurse leaders and calls on the Directing Council to appoint a Chief Nursing Officer for the region of the Americas. We also call on member states to establish and strengthen senior leadership positions for the nursing workforce. I thank you for your time.
Thank you very much for the intervention. And before we go ahead with other requests for the floor, I would like to remind delegates and non-state actors to please limit the interventions to 3 minutes and to please mute your microphones until you are recognized for the floor. We now recognize the Drug for Neglected Diseases Initiative. You have the floor.
Thank you, Mr. Moderator. Francisco Viegas, on behalf of the NDI. The COVID-19 pandemic continues to strike hard the region and has amplified existing barriers in access to health between and within countries, particularly among populations affected by neglected tropical diseases. Stockouts and disruptions of medicines, limited prioritization of primary health care, activities to other
Delegate, if you could
diseases.
please, wait a minute.
Should I start from the beginning?
You can restart. Thank you.
Stockouts and disruption of medicines, limited production of prioritization of primary healthcare activities to other diseases than COVID-19, social and financial vulnerability have increased and continue to threaten the response to NTDs. Access to care for neglected populations is a key indicator of resilient and effective health systems, as the persistence and wide geographical spread of NTDs to a general neglect by health system of existing needs and priorities. Member states must also address the diagnostic, treatment, vaccines, and other technology gaps that hinder the effective treatment of patients and require for sustainable elimination of infectious diseases. In order to address such challenges, the NDI urges member states to adopt and implement policies that promote healthcare initiatives that focus on the integration of NTDs of test and treat and PMCTC strategies, prevent stockouts of key health inputs, invest in local production, and contribute to the sustainability of supplies, prioritize investment in R&D, and develop an innovation agenda that's focusing on addressing existing diseases that disproportionately affect the region, in addition to future pandemic-prone diseases, with clear priority given to areas most likely to be neglected by the market, promoting health tools that are designed from the start for the places and people that need them so that they can reinforce health systems, and ensure there are agreed principles, norms, and binding rules governing research and development and equitable access to essential health tools to increase the benefits of scientific progress will be equally shared and consider global public goods and available to all. And thank you very much, Mr. Moderator.
We thank DNDI for that intervention. We would now yield the floor to the International Federation of Medical Students Association.
Thank you very much, Honorable President, distinguished delegates. The International Federation of Medical Students Association commends PAHO for encouraging the development of resilient health systems in the Americas after the COVID-19 crisis. IFMSA believes that achieving health equity requires the involvement of the population in decision-making processes, policies, and services. We call on the governments to launch an intersectoral and an intercultural dialogue to define the most urgent health problems in their populations with the aim to create solution plans with a social inclusion perspective, leaving no one behind. The right to health cannot be exercised if we do not ensure its coverage. Thus, we call on the WHO to encourage countries to address the gaps in access and availability of health services faced by low-income and vulnerable populations due to COVID-19. As youth, we are strong advocates in the global movement for human resources for health, and we firmly believe that the quality and quantity of the health workforce play a significant role in our ability to cope with situations such as the current pandemic. Not only should their preparedness be ensured with certified and accredited capacity building models, but also with resources, remuneration, and implementation of health workforce plans supported by appropriate governmental investments. We call upon governments to actively play the role of coordination in efficient crisis management, resource distribution, and education towards the health sector. This moment demands coordinated, decisive, and innovative policy action globally. For the economically vulnerable ones who are the most impacted by the global crisis. Thank you very much.
Thank you very much for your intervention. We will now recognize the International League Against Epilepsy.
Thank you so much for giving us the opportunity to intervene today. The International League Against Epilepsy welcomed the draft intersectional global action plan on epilepsy and other neurological disorders by the WHO in June 2020. The 5 strategic objectives are all epilepsy relevant, well-balanced, and comprehensive. ILAE congratulates the World Secretariat for their work in incorporating comments from people with epilepsy and clinical experience. WHO has declared addressing epilepsy to be a public health imperative, so it set ambitious targets to reduce the burden of epilepsy in the action plan. The proposed target of increasing service coverage by 20% by 2031 is, in the view of ILAE, insufficient, and it will do little to reduce the mortality and exclusion faced by the people with epilepsy. The International League Against Epilepsy proposes that the current target is replaced by an outcome focused on cascade target 90, 80, 70 that will not only incentivize intersectional action and strengthen across the health system, but would bring real and measurable change to millions of lives. 90% of people with epilepsy are aware of their diagnosis as a treatable brain disorder is achievable through public and professional education and diagnostic capacity building. 80% diagnosed with epilepsy to have appropriate access to affordable, safe medication is achievable based on low cost of medications, $5 per annum, and huge success of demonstration projects as a part of WHO ILAE International Bureau Against Epilepsy Global Campaign Against Epilepsy. 70% of those treated with achieving adequate seizure control, for which there are multiple large cohort studies that have provided strong evidence base. A further target to incentivize governments to address legislation discriminating against people with epilepsy and other neurological disorders should also be added. International League Against Epilepsy wishes for a greater focus within the Global Action Plan on the needs of children and adolescents transitioning into adulthood. This could be achieved with 7th guiding principle on the need for specialized services. Thank you.
Thank you very much for your intervention. And before we yield the floor to the International Heart Federation, I'd like to remind the non-state actors that have submitted interventions for this agenda item to please note their request for the floor by raising their hand in the electronic platform. We know that there's a few non-state actors that have requested the floor, and it's important that you raise your hand so we can properly identify you and give you the floor. Thank you very much. Having said that, International Health Federation, you have the floor. Heart Federation, you have the floor.
Honorable Presidente, distinguidos
Honorable
delegados.
President, distinguished delegates, the World Heart Federation and the Healthy American Coalition, my organization, and NCD Alliance celebrate the opportunity to address the Directing Council of PAHO about one of the most critical topics of our times. The COVID-19 pandemic has wrought incalculable, untold damage economically and socially speaking in our societies. Last year, we faced a global challenge that laid bare deep and true inequities and gaps in the healthcare systems of practically all of the countries represented here today. The combined impact of heart complications resulting from COVID-19 and the interruption of crucial medical interventions and the number of people living with hypertension, kidney diseases, cardiovascular diseases and other non-communicable diseases shall exacerbate the healthcare systems that are under equipped already. Now, key risk factors need to be addressed urgently, and preventive measures that can help to fight the non-communicable diseases, circulatory diseases, and health emergencies such as COVID-19. We appeal to member states of the region of the Americas to prioritize the attention and treatment, detection and treatment of circulatory diseases, as well as other NCDs in their national response and recovery plans to COVID-19, placing people front and center to raise national allocations of resources and special funds and resources to address risk factors for those with cardiovascular diseases and NCDs, including commercial health determinants through funding mechanisms such as indirect taxes on unhealthy junk food, salty and sweetened foods, as well as gathering data on the prevalence of comorbidities and in NCDs, as well as a more outreach, and to strengthen the healthcare systems to ensure equitable access to essential health services, particularly for those who do live with NCDs and who live in poor areas. Thank you.
Thank you very much for your intervention. We would now like to recognize the Federación Panamericana de Asociaciones de Facultades y Escuelas de Medicina. Adelante.
Buenas tardes.
Good afternoon. I thank the Directing Council of PAHO and its director and president for allowing us to take part in this meeting. I'd like to speak of the contributions of the medical schools working toward a future based on knowledge. In 2019, the medical schools at the 21st Pan American Conference on Medical Education, titled Transforming Medical Education for Better Health Care, and we refer to the Cartagena Declaration, in which we express our desire to contribute to the COVID response by promoting prevention and by pushing for universal coverage of health care, equitable access to primary health care being the key element that accompanies people throughout their lives, solving people's problems, and hospitals are at the attention of primary health care, and oftentimes interventions are given a prevalence in which there is an organized effort to favor health, in which there would be intersectoral and compensatory actions to promote prevention and to reduce the burden of disease in the most vulnerable and marginalized parts of society. The Cartagena Declaration is in line with the position of the Pan American Health Organization vis-a-vis primary health care, that we have more than 50 years of collaboration. And it's been important, especially during the last 5 years, in which activities carried out in the regional pact for primary health care and universal health 30-30-30. We should recognize that in most health ministries of Latin American countries, they don't have a very good relationship with medical schools, and that leads to a situation in which it's hard to train upcoming doctors and healthcare providers. That's why we appeal to the Ministries of Health and Education, who are here, and intersectoral actors, to make a sincere effort of establishing ties of collaboration with the associations of medical schools in your countries, for us together to achieve the dream of universal health care Thank you very much.
Thank you very much for your intervention. We have noted that the Pan American Federation of Nursing Professionals has raised and lowered their hand on various occasions. We just want to confirm their willingness to take the floor at this time.
Sí, efectivamente.
Yes, indeed.
You can go ahead.
Sí. Bueno. Muy buenas tardes.
Good afternoon. I would like to thank everyone on behalf of the Pan American Federation of Nursing Professionals, an organization that represents 20 national, Latin American, and Caribbean nursing groups. And we thank PAHO for its efforts and those of the member states in addressing the issue of strategies to establish the resilient health systems and post-COVID-19 pandemic recovery to protect public health gains. We consider that throughout the healthcare system, at the first front line of our care have been these diseases, and ours is a group that is a sector that will undergo a process of resilience. That needs to be strengthened. The Pan American Federation of Nursing Professionals has borne witness during the COVID-19 pandemic to the fundamental value and importance of nursing professionals in healthcare systems acting on the front lines of care to the benefit of the population of all of the Latin American, Caribbean countries. And many countries have benefited from nurses despite the fact that they did not have the necessary inputs or equipment during the pandemic. Biosafety equipment and vaccination came late in too many countries, and that means that jeopardized people's lives, leading to so much pain for so many families. That's why the region of the Americas needs to protect and invest in increasing resources for nursing to ensure access to quality health for the population in keeping with the strategies of sustainable development goals. And so we urge PAHO member states to support the quality of education of nursing, to strengthen healthcare systems in the region, to comply with sustainable Millennium Goals, and to incorporate nurses in decision-making bodies in health ministries throughout the country, and for them to have a voice in decisions that benefit the population, and that governments of all member countries of PAHO, WHO, contribute to strengthening the sufficient allocation of funds to nursing. On this occasion, we express our support to the plan of action for the 2021 post-2021 plan, and we pledge to support the Pan American Health Organization and all its events and its decisions that seek to enhance the quality of lives of nurses to the benefit of the population.
Thank you very much, Delegate, for your intervention. And having reached the end of the speakers list, we turn to you, Mr. President.
Thank you very much for all the interventions that have been made. A very important issue to discuss, building resilience, particularly in this very challenging period of our lives and our history. At this point, I'm going to ask Dr. Fitzgerald to comment on the subject matter and also on the issues that have been raised. And I apologize for not recognizing you earlier to make the initial comments. So I will fully appreciate your taking in an extended period this time around. Thank you very much. Over to you, sir.
Thank you very much, Mr. President, and thank you to all the member states that have commented on the strategy and really presented the national context in which health systems have operated over the past year and a half. As we discuss the issue of resilience and its capacity within health systems to be able to surge while maintaining core functions, we've seen that many of the health systems essentially have been overwhelmed in the past 18 months. And this has resulted, obviously, in impacted health and lives and livelihoods, but also has exacerbated the inequities that were mentioned by the United States and Canada. And this is really central to the strategy being presented here before you today, whereby the aim of the strategy is to recuperate and protect public health gains, responding to the needs of all people. The data that we have presented by income, quintile, race, and ethnicity has really showed that excess mortality remains much higher in lower income, Indigenous, and Afro-descendant populations, and that disadvantaged groups are disproportionately impacted through higher infection rates, worse severity, lack of access to treatment, and ultimately higher mortality rates. All this being essentially amplified then by barriers to access health. And so the health system really has a central role in the response. We've highlighted and we've heard from Peru, Brazil, Honduras on the long-standing deficiencies in our health systems and the need for us to address them. Some of them being the persistent segmentation or fragmentation, where we go to look at transformation of health systems, not really addressing these core issues that can really result in universal access to health and universal health coverage. What do we mean by fragmentation? Essentially the lack of continuity of care, and segmentation, really how we place subgroups of populations into specific silos with inadequate coverage and service offers. And those populations find it difficult to access the care essentially that they need. Much of this is due to sustained low public levels of investment in health. Despite the advances that have been made over the past 7 or 8 years, public expenditure in health does remain low at 3.7%, even though countries have improved. And out-of-pocket expenditures essentially correlate with high out-of-pocket expenditures, resulting in risk of catastrophic expenditures and impoverishment. We did see an increase in this during the pandemic as a consequence of loss of employment and shutdowns corresponding to increased catastrophic costs in health. The other critical issue I think that this strategy really aims to address is the resolution capacity and the expansion in health services. And here I think is really the core element of the strategy, the real need for us as we move forward in the future to transform our health systems based on primary health care. And this was really noted by Mexico, Jamaica, and Suriname in their interventions. We continue to urge countries to work on the Primary Healthcare Compact, as was mentioned by the director earlier during the Directing Council, reducing barriers to access by at least 30%, increasing public financing to at least 6% of GDP, and allocating at least 30% of these resources to the first level of care. And so the transformation based on primary healthcare will constitute a strategy moving forward whereby we can bring health services to the population where they live, and that those health services are comprehensive and integrated. The question of integration in health services, I think, was mentioned also by a number of countries, particularly Honduras, Canada, Peru, and Colombia, when they spoke about the impact of the pandemic on essential health services. We've worked very closely with all member states in the implementation of 2 rounds of the Pulse survey, looking at the impact of COVID-19 on the provision of essential health services, particularly at the first level of care, and as has been mentioned by a number of countries and indeed the non-state actors, the impact on foregone care. And in this regard, the strategy really is calling on countries to look at the issue of governance of health systems and services, strengthening the organization of integrated health networks, and in particular, strengthening services related to mental health and psychosocial support for the general population, for vulnerable groups, and also for health workers. I'll bring back the issue of fragmentation here, because the issue of fragmentation in service delivery is key. And we need to address that if we're to really leverage capacities across all subsystems within the health system and sectors. So what I'm talking about here is public and private, to begin to build these integrated networks across the public and private sectors. And so we need to continue to work in that. We've seen that this has really been extremely important, bringing these subsystems, bringing these sectors together in surge capacity, that elasticity that was mentioned by Jamaica, that is so required in the context of a public health emergency. I wanted to comment on some of the recommendations in terms of multi-sectoral action, specifically noted by the United States and Canada and Jamaica. And this strategy really does home in on this, the need really for increased multi-sectoral action and increased integration in action, really using the essential public health functions as the driver for that, linking with the international health regulations and pandemic preparedness, as was mentioned by Colombia, Cuba, and Suriname. The essential public health functions are those public health capacities that that have been designed to strengthen institutional structures, to coordinate the multiple public health interventions and programs that we need to have resilience in our health systems. And as was noted by Jamaica, information management, risk communication, and intersectoral action is key to that. Also key to this area of multi-sectoral action is the linkages, as we heard during the side event at lunchtime, between social protection, the organization of public health services, public health emergency preparedness, including global alert mechanisms and investments in health systems, combined with the individual care services with health systems. And these are the overarching levels, or levers of integration that we need to really build resilience. So, Mr. President, I will leave it there with just one final comment. I want to thank the United States and Brazil and Colombia for their suggestions. We do think that moving forward, the involvement of the member states in the definition of roadmaps to ensure implementation of the strategy is really important. We would welcome the establishment of a technical committee to look how we can really surge the response in terms of the implementation of the strategy, to look at those future scenarios that Brazil was mentioning, and to assist our member states really in the post-COVID era. And this will, of course, feed into the midterm evaluations that Colombia was mentioning that are so important in the evaluation of our strategies. So I will leave it there. Thank you very much, Mr. President.
Fitzgerald, for your contribution and your comments were well taken, and I'm sure will benefit the delegates. At this point, I'm going to ask Madam Director, Dr. Etienne, for any comments that she may have on this issue.
Thank you, Mr. President, and I do have many comments. Let me begin by thanking member states who have made efforts in the transformation of their health systems. If I must be honest with you, much of what we refer to as transformation has been piecemeal tweaking here and there in many countries. And we have not seen the scale of transformation that is required to ensure that we can provide care for our peoples, but at the same time, we can scale up for emergencies. Nothing that we are hearing today is new. Nothing. Most of what we are hearing today has been on and in the literature, in PAHO's governing bodies, resolutions for at least 25 years. So none of this is new. I think what is new is that the pandemic really exposed the weakness of our health systems. We have woken up and recognized that our health systems do need transformation. The only thing that is new is that we have added the term resilient. I can tell you, because I have been in this thing now for more than 40 years. So I can tell you, I have followed from 1977 until now. So nothing is new except the word resilient. What we have seen that with subsequent governments, many governments want to focus on hospitals, hospital-centric health developments. Everybody wants to build a bigger hospital. Hospitals do not serve the population well and do not necessarily save lives in terms of the number of lives saved. So what is new is this term called resilient health systems. And resilient health systems are very central to dealing with any emergency and the pandemic response. So a resilient health system is a strong health system based on primary health care that can deliver quality, adequate, comprehensive care to all that is consistent with the principles of universal health access and universal health coverage. But it must also encompass the essential public health functions. It must therefore be able to prepare for, identify, respond to epidemics, crises, emergencies, and pandemics, and to be able to scale up to meet the demand for those times. That's the only concept that's we have not kept up with the resolutions that we have passed in this organization. We need adequate financing, and I'm not going to go over it. 6% with 30% of that going to primary health care. And we need those finances to be well distributed. We need adequate, well-distributed, well-trained, motivated, well-remunerated healthcare workforce. And a workforce that is not concentrated on super specialists and specialists, but takes into consideration your workers at the first level of care, including your community health workers. I have said it often again. If we look in Latin America, we have more specialists and super specialists than we have doctors at the first level of care. We have more nurses in hospital than we have at the first level of care. So we need to deal with that disparity. And we've talked about strengthening of primary health care. I'm not going to go over this again, but primary health care has to go beyond just the words. We have to increase the ability of our services at the first level to deal with the majority of conditions and persons that exist in their community. And that is lacking. And we need to ensure essential health functions are well structured and are working. You know, PAHO had the whole concept of essential health functions more than 20 years ago. We revised them, must be 5 years ago or so. So those are not new, but these constitute important pillars of what a resilient health systems must look like. We need information systems that are sensitive. This year, we added the digital transformation and the digitalization, and we added the artificial intelligence, etc., and the other technology that is necessary, but this is not new. We've spoken about it a lot. We have not done sufficient about it. And for a strong health system, you need access to health technologies, medicines, vaccines, equipment, tools, etc. You go to a primary healthcare center in most of our countries, not even the blood pressure machine is working. This sphygmomanometer is probably not working. The basic equipment and supplies that they require are not there. And yet, we are saying that our primary healthcare must take care of some 70% of the needs of our people at that level. Wake up. That's why people bypass them. We have to increase their ability to solve their problems. We have to invest. We have to invest in technology and healthcare workers. So, you know, as I say, you know, James talked about the nexus between health, the economy, and social protection. In a report earlier in mid-2020, we raised that we will never overcome the pandemic unless we improve the health systems and we do attention to social protection in health, social protection. And we, in October, next month, we will launch a second such analysis. So I say all of this to make one point, Mr. President. This region needs to act decisively, and it has to act with scale. A piecemeal approach will not ensure that we will be able to deliver on UHC and universal health, and at the same time, be ready to face the next disaster or the next pandemic. We need to become serious about truly investing and building resilient health systems. Thank you for this opportunity to expound.
I have to commend Madam Director for that very passionate, fiery intervention in true Caribbean style, but very worthwhile, very, very pertinent to the need for us to transform our health systems through action, through follow-up, through collaboration, and through a determined sense of making changes where those changes are required. Very, very timely intervention. Thank you very much for that. And to all those who participated leading up to this point, I want to thank you for your contribution. I now ask the rapporteur to present the proposed resolution.
Thank you, Mr. President. I shall now proceed to read the proposed resolution. Strategy for building resilient health systems and post-COVID-19 pandemic recovery to sustain and protect public health gains. The 59th Directing Council, PP1, having reviewed the strategy for building resilient health systems and post-COVID-19 pandemic recovery to sustain and protect public health gains, paren document CD 59/11, close paren. PP2, recognizing that the COVID-19 pandemic has significantly impacted health, lives, and livelihoods in the region of the Americas. PP3, considering that action by member states is required to address the systemic and structural deficiencies in health systems and emergency preparedness and response that have been exposed by the pandemic, and aware of the potential benefits to be realized by rapidly adopting and consolidating health system innovations observed during the pandemic response. PP4, noting the urgency to invest and build resilience in health systems that fully address the social, environmental, and economic determinants of health as a means to protect, promote, and sustain health, advance social and economic development, and accelerate the recuperation of lost public health gains. Resolves to approve the strategy for building resilient health systems and post-COVID-19 pandemic recovery to sustain and protect public health gains. Document CD 59/11. That was OP1. OP2, to urge member states, taking into account their contexts, needs, vulnerabilities, and priorities, to, (a), strengthen leadership, governance, and stewardship to implement the strategic lines of action of the strategy for building resilient health systems. B, advance in transforming health systems based on the primary healthcare approach, inclusive social participation, and a whole of government and whole of society approach with intersectoral action to address the social, environmental, and economic determinants of health. C, measure the institutional capacities of health authorities to perform essential public health functions and develop sectoral and intersectoral action plans to strengthen these functions integrated into the country policy and budget cycle. D, build and expand the capacities of health service delivery networks to improve access and overcome fragmentation, including capacities for management and coordination of the networks, planning and management of human resources, digital transformation, and strengthening of information systems for health, availability and management of critical supplies, medicines, and other health technologies and infrastructure, community engagement, and the development of adaptable response plans. E, increase and sustain public investments in health to support the transformation and strengthening of health systems toward the achievement of universal health, paying due attention to the development of capacities for implementation of the essential public health functions, including compliance with the international health regulations, and prioritize investments in the first level of care to support the delivery of comprehensive health services, both individual and population-based. OP3, to request the director to A, provide technical cooperation to member states to strengthen capacities and contribute to the implementation of the strategy for building resilient health systems. B, exercise leadership to promote regional cooperation and dialogue in health and foster cooperation among countries and the sharing of knowledge and experiences. C, report periodically to the governing bodies of the Pan American Health Organization on the progress made and challenges faced in the implementation of this strategy through a midterm review in 2026 and a final report in 2032. Mr. President, that concludes the reading of this draft resolution.
Thank you very much for that. I open the floor now for any discussion, suggestions by members of the plenary. And I ask our moderator to manage that portion of the discussion. Thank you.
Thank you very much, Mr. President. We will then take note of the requests for the floor to discuss the proposed resolution. Seeing none, Mr. President, we turn back to you.
Okay, great. Very important discussion topic 4.8 is, and I see no objection raised, and therefore as president, I declare the resolution adopted. Okay, before we proceed to the next item, 8.1, I am going to ask Ms. Zaccarelli to make an announcement or two.
Thank you very much, Mr. President. The announcement is that to facilitate an informal dialogue around the proposed resolution for item 4.7, reinvigorating immunization as a public health, as a public good for universal health, the proposed resolution that was circulated this morning. So to facilitate a dialogue around that proposed resolution, an informal consultation is organized for this afternoon in this same virtual room as the council from 5:30 to no later than 7:30. So if you want to take part of that dialogue and that conversation, please just stay in the same room. Thank you, Mr. President. That's the announcement.
Thank you very much. Very important announcement. So for those who would like to participate at 5:30, that session will begin, informal session. Okay, we now turn to item 8.1, update on COVID-19 in the region of the Americas. And I'd like to bring document CD 59 INF1 to the attention of the council and invite the representative of the executive committee to report on the item.
Muchas gracias, señor presidente.
I thank you, Mr. President. The Executive Committee received an update on the COVID-19 situation in the region as of June of this year. The committee commended the Bureau's leadership of the regional response to the pandemic and expressed appreciation for the assistance and guidance the Bureau has provided to countries. Strong support was voiced for the strategic lines of action and recommendations contained in the report on this item. Delegates stressed the importance of drawing on the lessons learned thus far in order to deal more effectively with the ongoing pandemic and be better prepared for future health emergencies. The need to combat misinformation was underscored, as was the need to communicate public information on risks and prevention in simple and transparent language. The Bureau was asked to produce guidance on the issue of vaccine hesitancy, which was seen as a significant problem in the region and an obstacle to controlling the pandemic. While the committee noted that as of June, almost all countries in the region had introduced COVID-19 vaccines, it expressed concern about the major inequalities and inequities in access that continue to exist. The Bureau was urged to continue supporting donations of surplus vaccines. It was suggested that the COVAX facility should distribute vaccines on the basis of epidemiological criteria and should step up efforts to make vaccines available to the countries of the Americas. More information was requested about the possibility of developing a regional access strategy aimed at securing additional COVID-19 vaccines and pooling demand and resources from the member states. In response to that request, it was explained that the general idea is to propose alternatives for addressing the vaccine needs of self-financing countries beyond the initial 20% supplied through COVAX. And Mr. President, that concludes my report on this item 8.1.
Thank you very much for that. I now yield the floor to Dr. Jarbas Barbosa, Assistant Director of the Pan American Center Bureau, and Dr. Cairo Agarte, Director of the Department of Health Emergencies of the Pan American Center Health Bureau, to present the item. And I hope I got those pronunciations correct. I'm working on it. Apologies if I didn't.
Thank you, Mr. President. We will share a presentation. So I will ask Ciro Ugarte, please, if he can start the topic. Thank you.
Thank you. It is a real pleasure to share with you, Mr. President, Madam Director, distinguished delegates, colleagues, the presentation. And I would like to mention that this report is a summary of all the work that have been done by the organization, I mean the member states and the Secretariat, in responding to the pandemic, COVID-19 pandemic in the Americas. The global overview of the situation is that we are still having a huge number of cases and huge number of deaths. In the Americas, the proportion of cases and deaths is larger than any other region. 38% of all the total cases are from the Americas, and 46% of the cases are also from the Americas. And there are several countries where the changes in the last week is shown in the graphic. But probably the graphic that will show what is the situation in all the regions is the one that you see. although the number of cases and deaths have been reducing in general and worldwide, still there are a number of cases that are being reported in larger numbers in Afro, for example. And we are seeing that this is, several spikes after relaxation of measures, but also new implementation of new approaches, even though the vaccination is increasing around the world. In the Americas, the number of cases are still in higher numbers in many countries, as well as the number of deaths. That are in the last several weeks, we see that in the graphic where some of the countries that contribute with more number of cases and deaths, and you see some of them represent also the highest numbers worldwide. The bi-weekly change in COVID-19 cases and deaths reported by countries and territories in the region of the Americas in the last 2 weeks, you see in the left the map where some parts and territories, states, provinces, departments, areas of the countries and territories are showing an increase of cases, sometimes over 3 times increase in the last 2 weeks. And also in the number of deaths, you see that there are provinces, states, departments, areas in some of our countries. So we are, the message is that we are still in the middle of responding to COVID-19 pandemic. And because of that, we are also seeing an increased number of variants. And you see the variants of concern that were detected in the countries and territories in the Americas, the Alpha variant in 49 countries and territories in the last week and the week 37 epidemiologic week. And the Delta variant is present now in 52 countries and territories. And to the right, you may see that some of the data is thanks to the support of the laboratory network, the genomic sequencing laboratory network that is activated in the Americas and are helping some countries and territories to detect certain variants that they may not be detected by the laboratories in the countries. And along all these months, there have been a close collaboration with the member states. And we have been providing, and when I say we, it is the Secretariat and the experts of the member states. The countries have provided a lot of technical capacity and have participated along with the experts of the Pan American Health Organization in providing technical support, in technical guidelines and recommendations, almost in every action, every component of the response to the COVID-19 pandemic. And there were more than 286 virtual sessions. And also because of the strengthened capacity that PAHO had in the past on having a humanitarian depot in Panama, along with the UNHCR, I mean and IOM and other agencies, we were able to deploy and ship a lot of supplies, but also through our Department of Procurement and the strategic, using the strategic fund and for medicines, and also Jarbas will mention on the vaccines, on the revolving fund for vaccines. But we sent millions of gloves, surgical respirators, gowns, goggles, and others. But also we sent millions of tests, both to PCR tests, but also on rapid antigen tests for the diagnosis of the identification of the virus, but also primers and genomic sequencing surveillance tests. And we are showing this support has been done by the entire organization. Not one entity of the organization have been apart from this response. the response is the close collaboration by all entities. And some of the entities have been also following. I mean, for example, the Department of Health Services, Systems and Services have been following with our teams in health emergencies and all our country offices and the technical teams on what is the situation of the intensive care unit beds. And this graphic shows how this is just a sample of some of the countries. Some of them have increased the number of ICU beds by 3-fold, 4-fold. And even with that increase, we still have an occupancy rate very, very high. You see in the graphic, for example, Uruguay has increased the number of beds by 286 beds, and they have a 55% occupancy rate. And you see there are some countries that do have high occupancy rate currently. Imagine if the countries would not increase the number of ICU beds, the number of deaths, of course, would be higher than we are seeing now. Also, along with that was the adaptation of medical centers and the deployment of emergency medical teams, mostly national medical teams and some international medical teams. As we speak, several countries in the region are receiving staff from emergency medical teams to respond to COVID-19. And this is thanks to the effort and the solidarity of the countries. We are seeing that solidarity moving not only inside the territories and countries, but also along the countries. And this is a real example of how we can work together and support each other. There are several challenges, though. And this is a summary of some of the strategic areas. In surveillance, we have huge challenges to adapt and expand our capacities against the backdrop of varying transmission intensity, but also to the emergence of variants. But this is beyond COVID-19. The challenge is more in how are we doing with surveillance of all other diseases. And in some cases, because we do not do the work of proper surveillance, we may think that some of those diseases are reducing. So this is something that we need to take into consideration. The points of entry and international travel and transport is also another area where the decisions are taken usually from political, economic, and social considerations, but we need also to insert the influence in this decision-making of the health evidence and also to resume non-essential international travel to protect our populations. The case management is another area where we need to adapt and manage health services and networks. The laboratory, national laboratory, there are many laboratories now that we are able to detect the variants and the virus, but still identifying other new variants of concern is a continuous challenge. Identifying the limited capacity to implement national regulatory infection prevention and control frameworks, but the availability of those supplies, lack of sufficient and sustained resources for the procurement of those essential supplies is still present in many countries. As we speak, there are maintaining essential health services and systems during the pandemic is a big challenge, both in limited investment in the first level of care, as Dr. Etienne mentioned in the previous topic. This is a key challenge that is showing big time during the pandemic influenza, ensuring in COVID-19 pandemic, ensuring safe and decent working conditions for healthcare workers is another area of concern, and limited legal provisions for authorizing medicines and other health technologies for emergency use. And the area of vaccination will be expanded by Dr. Jarbas Barbosa. Just some of the lessons that we should have been learned or we have learned so far and the way forward. First, that the public health and social measures must continue even where acceptable vaccination coverage exists. We are seeing that this lesson must be learned. We should have learned this lesson, but unfortunately there are many examples that is showing that we relax the public and social measures as soon as we see the cases going down. A continuous planning for responsive healthcare services delivery for COVID-19 surges is critical during the medium and long term. So the capacity to detect and to deal with these surges. It is imperative that countries continuously review initial technical guidelines. There is increasing new evidence that must be inserted into the new guidelines. In general, the effective national responses have been both holistic and agile, but there are areas of administrative levels and ability to change the course of action to confront the rapidly unfolding pandemic is a matter of coordination across all sectors. And the infodemic of misinformation about COVID-19 has reinforced the need to explore non-traditional medium and social media for communicating and engaging with the public. Usually we use the formal way of communication, press releases, maybe our webpage, some guidelines, etc. But most of the decisions, most of the information that is getting to the population is going through social media or other means. There are actions necessary to improve the situation from the countries and territories to continue to systematically and rigorously apply non-pharmaceutical measures. The public health measures are essential in this process. Balance, urgent implementation and scaling up COVID-19 vaccination plans with the strengthening of routine health services provision and other COVID-19 specific response. And I would like to mention this because the COVID-19 pandemic seems that the response has passed. Actually, it has not. But the funding to implement the response, unfortunately, is very slim. There is very low funding to continue the response beyond the first months of next year. So immediately consider those sharing of available and projected excess vaccine doses, plan how to deal with a sudden increase in the consumption of critical supplies, and leverage existing surveillance system for assessing the effectiveness of the vaccines. And for the Secretariat, advising based on evidence-based information, reinforcing detection, characterization, and response to variants of concern, sustaining health systems resilience, surveillance, and testing, preparing countries for COVID-19 vaccine rollout and combating vaccine hesitancies is still an ongoing work, procuring critical COVID-19 medicine, supplies, and equipment for emergency use and increase their production, securing access to additional COVID-19 vaccines and supporting those sharing. And there are the balance between acute response and with programmatic delivery of technical cooperation, because the region may experience recurrent epidemic waves of outbreaks and periods of low-level transmission, requiring national leadership and whole of government and whole of society commitment to sustain consistent and robust response. Countries will continue responding to the pandemic, addressing the triple crisis, as we've seen also in side events and in many of your interventions, public health, economy, and social impact, and the Secretariat to support countries to develop and adapt strategies to maintain and continuity of priority public health programs that suffered too much, and the health services, and while responding also still responding to COVID-19. And I would like to end my presentation thanking the support of all the experts and all the member states in this response. It has been truly a joint response. The efforts of the countries and complementarity of the organization have moved along the priorities, and the report, the document that you refer, Mr. President, is a report that I encourage you to read carefully and analyze, because it includes a lot of critical and efforts on the progress on the strategic lines, but also some of the recommendations that have been elaborated together with the member states. Thank you.
Thank you, Ciro. I will present a brief presentation. Here, it's a snapshot about the disruption across the health services in the region. Just to call the attention that we had a very important impact on primary care. Around 55% of the countries reported that there were slight, moderate, or severe disruption on these services. And when we are talking about this, we are talking about a very important impact on routine immunization coverage, about the detection, diagnosis, and medication for people with hypertension, with diabetes, with cancer. We are talking about prenatal care and many others. So it's very important to recognize these disruptions. And when we are talking about the protecting public health gains, about the recovering, and about the building strong and looking to the near future that we have, we need to see how we can link this impact with the new strategies that we need to implement in order to recover better. The impact can be very important. I will present only 2 or 3 important indicators. The first one is maternal mortality. As you can see, the target that was established in our region by our member state for the strategic plan was achieving 35 for each 100,000 in 2025. And in the strategic health agenda for the Americas for the year 2030, the target is to reduce it to 30. Probably we will achieve an important reduction, and important to recognize all the efforts the member states are doing to reduce the maternal mortality rate, but we will not achieve the goal. Despite all the efforts, we are currently we have currently a reduction of 1.4% each year. The key countries are reducing faster, 1.7, what's good, but it should be necessary to have a reduction about 7.83% to achieve the goals. But it can be worse, because with the impact provided by the pandemic, and we are still finalizing all the assessments, but it looks like we will have around the 19% increase in maternal mortality. This is a setback in around the 13 years. So this will be more challenging to reduce, and I point out this situation to say that we are not about going back to 2019. We are really talking about how we can use this moment to review the strategies, to adapt, to be innovative, to remove barriers, to strengthen primary health care in order to change this forecast. The premature mortality related to non-communicable diseases, it's almost the same. We are reducing. This is very important. We probably will arrive in 2030 very close to the target that was established for 2025, but we will not achieve the target that was established for 2030. Now, we need to increase the speed of the adoption of some strategic approach. We need to improve the quality of primary health care. We need to improve the quality. We need to improve the access to medicines. We need to improve the access for early diagnosis. And also, when we are talking about the incidence rate of HIV, despite all the efforts, all the achievements that you have in the region, we probably will not achieve the target that was established by both the strategic health agenda, sustainable health agenda, for the Americas, and for the SDGs. So the pandemic probably will have an impact on all these conditions. So the challenge is even bigger. And the resolution that we approved about the resilient health system needed to be translated really in practical actions in each country to recover. About vaccination, we have now, all the countries and territories have introduced the COVID-19 vaccines. 31 of these countries have received the vaccine through COVAX facility. We have more than 1 billion doses administered in the region, 56% in Latin American and Caribbean countries. We have many member states that now have achieved a high coverage. Five member states having more than 50% of their population fully vaccinated now: Uruguay, Chile, Canada, Ecuador, United States, and other countries are moving in the same direction. But we have in Latin America and the Caribbean, as an average, only 50% of the population with 1 dose, and only 1/3 of the population is fully vaccinated in Latin America in the Caribbean countries. And very importantly, we still have 10 countries that have not achieved 20% of coverage. So we still have 10 countries in Latin America and the Caribbean that are still in the process to protect the most vulnerable population that they have. I think that this is a very good example of the limited access that we still have in Latin America and the Caribbean. So far, COVAX has provided around almost 48 million doses for many countries. These vaccines are coming from the agreements that the COVAX facility has with the producers. And it's important to recognize that the producers are not accomplished with the contracts that they have with COVAX. This has been publicly discussed. They have prioritized bilateral agreements. So it was very important since last month, the donations that were made through COVAX. So we want to recognize the donations provided by the United States, by Canada, by Spain, by France, by Sweden, and by Norway. This was really important to allow the countries to receive more vaccine during this very critical period. And of course, that is important to advocate for more vaccines in order to have at least the most vulnerable population in every country in our region vaccinated in the next weeks. The PAHO Revolving Fund has launched this additional access to COVID-19 vaccine. It's an initiative to provide another alternative to our member states. It's to complement COVAX. It's not to replace COVAX. The idea is to have, besides the agreements through COVAX, the bilateral agreements, another alternative in order to allow the member states to reach the high coverage that probably is needed to control the transmission. We have received requests from the countries. Now we are working with these countries to have more information about the request, and we are also finalizing the agreements with the producers. We are negotiating with all the producers that have WHO EUL. So far, we have received and finalized and signed the agreement with Sinovac that has offered 8.5 million for the last quarter of 2021 and 80 million doses for 2022. With AstraZeneca, we are in the final discussions to sign the agreement. Probably next week we will sign, and the AstraZeneca will provide the final volume that will be available next week, while we are also in negotiation with the countries to establish the real volume that they want to purchase. With Moderna, we are also finalizing the negotiation. They are offering vaccines for 2022. With Pfizer and with Sinopharm, we are in negotiations, but not so advanced as with these three producers. We have also the other initiative, the regional platform for the advancement in the production of vaccines and other health technologies for COVID-19 in the Americas. This is not a short-term response, but I think that this is aligned with the will of our member states to reduce the vulnerability that you have in Latin America and the Caribbean. From the personal protective equipment last year for PCR tests, for ventilators, now for vaccines. So Latin America and the Caribbean, they have already capacity that is established in many countries. And if we have a mechanism that can put the countries working together in a complementary way and guaranteeing that all the products will benefit all countries in Latin America and the Caribbean using the strategic fund for medicines and the revolving fund for vaccines, we do believe that this will reduce the vulnerability and will make our region better prepared to respond to new public health emergencies. Yesterday, we have the launch of the initiative with the announcement of the 2 projects for mRNA vaccines, one in Argentina, one in Brazil, that will receive technical support to develop and produce the vaccines that will be offered to every country in Latin America and the Caribbean through the revolving fund. Just to finalize, I think that's important to highlight that most countries will still face limited access to vaccines, so it's important to advocate in every global forum that you have that we need more equitable access in order to protect everybody. If we cannot control the transmission in every country, we can have new variants because this is the natural process that the virus has. We are working to expedite the process within COVAX to get more donation to Latin America and the Caribbean, presenting the epidemiological situation, presenting the very limited access that many countries still have, and also offering this direct purchase alternative through the revolving fund. It's important also to highlight to the countries the need that we have to adopt, to expand, to be innovative, adopting new strategies to protect the gains and improve the performance of priority public health programs. That forecast that I presented, I think that forecasts are good to be challenging. Forecasts are good to not be the reality, because if we can, and it's possible to the countries to make this movement, to take the opportunity to be innovative and to adapt, to remove barriers, to expand the access, we can challenge these forecasts and show that the Americas can really meet all the goals that were established by our member states. Also important also to get all the support that is needed to the regional platform to reduce the vulnerability. It's totally aligned with the resolution that was approved yesterday in the morning. And also this link with resilient health systems. As our director mentioned, we have a window of opportunity to really build on the lessons that we learned, the weakness that were highlighted by the pandemic, and to adopt a strategy to overcome them and to improve the general situation of our region. Thank you very much, Mr. President.
Thank you very much for presentation, both gentlemen, Dr. Ugarte and Dr. Barbosa. Very comprehensive and captures, I think, a lot of information for delegates to digest and certainly to learn from. At this point, I'm going to ask the plenary to begin the discussion and invite delegates to use the electronic platform for their comments, and Mr. Moderator for coordinating this segment. Thank you.
Thank you very much, Mr. President. We will then proceed to take note of the requests for the floor on this agenda item. And we see and recognize the delegation of the United States, followed by Venezuela.
Thank you, Mr. Moderator. The United States appreciates the comprehensive update on the COVID-19 response in the Americas and thanks PAHO leadership and staff for the incredible efforts to combat the pandemic in our region. We're grateful for your extensive partnership and collaboration with us on COVID-19 and beyond. The Americas continues to be hit hard by the pandemic, and much remains uncertain as we move into 2022. We appreciate PAHO's leadership in helping the region address the many issues and needs of countries in the Americas region. PAHO's technical assistance to member states to strengthen critical areas of the response, such as diagnostics, case management, infection control, and continuity of essential health services, and the regulatory systems that facilitate access to medical products, is critical. The United States continues to work to address the need for additional vaccine doses. To date, the United States has donated and shipped over 140 million doses of COVID-19 vaccines to more than 90 countries and economies, including over 35 million doses to the Americas region. Today, President Biden announced that the US is purchasing an additional 500 million Pfizer COVID-19 vaccines to donate to low and middle income countries around the world. This new commitment will bring our total to over 1.1 billion vaccines donated to the world. The United States is donating 1.1 billion doses of vaccines free of charge, no strings attached. The United States is also committed to providing complementary technical assistance in a variety of areas in the region, and we support PAHO's work to develop a regional access strategy, including the use of existing revolving fund mechanism. We must address the shortcomings in the global health architecture uncovered by the pandemic. The United States looks forward to continue working together as a region in the spirit of Pan-Americanism to bring our collective experience and expertise to lead transformational change, to strengthen WHO, PAHO, and to defeat COVID-19. Thank you very much.
We thank the United States for the intervention. We now recognize Venezuela, followed by Argentina.
Gracias, señor presidente.
Thank you, Mr. President. In the Bolivarian Republic of Venezuela, the pandemic in July, August, September of 2021, in which there was much echo coming from the room, making interpreting very difficult. With the circulation mid-April of the variant Gamma, I would just ask you to speak more calmly for us to ensure interpretation. Let me start again. Mr. President, in the Bolivarian Republic of Venezuela, the pandemic expressed itself two ways. In July, August, and September 2020, there was a massive number of Venezuelans that we vaccinated. Second, in March of 2021, with the community circulation of the Gamma variant mid-April, we have a high level until the third level of August, when again, says the interpreter, there is too much echo coming from the room to distinguish the words. Given the economic context, the main strengths of our fight against COVID-19 has been our sustained action to broaden universal free access to healthcare. 7+7 is our approach, with 7 days of we have control mechanisms that we have instituted. We go home to home, and we offer comprehensive protection to society, and we are doing genomic sequencing, among other activities. We have a massive vaccination plan directed toward all social sectors to help the most vulnerable first and foremost. 40% of our population has been vaccinated with the first dose, 47% with the second. Well, again, the interpreter says there is much echo coming from the room, making interpreting very difficult. We continue to offer healthcare. There is deterioration of the infrastructure, and also the supply of medical inputs has been interrupted. Despite all of these problems, the Bolivarian government the interpreter reiterates that the sound is not good enough to enable interpretation accurately. I will do my best. We continue working with PAHO and other international organizations to come up with a formula to forge ahead with our commitment to overcome our financial situation. We are grateful for the assistance we received from PAHO, the WHO, and the UN system, the governments of China, Russia, Turkey, India, Cuba, as well as of other international organizations. Under these circumstances, in this time in the history of humanity, we are a peaceful region. We seek to step up the distribution of vaccines. And we call for the suspension of intellectual property rights on vaccines for COVID-19 to ensure universal access to the vaccine. Thank you very much.
We thank Venezuela for the intervention. We now recognize Argentina, followed by Canada.
Gracias, señor moderador. La Argentina toma nota del informe.
Thank you, moderator. Argentina takes notes of this report. Argentina is facing one of the most critical junctures of the pandemic, with a great increase in cases and struggle getting necessary vaccine. As the presenters pointed out, the region has certainly been very, very hard hit. Only 23% of our citizens are fully covered, and in many parts of the region, it's lower than that. Strategic and essential medicines, the vaccines themselves, represent an enormous challenge. Now, we have essential capacities to boost the regional supply and to try to narrow the gap of access to vaccines, as well as regards essential inputs that very often are just not there to be had for our countries. So we want to celebrate the BioNTech meeting with the Biomanguinho Center in order to be part of that regional hub that is working with Brazil to work to get the necessary vaccines available to guard against COVID. We are very well aware of how important it is to keep looking for an integral approach, always thinking of the most vulnerable. And within that framework, in this second wave, we in Argentina took community measures in the areas that we thought most important, and that at least curbed the spread. We have at present 16 weeks of uninterrupted drop in cases. More than 90% of the cases have been curbed with reference to the high peak of the second wave. We have 64% coverage in our citizenry with one dose and 43% with both of them. We're very convinced that with PAHO, the community of experts and the industry and commitment of everyone who cares, we can break the back of this situation, particularly the very concentrated vaccine market. We can only underscore the need to keep at it, take a comprehensive approach with a human rights and humanitarian perspective so that we can ensure that surplus vaccines are distributed in a greater spirit of justice and equity. Thank you.
Thank Argentina for that intervention. We now recognize Canada, followed by Honduras.
Thank you, Mr. Moderator. And as it's the first time I'm taking the floor, I would like to congratulate the President for his nomination in this position. Canada thanks the Secretariat for this important report. For over a year now, COVID-19 has continued to have devastating effects globally, including in the Americas, which has been disproportionately impacted by the pandemic. We continue to applaud PAHO's critical leadership in providing technical guidance and cooperation on the many aspects of the pandemic response, and also recognize the organization's tireless efforts not to only ensure member states are supported during this unprecedented health crisis, but that the region is seen and represented globally. Canada remains committed to robust global collaboration to end the acute phase of the pandemic and the devastating health, social, and economic effects it has on the most vulnerable, both in Canada and around the world. We acknowledge that in order to achieve this, equitable, timely, and affordable access to effective vaccines will be critical. And Canada continues to do its part to ensure that everyone, everywhere, has access to COVID-19 vaccines. Recognizing PAHO's crucial role in COVID-19 specific vaccine efforts, given the organization's decade-long experience in providing procurement support to countries in the Americas, we are pleased to be assisting PAHO in facilitating access to COVID-19 vaccines and ancillary supplies for populations in situation of vulnerability in the region, having provided $50 million to the organization to help advance these efforts. Canada has also committed to donate over 40 million doses of COVID-19 vaccines through the COVAX facility and bilaterally, accelerating deliveries to countries in the Caribbean and Latin America, while also helping priority countries in other regions. The recognition and adoption of mixed vaccination schedules can also help contribute to increasing global rates of vaccination, as it could expand the options under which individuals can be fully vaccinated and support countries facing uncertain vaccine supplies. As such, we believe it is important for the international community to recognize the benefits of a mix and match approach to vaccination when supported by scientific evidence and regulatory authorities, particularly for travelers who may have received mixed doses. Finally, we support the actions needed to improve the COVID-19 situation in the region, which are outlined both for member states and for the organization. Canada has implemented in different ways the actions proposed not only through domestic initiatives, but also through our support to regional and global efforts, and Canada will continue to do so. Thank you very much.
We thank Canada for the intervention. We now recognize the delegate of Honduras, followed by Brazil.
Muchas gracias, señor presidente.
Thank you very much. Mr. President, Honduras takes very good note of this present document and very much agrees with the idea that technical cooperation should be maintained and continue to assist in obtaining indeed a more integral approach to the pandemic that is facing us and to health generally, based on the 4 strategic lines of action that are outlined therein. With regard to introduction of the vaccines, we see that the Bureau is also focusing on critical aspects of diagnosis, response, diagnosis, management of the cases, and the continuity of essential services in the health service. We need to include here the need to boost the capacity of those networks in the health sector, particularly primary care, intensive care, and emergency teams and equipment, and deploying medical teams, as well as thinking of post-COVID rehabilitation, which we are now understanding is a priority issue. Let's look also at bottlenecks in the health sector, like human resources, financing, and health logistics in general, as ever. Honduras feels that the organization needs to very much keep back a reservoir of essential equipment in order to be able to put them in play in a moment of great emergency. And that might mitigate situation when there is delay or simple lack of certain essential medicines or delay because of transportation or any other impediment. We very much agree that the Bureau should continue supporting member states in looking for doses that will assist us in better combating COVID-19 through the COVAX mechanism, certainly, also the regional donation system or bilateral system, certainly, all of which will facilitate getting the doses out among member states. And that does have to be from the standpoint of greater equity and improving coverage in the vaccination efforts throughout the region. And for all of these reasons, bottom line is to try to help prevent contracting the disease in the first place and hopefully avoid death. We beg the Directing Council to adopt the tenets of this report and for this to be embedded in our action as we move forward. Thank you very much. Thank you. Brazil has the floor. Thank you, moderator. Brazil is very grateful for this update on the COVID-19 pandemic in the Americas as put forward by the Secretary. The 5 strategic lines that have been put forward in the document are particularly relevant. Brazil has very much worked on this, and on the 15th of September, we worked on 15 vaccines that were offered to more than 1 million of the residents, and that for the first dose. We are very pleased at the success of our campaign on the basis of the broad attention that has been paid to fighting COVID-19 and working through the very broad network throughout the country. We now have 142,000 citizens who have had their first dose, and 123 million doses have been received and has distributed to the tune of more than 72 million. We think we now have about 29% of the citizenry that has had the first dose, and 65% almost completely immunized. We are working hard also to work on the borders. There are townships and provinces up against the borders of the country that are particular challenges. The 121 townships that are affected have received a higher number of doses to assist the population there. And Brazil is looking very hard to see how we can do better and maybe accelerate the production of vaccines through a great jump forward in technology. We were delighted with the news that Brazil has been chosen to be one of the centers to get this done, particularly the mRNA, the messenger RNA. This is terrific news, and we are very, very keen to continue to tap other technologies as well as to look at how we can boost a spreading capacity for spreading these medications, and to work with AstraZeneca and Fiocruz. There is interference from some other speakers. The interpreter is hearing 3 conversations here. Brazil continues. Just want to say again on behalf of the Brazilian government how deeply grateful we are for the partnership with PAHO and all of you. Thanks very much.
We recognize Cuba, followed by Suriname.
Thank you, moderator. Cuba, from March of 2020, when we detected the first cases, has launched a national plan to prevent and control this pandemic based on a management model that we think cover the most essential epidemiological and scientific elements that have to be covered. Our integral network and a particular deployment of specialized human resources has borne fruit. And we had a number of about 8,000 cases that were confirmed early on, and we have about 85 per 100,000 inhabitants. This shows the presence of the Delta variant here of SARS-CoV-2. 125,321 patients have been detected with that Delta variant. About 4.9% of the total of those who have been diagnosed translates into 98.9 with good evolution, moving toward 80.4% up to today. 9,165,307 samples have been taken, which points to the 85,900 and some, which I mentioned earlier, representing about 9% of what we have studied. Now, this very complex panoramic has certainly not curbed our efforts, far from it. We're determined to surge forward, and starting in May, we launched a vaccination process that has allowed us to reach 76.2% of the population that is vaccinated above 2 years of age with our own vaccines. 49.5% with the second dose, again, of our vaccines, and 41.6% already have the entire set of vaccinations that are recommended. We look to have the entire population covered within a year, and maybe, and that's our hope, we will reach that landmark before any other country. This would put us, we desperately hope, in a position in which we can get back to normal and pinpoint new variants that may come up and be in a better position to fight this kind of tremendous risk next time, spotting our vulnerabilities and working against it. Please let me say that the Pan American Health Organization has our immense appreciation and admiration, and very much believe in that principle of equity that you espouse.
We thank Cuba for the intervention. We note the request of Suriname, followed by Colombia. Suriname.
Thank you, Mr. Moderator. This document provides an update on the COVID-19 pandemic in the region of the Americas and the progress and challenges. And as many other countries, Suriname has also faced many challenges. To mention some key points, the COVID-19 pandemic has also highlighted aspects of the national response to public health emergencies. An intra-action review can provide more in-depth analysis of the country's gaps in response. However, noteworthy is that the lack of sufficient response plans and coordination and communication mechanisms. The COVID-19 pandemic has increased socioeconomic challenges in the country and therefore increasing the challenges in procurement of essential and emergency supplies, such as testing materials and needs for case management and other needs to maintain essential services. Suriname has yet to integrate the surveillance of all respiratory illnesses and actively acquire SARI case data. The systems should be used for detection and monitoring of COVID-19 transmission in the community. Lack of HR has been the most significant challenge seen during this pandemic, and in trying to maintain essential services, vaccination, and clinical management for COVID-19. Building capacity in surge planning and IPC is essential for future preparedness efforts. In terms of strengthening surveillance, Suriname has perceived challenges in adequate case detection, and now we are using more rapid tests. Although there is a range of vaccines used in the country, we've now vaccinated around 36% of our population, and that is around 45% of the target group above 12 years. And still, there is misinformation about COVID-19 vaccines, and you have a lot of hesitancy still in the community. So we will need to strengthen the risk communication and community engagement approach. We are very thankful for all the support we are receiving, for all our friendly countries, our friends, and all the international organizations. Suriname takes note of the report and will increase efforts to control the spread of the disease by strengthening the public health measures and improving vaccine uptake. Thank you very much.
We thank Suriname for the intervention. And now we would like to confirm Colombia's willingness to take the floor at this time, seeing as we had registered their request for the floor just a few minutes ago. Colombia, you have the floor.
I'm afraid the interpreter cannot hear one word. Sorry.
We are unable to hear you. There might be an issue with your audio system. If you could please double check.
That's better with a lot of crackling. The interpreter will do her best, but it's not good. Do our best. Thank you. No, cutting out and crackling. The interpreter deeply regrets. It's impossible to work in these conditions. Very sorry. It's not fair to the delegate.
We're receiving your audio intermittently. If you could please, again, double check and verify that your audio system is working correctly. We're unable to hear you still. Would there be maybe another delegate from Colombia that could take the floor on behalf of your country?
Quizás intenta sin el headset.
I'm afraid I'm getting an echo as in a wind tunnel. I'm very sorry. No, I'm very sorry. We hear a volume, but we hear noises, echoes. The interpreter very much regrets. Well, I'm going to try. The interpreter hesitates to even attempt this. We thank the Secretariat for the report that has been presented, which offers a clear idea of progress that has been made, as much as the challenges that we continue to face in the pandemic 19, which has been properly been stated, certainly has pinpointed the weaknesses in our health systems. We in Colombia have had a great spike in the number of contagions and deaths resulting here, but now we've finally dropped to below 50 deaths daily. So I also want to say that our ICUs over the last months have shown finally a drop toward lower levels of positive tests that have been taken. However, the national government is very much aware of what needs to be done to boost early detection, follow-up, and isolation of cases that are positive, and the need to move forward in increasing vaccination of the population to avoid further contagion. Along those same lines, we are deploying immense efforts to really marshal all of the pluses we have available to us, more than 15.8 and 18.9 million tests where we were finally able to detect the Mu variant. On the other hand, despite the need for additional vaccines and lags in allowing us to move forward with our national immunization, right, we have already distributed 37,000 doses. Many have received the first, 13 million have received the second. But despite efforts that many of our countries have made to move forward here, the vaccine market is, of course, still hobbled by the lack of recognition of vaccines that need to be approved and WHO input. So we can only hope that this will be ameliorated. It's one among many challenges that we're facing. Many studies have been drawn up, as you know, nationally and internationally, to point out how important it is to boost the availability of these vaccines. And all of the points that are made in the document are good. It's important to have a better following of the WHO guidelines and international health regulations. We also regret various obstacles to human mobility. We hope that as we move forward, we can do better in tackling the challenges. And I thank you. The interpreter again regrets it. Did my very best.
We thank the delegate of Colombia for the intervention. And seeing no additional requests for the floor from member states or non-state actors at this point, Mr. President, we turn back to you.
Thank you very much. And we certainly, I think there's an additional hand up, Mr. Moderator. So maybe I should hand back to you.
Yes, thank you very much, Mr. President. I recognize Haiti. Go ahead, Haiti.
Terribly sorry, we cannot hear the delegate. Here we go. Thank you very much, Mr. President. Haiti wishes to express its gratitude. Hello?
Yes, go ahead.
I was saying, thank you very much, Mr. President. Haiti wishes to express its gratitude to the Secretariat for this excellent report. We stand here to absolutely affirm how important the support has been by PAHO and the Bureau, in as much as it has made it possible for us to move forward and against the most dire predictions that had been made in our case. From the very first moment, PAHO was just with us, as was the Bureau, to help us survey the extent of the disease, train our personnel, and afford the equipment and materiel that our institutions desperately needed. COVID-19 has absolutely shed a spotlight on the injustices, the contradictions, and the weaknesses of our system. Haiti is trying very hard to face this pandemic, as you all know, in what are already very, very dire circumstances. In 21,000 and several thousand tested positive to COVID earlier. Numbers died in December. Many were hospitalized, numbers of others died. But we launched the vaccination effort through the help of the United States government that gave us 700,000 doses through COVAX. 18,000 and some persons are to date completely vaccinated. 42,788 have received their first dose. It is important to find the necessary resources to increase sensitization, to mobilize our community, really pulling out all the stops, doing everything we can possibly do to dispel the myths and the disinformation that is rampant with regard to vaccination, thereby making vaccinations more available, and when they are available, to be accepted closer to where people live. We understand that we are one among many struggling in an international health crisis, but certainly we, for our part, must boost our capacity to detect, to prevent this kind of disease, to better organize our healthcare, and to adopt more equitable approaches in terms of the spread and the quality of the services we offer. And this is why we take this opportunity to call out for solidarity as an international principle that will focus on countries that desperately need help on the basis of universal health coverage, and to assist in putting together trustworthy systems of information and the necessary technical means by which citizens can aspire to better protection in a context of equity and transparency, and so that sufficiently number of people are trained and motivated to work in this sector. We have got to do more to get these vaccines out to where we need them, and most especially that they may finally be shot in the arms of the people who need them. In my country, certainly. Now is when. We have got to plan for the next trouble around the corner. Thank you.
I'd like to thank Haiti for the intervention. And as we see no additional member states requesting the floor, we will entertain requests from non-state actors in official relations with the organization to speak on this agenda item. Then I recognize the United States Pharmacopeia.
Thank you for the opportunity to share our comments at the 59th Directing Council of the Pan American Health Organization. The United States Pharmacopeal Convention is a nonprofit organization that sets standards for the identity, strength, quality, and purity of medicines, food ingredients, and dietary supplements. Ensuring strong global supply chains is critical to COVID-19 responses and to addressing future global crises. USP is committed to working with global stakeholders on concerted and coordinated responses. Patients depend on quality assured medicines and their ingredients sourced from manufacturers operating in compliance with internationally recognized quality standards. Acute disruptions, such as the disruption caused by the COVID-19 pandemic, expose and exacerbate vulnerabilities in the supply chain that can lead to patients' harm. Therefore, USP supports the global community's efforts to strengthen the supply chain resilience, including the use of pharmacopeal standards to ensure the continuous supply of quality assured medicines. USP calls on regional and global stakeholders to increase transparency, including expanding requirements for industry and healthcare providers to report on existing or potential shortage indicators, bolster quality assurance through training of regulatory and medicines quality control laboratory personnel, and supporting industry compliance with international standards, including good manufacturing practices. Call on governments and stakeholders to strengthen regulatory systems by adopting guidelines for emergency use authorization, reviewing new applications more efficiently, implementing risk-based post-market surveillance, and expanding patient safety surveillance. Expand local production capabilities, including exploring last-mile manufacturing of COVID-19 vaccines to foster more resilient and equitable supply chains and promote health security, and to enhance regional and global cooperation through increased information sharing, recognition, and reliance agreements among pharmacopoeias and regulators to accelerate access to medicines and vaccines and disincentivize substandard and falsified medicines. USP is committed to supporting the public health response to COVID-19, including efforts to build more resilient global medicine supply chains and strengthen the supply of trusted, quality assured COVID-19 vaccines, treatments, and preventatives. Thank you.
Thank you very much for the intervention. And now, Mr. President, seeing no additional requests for the floor, we turn to you.
Thank you very much. We are running behind schedule, and it's now 2 minutes after 5. We do have another session that's coming up at 5:30, informal as it may be, very, very important to conclude on a resolution that needs to be discussed. And so we're going to try and complete the agenda, but I'm going to ask both the Dr. Barbosa and Dr. Ugarte to be brief, pointed on the important issues that they would like to comment on, and then we will try to see how we can conclude. Thank you very much. We'll begin with Dr. Barbosa.
Thank you, Mr. President. I just want to first to thank all the countries for sharing their experiences, the challenges, the way that they are facing the pandemic. I do believe that every country is doing the best effort. The pandemic is not only a public health problem, but also hit very hard the economy and the social the social situation in the countries. I think that of course that it's very important to review the lessons learned. I think that the health system needs to be better after this pandemic. We needed to respond to the many weakness gaps that were identified and highlighted during the pandemic. Quero também agradecer a Estados Unidos, a
I would also
Canadá,
like to thank the US and
por
Canada
las donaciones que
for the
hicieron
donations that they made during this period of vaccination, which was very important, not just the vaccines, but resources to support the most vulnerable populations in the region, and also many countries in the region did show solidarity through bilateral cooperation, and that was a great show of solidarity among countries. Now, the issue of Brazil and Argentina and Cuba, who spoke about the development of vaccines happening there, PAHO is in direct contact with those countries to offer technical support in the development processes for them to perfect their system and to put them in touch with the WHO pre-qualification team to carry out this effort by these countries. Now, with Colombia, we are working on a request by member states on the issue of digital certification of vaccines, just as Colombia said, not to erect a barrier, but for there to be a record that can help all countries to have access to the vaccine record of people. And that, on that, we are working on a proposal to first understand the efforts that countries in the region have already made to see if we can come up with a region-wide vaccine certificate. Thank you very much, Mr. President.
Dr. Ugarte.
Thank you, Mr. President. Quisiera mencionar que en
I would
este
like to mention that in this whole process of responding to COVID-19, this has been a joint effort in which we pull together, but there are still some challenges we have yet to overcome. We still need to strengthen the stewardship, governance, leadership of responses to this type of emergency. We need to bolster epidemiological surveillance and to share information on time, not just to protect our populations within countries, but to protect other countries as well, to strengthen healthcare systems and the networks of services so that we can keep health services and also provide critical services. There has to be, this has to be done to strengthen our response. We are in the midst of this, but resources are ever more scarce for us to continue offering the support that countries need. We continue making an effort to galvanize, mobilize resources, but as you know, and we have seen in this discussion on the program budget, responding to emergencies such as COVID-19 call for extraordinary resources, voluntary resources, and we do express much thanks for the solidarity shown by Canada and the US and other countries of other regions who have been cooperating with our organization, as well as the solidarity shown among countries. We have to continue with these efforts, those that have shown to be effective, to ensure that the vaccine reaches the largest portion of the population as possible. Thank you.
Thank you very much, gentlemen, for your excellent presentations and for your follow-up comments, and thanks to those who have participated so far. I'm going to invite now Madam Director, Dr. Etienne, for any comments that she would want to give.
Thank you, Minister. And I'm going to be very brief. A lot has been said about COVID-19 and about our response, about our needs and the lessons that we've learned. Really, we are in a fight of our life against SARS-CoV-2, and I am not sure who is winning at this stage, but we need to make sure that we win, and we need to make sure that we get out of it. And one of the things that has impressed me significantly is I don't think ever before we've had such an extended interest at the highest level of government in a health issue. I know it's not because of health itself, but it's because to continue the development, economic development, for the benefits of the economy, they have to focus on health. And so we need to take advantage of that, those of us who are in the health sector. I think that's very important. It is clear that we need greater access to many of the inputs, vaccines, tools, testing material, diagnostics, all of this. So that is clear, and you've heard what we are doing to advance this. I think going forward, it is absolutely important that we address vaccine hesitancy, not merely using social media. We need to engage communities in that fight. We need, and what I want to stress, although we need all of those things, although we are increasing the vaccination coverage, and let me congratulate member states who with vaccines are increasing their vaccination coverage steadily. We need to make sure that we stress with our country, citizens and community, the need to continue the public health measures. I think people are getting lost in the idea, we need vaccines. Yes, but the public health measures have proven to be effective thus far, and they must be continued even when you have vaccines, until we have won the fight against SARS-CoV-2. So that's going to be very, very important. I want to, as the director of the Secretariat, I want to thank all of those countries who really have supported us. Some of our own countries like US, United States of America and Canada, but for the many other donors and partners who have supported the efforts of PAHO. Remember, in 2020, we were having a financial crisis, but the resources that we were able to receive helped us to be able to deliver a level of technical cooperation that our member states required. Going into 21, 22, those resources are a little less, so we continue to look to mobilize resources. And finally, to say, we will not get out of the pandemic without solidarity. And so I want to make a special plea to the countries of Latin America and the Caribbean, supported by US and Canada, that the countries of this region need to build on their solidarity and support for each other. The vaccine summit this afternoon, this morning into early afternoon, it really showcased what is required, and very importantly, the commitment of the United States of America to work with the entire universe to ensure that we do get there soonest. So we look forward to 2021, when hopefully we will be able to vaccinate 70% of all peoples in all countries, and thus begin the recovery process. Thank you very much, Mr. President. Thank you, member states, for your efforts. Over, please.
Thank you. Thank you very much, Madam Director, for your usual valuable contribution. I want to thank the presenters on this subject, the delegates who have contributed, and I think there is a lot of information there to digest, to learn from, and to use as a basis for planning. We have now come to the end of today's events, formal events. Please remember the 5:30 informal event that will take place about 17 minutes from now. Just to indicate that tomorrow we will start with considering proposed resolutions that are pending. And of course, the discussions at 5:30 will seek to conclude on this. And hopefully, therefore, tomorrow we can finish and get those resolutions approved. Following that, we will have items 8.2, 8.3, and 8.4 after the break. And if time permits, we will also try to do 8.5. So that's the tentative plan for tomorrow. Please enjoy the rest of your evening, and looking forward to a healthy conversation in the informal session in order for us to reach agreement. Thank you very much, and have a good evening.